Sound check, sound testing, sound check, mic testing, 1, 2. Uy, na-press ko. Na-press ako ng kaiba. Diba? Sound check, sound testing, sound check. Sound check, sound testing, 1, 2, 3. Mic testing, 1. Okay, sound check. Yes po ma'am, yes ma'am. Wait, ako nga, testing ko po muna. Okay, the background check. Sound check, sound. Ulit.
Sige, join ka ulit.
Okay. So sound check. Ay, ako yung host eh. Lipat ko muna ito. Ako yung host eh. Ilipat mo itong host sa kabila. Host sound check. Sound check, sound check, sound check. Make a host. Okay. Sound check, sound check. Meron na ba guys? Yes or no? Meron na ba? Okay na? Okay, so ayan po guys. Kasi set up lang po guys. Thank you. Ayan po. Clear pa ba yung ating audio guys? Yes or no? Clear? Okay, so good. Okay, so ayan po. Thank you guys. Again, thank you. Ayan po, clear na po tayo. Okay, so wait. Ako na lang yung hindi lumabas. Okay. Ako na hindi lumabas. Okay, wait lang guys. Ayan. Okay na. Okay, so guys, okay na ba? Clear? Okay, so good. Salamat guys. Okay, thank you very much. Okay, so guys, good afternoon guys. Versus guys, pakisabi lang guys kung hindi maganda yung ating audio ha. Kasi guys, again, class, inaayos ko po yung ating connection again for this internet. Okay, so ayan, clear. Okay, okay, so syempre guys, again, ako nag-swimming ulit. Ako'y umahon lang guys para mag-lecture sa inyo. Okay, guys, again, good again, all throughout guys. And guys, good afternoon sa lahat. Sa mga student po natin guys, again, syempre sa team abroad po natin, andyan po guys, good evening, okay, pleasant morning po again. Sa team live po natin na nakisabay po ngayon, araw, guys, alam ko may birthday pala kahapon. Birthday kahapon, tama ba? May birthday kahapon. Kasi okay, so guys, versus class, okay class, good afternoon po sa lahat. Thank you po again, ma'am. Again, sa Ma'am Joy Sebastian. Again, thank you po again, class. Thank you. Thanks for dropping by po nandito. Okay, guys, shout out po natin mga students po natin kay Ma'am Joy Sebastian, guys, nurses. Ang aga ng bungad natin. Class, again, tingnan dito ngayon. Class nurses, may bagong pumasa tayo ng last June 19. So, shout out kay Ma'am Joy, again, Sebastian. Again, class, bagong class USRNs natin, guys, nurses. Okay? So guys, location ko po. Okay, class again, thank you po again, Ma'am Joy, thanks for dropping by. Okay, so guys, ayan, dinala naman kayo ng mabagong passers po natin again for this NCLEX. Congrats po, ma'am. Okay sa inyo po. Sa team live po natin, guys, shout out po sa team live po natin nandiyan ngayon. Okay, so kay Sir JB, good afternoon po again kay Ma'am Amelia, good afternoon po again, pleasant afternoon kay Ma'am Jelly Ann. Okay, so of course kay Ma'am Jet. Okay, last kay Ma'am Katrina, good afternoon po again, Ma'am Kat, good afternoon. Okay, so yan po. Okay, Ma'am Janet, good afternoon po. And of course kay Sir Nel, okay, kay Sir Nel, of course kay Ma'am Rio. Okay, kay Sir, kay Ma'am Marl, again, Ma'am Jen, and all throughout kay Sir Sis, nakita ko sa hindi class, pleasant afternoon class again sa lahat po na andito. Okay? So guys, again, nurses class, for today's lecture, guys, again, class nurses, ang ganda ng bungad kasi pag may bungad na bagong pumunta sa nurses class, sunod-sunod na po yan. Tama? Nurses, maniwala ka, uulan ng bagong lisensya for this 2023. Tama ba? Okay, so good. Okay, so guys, nurses, okay, so as far as possible, guys, nurses class, yan sa mag-exam for this again, July, for this August nurses class, konting review lang po ng concepts natin. Class, tingnan ngayon, during the exam nurses, this one of the anticipate, kasi guys, alam kong pag mag-exam ka this July, in this August nurses, we expect na magkita tayo class again. After this one, kayo na po ang bagong class again bibisita para class again tingnan, class again, para class again makita po natin kayo mabagong passers again for this again August and July. And of course guys, sa mga malapit-lapit po nag-exam ha. Okay guys, again class, always nurses, maniwala ka nurses, papasa ka. Okay, for this again 2023. Okay, so guys, again nurses class, for today's lecture, guys, nurses, tapusin ko po yung concept natin about last time with regards again to your class class electrolytes. After this one, guys, nurses, we're going to start class concept already. With regards again to your class nurses concept now with regards to cardiovascular disorders. Okay? So guys, pagka-class, bago magsimula guys, let me see muna sa aking whiteboard the screen kasi since bago po ang ating kabilang screen. Let me see guys kung naglalag. Ang laki pa lang screen ko. Pag sabi guys sa akin kung naglalag po ito ha. Okay guys, kasi ito yung bago ko po na, ano, okay, so wait na po. Okay, so yeah, please. Let me see guys, kung naglalag po tayo guys muna. Testing ko lang po ito. Okay, sa lahat po na andyan. Sa team live po natin guys, okay, class, ganyan yan. Okay, so yun pa. Okay. Natin muna ha. Okay, class. Okay, so yun guys, sige tingnan guys. Sources nakita na ba? Yes. Okay, good. Klaro ba sa lahat? Okay, class ngayon nagbabasa ka lang nurses. Kung nabasa mo to nurses, guys, susunod ka na. Tama ba? Okay, good. Okay, so guys, clear? Okay, so clear pa yung ating class, ang ating whiteboard. Okay? So yun guys, nurses class gantingan. For today's lecture nurses, guys, sige tingnan, tapusin yung concept ko na class with regards again to your fluids. After this one class nurses, when you start class concept already, with regards to your cardiovascular again disorders. Nurses class, USRS, INAP, this is 2023. Ang tanong syempre, nurses guys, handa ka na bang pumasa? Yes or no? Yes, let's do this again. Recall nurses. Balikan natin muna lahat ng nalaman class kahapon, concept na with regards again to your class again dito, electrolytes. At this one class nurses, again class with the continue class remaining concept again for your electrolytes. Guys sa mga bagong student po natin guys, don't worry. Pwede naman sa una, wag ma-stress. Andiyan na po yung class, ulit ko sa ikalawa, sa ikatlo, at sa ikapat. Okay, therefore class yun, last step here, balikan natin muna class, concept kahapon class with regards to your electrolytes. Guys, again, pagalingan tayo. Number one, class again, most abundant intracellular. Intracellular kasi within the cell, kasi inside the cell, most abundant intracellular. Sino yun? Answer is, very good is potassium. Very good class intravascular. Most abundant sa blood vessels. Sino yun? Answer, very good sodium. Good. Again, nurses, gumagaling ka na. Most abundant kasi in the bone. Most abundant in the bone. Sino yun? Answer good is, very good, you have your good answer is calcium. You have your calcium. Very good. Interstitial, in between the cells. Pag in between, sino yun? Answer is, you have your, very good answer is, you have your calcium. You have your calcium. Tama ba? Okay, good. Therefore, nurses class, let's correct your concept again. Balikan. Now, in a case kin sinabi ko kahapon, nurses, the pumping of sodium, potassium class, it causes muscle contraction. Ang ibig ko sabihin guys kahapon, therefore, nurses, kapag tumas ang calcium, what will happen to your contraction? Tumas ang calcium contraction, increase or decrease? Ang sagot is, very good, ang sagot is decrease. Kasi mayroong guard. Kapag decrease contraction, decrease again calcium, class increase in muscle contraction. Tama ba? Okay, increase in muscle contraction. Therefore, here we go. Now, Kahapon class, we have start class concept with regards to potassium. Tanda na kasi ikukunin ko po ito. Potassium class, last okay class again, arrhythmias plus your manifestations. Again, arrhythmias plus your manifestation. Hyperkalemia, hypokalemia. Walang sumagot ng hyporkalemia. So, ang hyporkalemia nurses na ko class, sabi ko na ko class nurses sa hyper in hypo lamang. Nurses class, here we go, recall. Guys, again, type in your answer. Pabilisan tayo. Number 1. Una class again, class, what causes tachycardia? Hypokalemia, tachycardia. As what's in yun? With hyperkalemia, very goodness affects your lower extremities. Lower extremities, in yun? Hypokalemia, very good hyperactivity of the heart and brain. Hyperactivity of the heart and brain. Sino yun? With hyperkalemia kasi hyperkalemia, good nurses, gumagaling ka na. Abdominal cramping. Pag abdominal cramping, what is abdominal cramping? Ang sagot, sino yun? Answer? Hyperkalemia, good nurses, guys, abdominal distension. Abdominal distension. Sino yun? Ang sagot is hypokalemia. Very good nurses, stomach flu or GI flu. Stomach flu, gastric flu or GI flu. Sino yun? Class, ang sagot is hyperkalemia. Very good nurses, class, balikan. Pag sinabi sa exam, paralytic ileus. Pag paralytic ileus, ang sagot is answer, hypokalemia. Very good nurses, weakness, muscle weakness. Ano yun? Hypo, class, because fatigue. Hypo, very good, class, apathy. Ano yun? Hypo, let's correct. Balikan. Class, flatten T-wave, flatten T-wave, flatten T-wave. Sino yun? Hypokalemia, taller peak T-wave. Tall, sino yun? Hyperkalemia, very good, ST, elevation. ST, elevation. Sino yun? Hyperkalemia, very good, ST depression. ST depression. Sino yun? Hypokalemia, good nurses case. Galingan natin. Recall, nurses class, widening of your QRS. Widening of your QRS. Sino yun? Good hyperkalemia, very good, narrowing. Pag narrowing, sino yun? Good hypokalemia, good nurses class again, presence of U-wave. Presence of U-wave. Sino yun? Ang sagot is good hypokalemia. Very good. Nurses class, again, kapon we have done class concept already when regards again to your potassium. Therefore, last month is that already class with regard to the hyper, you have your hypokalemia. Guys, wait lang sa guys, sasaksak ko lang po yung ating tablet, guys, para po again all throughout. Hindi po siya kaskin biglang mag-shutdown later on. Okay, here we go. Wait lang po Okay, sasaksak po natin muna. Okay, kasi baka mapubo sa kanyang chakra. Tama? Hindi makaabot kasi. Okay, here we go. Class, wait lang po. Okay, saksak po muna. Okay, saglit lang guys ha. Kasi baka may matouch po tayo dito. Ma-shutdown bigla. Wait lang po. Saksak po muna. Ayan. So, ayan. Okay, so good. Ayan. Let's discuss again the full last. Okay, class, already class concept already. Class application, class the exam. Last of class, here we go. You have now in the case again manifestation again or the management for the hyper and hypokalemia. Okay, therefore class, here we go class, nurses. Ito kayo. Now, class, kapag siyang potassium guys, nurses, let's correct your concept. Sa kabila dito ngayon, unahin ko class in the case of the hypokalemia. Okay, guys, nurses, this is your hypo and hypokalemia. This is your hypo, class and hypokalemia. What is your management class? Kapag nagkataon na kulangan ka ng potassium, this is your hypokalemia. Para ko yan, hindi bago guys sa aking sinusulatan. Ayan pala. Malaki na aking screen. Okay, this is your hypo and hypokalemia. Therefore, here we go. Ngayon, now class. Kapag siya gin hypokalemia, therefore, nasa siyempre kulang ka ng potassium, kulang ka ng potassium. Kaya rule palagi guys, sources, pag kulang talaga, siyempre, pag sobra, bawasan gas. This is in the case of the hypokalemia. Una, ngayon, guys, tingin sa board. Here we go. What is the diet for a patient with your hypos and hypokalemia? What's the diet? Kasi number 1, una, you have your diet again, siyempre, diet again, includes in high or low in potassium. High or low in potassium. Answer. Ano siya? Answer? Very encouraged again, it must be high in potassium. That includes high in potassium, guys. Includes because that is your high in potassium. So wait lang guys, includes these are the foods again, includes those are the high in potassium again. Diet. Tama ba? High in potassium. Tama ba? Okay, here we go class. There's again. Now, class. In a case in pashay food again, high again in your potassium. Therefore, nurses class yan. What are the food again? High again in your potassium class. Then high in potassium includes. And pagka-includes, those are the one inclusive of your A, B, C, kasi inclusive of your A, kasi A, B, C, kasi inclusive of A, B, C, kasi inclusive A, B, C. Diba? Okay, A, B, C kasi nga ngayon, class, these are the foods again, high again in your potassium. Diba? Okay, therefore, here we go. Class number 1, una. Now, A, B, C kasi foods again, high in potassium, kasi high in potassium. Therefore, kasi recalling yan, sino ang mapagkain guys, sources, includes again recall high again in your potassium. Therefore, last of the A. A stands for A. Ang paborito A. Right, A stands for A. Apple. A stands for A. Apple. Ang paborito ng A of your A. Apple. I have your A. Apple. I get an apple. I get a pen. Apple pen. Kung again, you have your A. Apple. I have your A. Apple. Tama? Okay, good. Again, number 2. Na una. Kapag marang apple again, number 2. Guys, here's orange. Number 2. Kapag A, no kang A. Yabang A. Avocado. Yes, A stands for A. avocado. Kasi it includes A, yes, that's for A, avocado. Kasi also kas avocado, ha? Okay. A, kasi A stands for apple. Number 2 includes also ano yan? A of your avocado, avocado. Guys, isama mo na pag sa isang you will see kasi apricot are also high in potassium. Kasi apricot also kasi high in potassium, ha? Okay, high in. Sound check, sound guys. Could you hear me po? Narinig ba ako? Yes or no? Narinig ako? Yes. Could you hear me po? Narinig ako? Yes or no? Okay na po? Ayan na. Narinig na? Okay, good. Okay, the focus. Ayan. Okay, nakamute ako ha. Okay, tingnan na. Okay, so guys, nakamute ako. Sino po ang nag-mute sa akin ha? Sino ang nag-mute sa akin? Okay, class, ganyan. Class again, B. The B stands for B stands for B. Anong B? And again, A, B. And B stands for B. Anong A? Banana. B, babana. Ang sagot ano yun? B stands for B of your banana. Yes, B stands for your banana. Class again, banana. Ang pabortong class banana, ang saba ni Dilema. Junel, na your banana ha. Ang paborito mong gawin sa gabi, ano yun yan? Banana split. Tama ba? Banana. Have your banana split. Tama ba? Okay, therefore, B stands for B. Banana. Tama ba? Okay, therefore, class, here we go. Class, sige, tingnan. Now, ibig sabihin ng C stands for C stands for C. Very good. Nurses class, C stands for C. Citrus. Sige, stands for C. Citrus plus, ha? C stands for your C. Refers to your citrus. Sige, citrus fruits. Tama? Okay, here we go. C stands for your citrus fruits. Sige, citrus fruits. Tama? Okay, good. Therefore, kasi to recall now, pag citrus, second plus citrus, this is your citrus fruits. Because C stands for C, citrus, again, your citrus fruits. Therefore, kasi recall, sino bang citrus nurses? Now, pag citrus ang kasi therefore includes, therefore, yan bagay ang kalamansi, yes, ano? Yes. Poncan, yes. Orange, yes. Lemon, yes. Very good. Kasi you have your citrus. Your citrus. Lahat ng maasim, maliban sa kilikili, are high in potassium. High in potassium. Kasi boyfriend ko, sir, no, kasi maasim na ko, sir. Okay lang po yan, ha? Class high in potassium, ha? Maliban sa kilikili, are high in potassium. Citrus fruits, ha? Lahat ng maasim. Lagi ng maasim. Diba? Okay, guys. Citrus class, again, citrus, again, plus, again, class. Dito into C. Very good clusters. Ano pa C class? C stands for C of your class. You have your cantaloupe. You have your cantaloupe. You have your cantaloupe. Tama, you have your cantaloupe. Tama, okay. C also have your cantaloupe. Tama, okay. Also inclusive your cantaloupe. Tama, okay. This short cantaloupe. Very good. Kasi balikan natin, guys. Naku, nagiging brown. Wait lang, guys. Ano ba yung nakita pa natin yan? Okay. C stands for your cantaloupe. You have your cantaloupe. Tama, okay. Cantaloupe. Tama, okay, therefore stands for C stands for C, you have cantaloupe. Kasi tabang spelling natin dyan, guys, baka may maliit yung spelling po dyan, guys, sabi po, C stands for inclusive, again, also, guys, says, class, ay mali po spelling natin, class stands for that, class again, stands again for your cantaloupe. Now, your cantaloupe, therefore, your C stands for your cantaloupe. Tama, okay, therefore, cantaloupe. Ano spelling cantaloupe? Naku, ayan na naman tayo. Spelling na naman ha. Sabi, tama pa spelling natin. Yes, sir. Pambira to. Tama spelling. Stands for cantaloupe. Tama spelling natin. Naku, nakalimutan spelling. Guys, panagkamali guys. Tama ba? Okay guys, panagkamali. Okay lang po guys, yourselves. Anong lumalabas again sa text exam? There says multiple choice. Ha? Okay, kasi lusot. Ano sige na cancel. And of course, there's this guys, isang ka sa portal KKK, kasi K, says ka, carrots. If K stands for K, you have your carrots. Can class your carrots. Your carrots also has a high also has in your potassium. Okay, high in potassium. Therefore, kasi your potassium. Diba? Okay, therefore, kasi recall. Balikan natin kasi yun na. Okay, kasi includes. Ano yan? Una, includes, again, recalling again, apple. Again, kasi again, avocado, kasi apricot. Ang B, banana. Citrus plus, kapag in the case, also cantaloupe plus includes also you have your carrots. Your carrots. Tama? Okay, includes also you have your carrots. Tama? Okay, good. Therefore, kasi we go. Nothing else. Oh, now, in the case in the forecast recall, kasi these are the foods high in potassium. Guys, anong tandaan po natin, guys, itong tandaan? Again, recall. Now, kapag sinabi kasi na high in potassium, kapag nakalimutan mo, class, almost class ang mga pagkain natin, guys, again, class, mga prutas. Pag prutas sa pag-usapan, lahat ng prutas kapag in-slice mo ng itim, high in potassium yan. Pag nangitim, high in potassium. Guys, versus class nga, ang apple, pag na-slice mo, nangitim pa si apple, yes, ano? Yes. Is that high in potassium? Good. Tama? Okay. Kasi avocado, nangitim ba? Yes, also high in potassium. Same as your apricot, kas banana. Nangitim ba ang saging? Yes, ano? Yes. Yung saging na hinog, slice mo siya, hayaan mo sa salamesa, nangitim yan. High in potassium. Tama? Okay, high in potassium. Kaya sabi ko, fruits, those are high in potassium. Tama? Okay, therefore sabi ko, prutas ng itim, high in potassium. Good. So, kasi sir, ang kilikili, hindi siya prutas. Tanda na? Okay, kasi hindi po siya prutas yan. Okay, kasi yan. Oh. Nurses class nga ngayon, okay, nangitim. Sir, yung patatas, nangitim din. Sabi ko, prutas. Ang patatas, nurses, hindi pa po lumipat sa prutas. Ha? Tandaan, huwag i-adjust ang patatas sa prutas. Sabi ko, prutas na nangitim, high in potassium. Tama? Okay, now, nurses guys, pag sa exam, ha? Okay, class ganyan. You have your foods again high in potassium. Therefore, kasi tandaan pa ito ngayon. Again, recall. Now, kapag in the case again, therefore, kasi again, foods high in potassium, includes, again, recall, almost na pagkain basta above the ground. Again, above the ground, high in potassium yan. Pag below the ground, prutas again, basta binubungkal, most of them are high in sodium. High in sodium. Pag prutas above the ground, high in potassium. Kapag in the case below the ground, kasi high in sodium, high in sodium. O ang tanong kasi again, nakita mo, class, ang apple, avocado, banana, class again, siya ba above the ground? Yes. Kaya ano bang apple, avocado, class? High in potassium, high in sodium, high in potassium. High in potassium. Tama ba? Pag nahulog yung saging, high in sodium na, hindi. Kasi potassium pa rin yun, ha? Okay, kasi nahulog. So, high in potassium pa rin yun. That's ano po, sige, high in potassium yan. Again, high in potassium. Tama? Okay, good. Therefore, class kita above the ground. Guys, may isa pa pala guys, ilabas sa EdClex yung tandaan. Guys, sila ba sa exam class po sa potassium includes ito lang guys. Ito guys, kiwi. Kiwi class also high in potassium. Again, high in potassium. The kiwi is also class high in potassium. This is ilabas sa exam nyo. Food, again, contains high in potassium class. Class kiwi is a one of the class high in and in potassium. Tama? Okay, now. Previous exam question, wala dang apple, walang avocado, walang banana, walang citrus nurses. Class 1 of the exam question labas on which food choices are high in potassium should you avoid for the person with renal failure? Bawal ang sagot sa exam class raisins. Raisins are high in potassium. Di ba, have you seen? Ano bang raisins nurses? Saan ba nanggaling ang raisins? Saan nanggaling ang raisins? Saan nanggaling? Ang raisins, saan nanggaling raisins? Saan nanggaling ang raisins? Saan nanggaling? Saan nanggaling? Guys, saan? Nurses, nalin lang po. Ang raisins, nurses, saan nanggaling kasi ang raisins? Saan? Ang raisins, nurses, guys, actually guys, dito siya talaga nanggaling. Dito po nanggaling din ang raisins. Saan? Dito po yan nanggaling, ha? Ang raisins, guys, dito po yan nanggagaling din ang raisins. Saan? Saan? Nasa saan? Sa kambing talaga, sa kambing. Tama? Bobati, ha? sa kambing. Okay, class, hindi. Again, class, again. Saan ang galing to? Nurses, very good. Nurses, saan? Sa grapes, tama? O grapes are high in potassium. Tapos, pa-extra pearl ka pa sa kambing pal nang galing, ha? Kasi high in potassium, tama? Nagaling sa grapes. O, ang grapes ba, guys, pinipitas, binubungkal. O diba, di ba class, nagbubungkal ako ng grapes, ayusin mo ha, tapos pinipitas mo yun, those are the food high in potassium. Kapag choices, basta fruits out of the ground, those are high in potassium. Now, high in potassium. Tama? Okay, here we go. Now, dito ngayon. Unang kas foods high in potassium. Therefore, kas number 2, syempre may gamot ka. Ano po drug of choice, guys? Drug of choice. In the case, kapag may hypo, kalimutan ang gamot kay sources, tingnan. Dalawa po yan. Una class is given oral. Given oral. That's given oral. Ha? Given oral. Tama? Okay, oral class. Ibig sabihin guys, sinusubo. Sana all may sinusubo. Tama? Yung given oral. Siyempre, given IV. Given IV. Ha? IV guys, IV. Intravaginal. Intravenous pala guys. Intravenous. May potassium intravaginal. Intravenous. Tama? Okay, here we go. Now, class. Kapag siya oral, therefore, alam mo to guys, kung nag-duty ka sa hospital, yung kulay orange na tablet. Good. Ano po yung tawag doon? Kalium durul. Di ba? Kalium durul. Now, ang kalium durul are potassium tablets. Mga tableta na potassium yun. Ang pasyente na may hypokalemia, may ganito dapat sa bahay. Tama? Sa bag mo, may kalium durul ka. O sabi, kalium durul. Now, the kalium durul are the potassium tablets. These are the your potassium kasi potassium tablets, your kalium kasi kalium durul guys, kalium durul. Those are the potassium tablets and potassium tablets. For the kalium durul is the potassium again tablets. Tama ba? Okay, therefore as kulay orange yan, this kalium durul. Tama ba? Okay, good. Pag IV, sinong IV? Pag IV guys, pag IV sino yun? Okay guys ha. IV very good class KCl. KCl ha. KCl. Plus KCl, therefore as again KCl. Tama ba? Okay, here we go class ganyan. What is KCl? Anong KCl guys? Kesa para potassium chloride. Potassium plus potassium chloride. Tama? Anong rule? Never give potassium IV push. Tanda na? Never give. Wag na wag mo tong ibigay, nurses. Never give. Never give. Never administer. Never give again of your potassium. Potassium kasi IV push. Never give your potassium kasi must be again IV kasi IV push. Huwag mo itong ibigay kasi never give potassium IV push. Tama? Okay, therefore kasi sir, bakit bawal? Kasi binigay mo to para ikaw na po nag-lethal injection sa kanya. Tama po yun. Kasi therefore kasi nagkataon, ni-lethal injection ka. Tama? Okay, here we go na. As gina, ni-lethal injection ka therefore nurses. Unang ginagawa sa lethal injection guys versus una pa sa ganito ngayon sinisedate ka. Once sedated ka, oh grabe Lord, glass konti-konti na lang ito bro. Konti, magkikita na po tayo. After nun kasi gina ka medyo drogy ka ng class nurses, yung tipong parang lumulutang ka na, parang sa cloud na again, saka ka nag-inject ng potassium. Nang in-inject yung potassium class again dito, bigla ka na ko ng arrhythmia, that's the reason kasi nagkaroon ka ng cardiac arrest. So, ng cardiac arrest. Kaya therefore kasi tandaan, wag na wag mo tong ibigay IV push. Sige, IV push ha. Wag na wag mo tong ibigay guys, IV push. Tama ba? Okay, therefore class, again, here we go. Paano ibigay guys? Again, class, paano ibigay? Never give potassium push. Paano ibigay class? It must be administered, it must be incorporate. Pwede mo siyang ihalo. Sabi nga class, it must be incorporate. Incorporate guys, incorporate. Okay, incorporate. Pwede mo siyang ihalo kasi incorporate kasi with your IV. It must be incorporated with your IV. Or your IV kasi yung IV, incorporate the IV kasi ibig sabihin, yung IV mo minsan may nakalagay na plus with IV of D5LRS, di ba, plus minsan 20 MEQ KCl. Ganun yun, 20 MEQ KCl. Ibig sabihin, nagdagdag ka ng potassium kasi nagdagdag ka ng potassium. Incorporate with IV kasi or syempre via Soluset or via Soluset. Via Soluset. Ibig sabihin, via Soluset. Incorporate again or via Soluset. Tama? Okay, kasi tandaan, wag na wag mo itong ibigay IV push. It was given via incorporate again in the IV or via using your Soluset. Using your Soluset. Kasi guys, sources, be careful guys. Sige, tingnan. Baka kasi pag sa US ka na kung nakalimutan mo tandaan guys, sources, ang lagayan kasi guys ng potassium chloride, parang distilled water for injection yan. Ang distilled water, kulay blue po yung label nun. Kulang blue may label, tama? Okay, may label yan, tama? Kulay blue po may label. Ang potassium is kulay orange, tama? Ngayon, nagkuha ka ng distilled water, tinabi mo yung potassium, akala mo distilled water, pinalo mo sa antibiotic sa pasyente. Yun pala kasi potassium ito. Ngayon, kasi sabi nga pumunta ka sa pasyente, ginagano mo yung klase yung vial. Hi ma'am, good morning. Sabi ito ka bukas lalabas ka na. Opo, yung last dose mo ng antibiotic ito, bukas i-shift ka na sa tablet kasi uwi ka na, tama? Yes. Again nga na ngayon, habang pabigay mo kasi ma'am, kasi last na po ito, mabuti ito yung IV mo. Okay, last na po ito. Naku, kasi syempre binigay mo na, kaniti ka pa nun, tama? Yes. Nang binigay mo sa kanya, nurses kasi hindi abot ng isang oras yan, tama? Yung pasyente, nakalabas ng hospital, tama yun, nakabalot na. Ikaw ang dahilan, hayop ka, pinatay mo ang pasyente. Tama? Tingnan. Nurses, class tingnan. Wag na wag ibigay ito IV push. Tama? Yes or no? Yes. Pero kay X pwede. Tama? Sa pasyente, bawal. Tama? Okay, tandaan yan ha. Okay, therefore kasi kay X pwede ha. Sa pasyente, bawal. Tama? Okay, therefore kasi again, kay number 3 pwede. Pero sa pasyente, bawal. Kaya sabi ko pa sa Pilipinas, itong masakla sa Pilipinas, di ba? Siyempre kasi nakamotor, may rosaryo. Tama? Nakaangkas, kabit. Pwedeng bigyan lagi ng potassium chloride. Okay, here we go. Tandaan guys, wag na wag itong ibigay. Tama? Okay, kasi bayak IV push. Tama? Okay, good. Balikan. Class, foods again includes high again in potassium. Plus avocado, kasi in apple, apricot. Again, kasi last time nakalagay kiwi. Previous exam question, nurses nakalagay din nun is also your last of your races. Tama ba? Okay, that means ito ang dapat mong ibigay kapag nakulangan ka ng potassium. In the case of the hypokalemia. This is the hypokalemia. Kulang ka ng potassium. Tama ba? Okay, therefore, here we go. Lasokinocystosis, ano naman class ang management when the patient develops hyperkalemia. Dapat tas unang hypo, lasokinocystosis na already guys, team live po natin, makisabay na rin, already guys, concept na with your hyperkalemia. Guys, versus USRS guys, INAP, can I clear the screen? Okay na ba guys, tanggalin ko ito muna, yes or no nurses? Can I clear the screen? Okay ba sa lahat? Yes or no? Good. Okay na focus. Lots of class, here we go ngayon class in concept ready. When it comes to the hyperkalemia guys. Therefore, let us clear in 3, 2, okay, 1. Okay, this is now, ang nakita the hyper. And next hyperkalemia. For these are the food class kanina, management class kapag tumaas ang iyong potassium. Example, nagka-renal failure ka, tumaas ang potassium. In the case of burns also, kas tumataas din ang potassium. Tama ba? Okay, good. Therefore, class, so here we go. Kapag hyperkalemia. Kasi ang rule palagi, ang kulang talagang kasi pag sobra, ay ganito, bawasan. Tama ba? Okay, therefore, last talk about here, hyperkalemia. Good. There's this case, galingan natin tingnan. Here we go. Now, class. In a case pag hyperkalemia, hyperkalemia, ano rule? Anong diet natin kasi high or low in potassium? It must be given very good low in potassium kasi low in potassium low in potassium na low in potassium. Again, low in potassium. Tama? Okay, it must be low in potassium. Therefore, kasi balik ka kayo na recall kanina, pag hyperkalemia, it must be given high in potassium. Therefore, kasi recall kayo, kapag ang pasyente kasi recall din ngayon class, ang pasyente, now, kapag hypokalemia class, also given class, they are class given also low in your potassium, Therefore, these are the foods high, low in your potassium, low in your potassium diet. Tama, okay, therefore, kasi last your concept nurses, guys, here we go. Now, encourage low potassium diet. Therefore, kasi ibig sabihin, kapag ang pasyente may renal failure, pag may renal failure ka guys versus nag-shutdown ang kidney, pwede ka bigyan ng ba ng apple juice? Apple juice, pwede bang apple juice? No. High potassium kasi. Class recall, class tingnan, balikan orange juice. Bawal, tama? Class, pwede ka ba kasi mag-perform ng banana split? Nurses, bawal ang pabortamang banana split sa gabi. Bawal po yan, ha? Bawal ang saging na sa bani. Dilemma, ha? Bawal ang saging, tama? Okay, therefore, class, here we go. Class, bawal yan. Dapat low in potassium, low in your potassium. Tama? Okay, dapat. Regarding sa food, gusto kasi low in your potassium. Tama? Okay, therefore, class, number 2. Now, here we go. Una kasi low in potassium again diet. Tama? Low, sir, in your potassium. Tama? Okay, next again, recall nurses, guys. Ito na. Now, increase low in potassium again diet. Therefore, next again, look at this one. Kapag may hyperkalemia nurses, question, guys, tandaan, ito yung lumabas sa exam question mo, dapat alam mo ito kapag sinabi sa exam. Now, in the case again for nurses, what is the antidote? Antidote for the hyperkalemia. What's the antidote for the hyperkalemia? Antidote? Answer? Very good, guys. Ang sagot siya, antidote for hyperkalemia, guys. Ang isagot mo is ang sagot is answer good. Answer calcium gluconate. Plus calcium gluconate. Antidote plus you have to give your class. Ano yung bigyan siya ng calcium plus calcium gluconate. Plus calcium gluconate to give your calcium plus calcium gluconate. Tama? Okay, therefore, kasi dito ngayon, you have to give your calcium gluconate. Tama? Okay, calcium gluconate. Tama kayo class, recall now. Remember class again the effect class again of your potassium. Can I recall? Certain again. Bakit ka nagbigay again ng calcium? Bakit na nagbigay ng calcium, guys, versus? Itong tandaan. Again, now, ang calcium, does it decreases the potassium? Does calcium decreases the potassium? INAP USRNs. Does calcium decreases the potassium? Yes or no? Does it decrease the potassium? Yes or no? Ang sagot is? Okay, sagot is yes or no? Ang sagot is? Again, nurse, are you sure? Sure ba kayo dyan? Nurse, paglalaban. Hanggang kamatayan? Okay, para sa bayan? Okay, ang sagot is? No. Hindi po binabagsak ng calcium at potassium. Ha? Sir, hindi binabagsak. Isa bakit binigay? Hindi naman palakas binabagsak. Bakit binibigay? Remember guys, yours kanina, ang calcium siya bang guard? Yes or no? Yes. Kapag guard, therefore, anong rule? Kapag may hyperkalemia, mayroon kang tachycardia. Pag bibigyan kita ng calcium kasi what will happen? Class, it will decrease the heart rate. Bakit siya bang guard? Yes or no? Yes. Kaya ang goal ng calcium, it antagonizes, it counters the effect of your potassium. Ibig sabihin kasi kapag tinaas ko yan, it will decrease your heart rate. Good. Reverse the effect or sabi doon, it antagonizes Antagonize the effect of your potassium. Antagonize the effect. Antagonize what? The effect. The effect is going to be what of your potassium. It antagonize the effect what of your potassium. Antagonize the effect of what of your potassium. Ano yung sin antagonize again the effect, guys? Alas, dapat maintindihan mo ito ngayon. Now, pag pinagit kasi kay sources na antagonize again the effect, ito po yung again there's antagonize again the effect. Ibig sabihin, kapag tumaas kas ang potassium mo, ang iyong kas ng potassium, kapag gumagsak yung sipo, potassium increase or decrease what in your potassium. Tama ba? Okay, therefore here we go. Now, kapag in-a-case nangyari therefore nurses class, antagonize the effect of your potassium. Ibig sabihin, pag tumaas guys ang calcium, di ba? Happy singles what will happen nurses? The calcium plus nurses class yun siya, it decreases, again decreases muscle contraction. Decrease muscle, decrease muscle contraction. Plus, kapag tumaas ang calcium, therefore kasi kanina, it decreases muscle contraction. Thereby, pag in-decrease yung therefore it will decrease your heart rate. Thereby, it will decrease your heart rate. Tama ba? Okay, therefore kasi ngayon, it will decrease in your heart rate. Decrease in your heart rate. Antagonize the effect of potassium. Pag tinas ang calcium, decrease contraction, decrease heart rate. Ibig sabihin, kinokontra niya ang effect ng iyong potassium. It counters the effect of your potassium. It will decrease your heart rate. Tama ba? Okay, good. Therefore kasi nga na. Plus, kapag sa exam, sabi nga, kaya ang pasyente kapag may hyperkalemia, bibigyan mo ng calcium kasi it will decrease your potassium. Tama? Decrease the effect again of your potassium. Take out on the effect. Decreases the effect kasi again what of your potassium or your what of your potassium. Tama ba? Okay, decrease the effect of your potassium. Kaya ngayon, anong ibig parting guys? Yes, Alan. Sige, here we go. Now, kapag ang pasyente, just recall, yes, anong rule? Kapag ang pasyente, an example, one of them has some patient, mayroon ang renal failure. Ngayon, in a case ng pasyente, develops renal kasi mayroon ang renal failure. Ngayon, class, ang patient now is having renal failure. Kasi question the exam guys. Side notes mo lang guys, sources. Para renal failure kasi ngayon. Kasi nangyari sa kanya, blood sugar ka pinakawalan. Kasi in class, and siya ito kasi kanina, you have here, this is your renal failure. Ngayon, kapag sira ang kidneys po natin guys, sira ang kidney. Guys, you can recall, nagkataon, ang potassium level, potassium level kasi reveals. Sige, example kasi ito ngayon, 8.5. O sige, sagutin mo to. High or low? Kasi balik ka na, ano siya? High. Mataas ang iyong potassium. Ngayon, question daw of the exam again. This one of the exam question. The doctor orders that the patient should be given. Say, look, bigyan mo na siya given calcium chloride. Bakit na siya bigyan ng calcium chloride? Sir, bakit naman? Ibigay ang calcium chloride. Why you give the patient this calcium chloride? Wait lang guys ha. Okay, ayan po. Ayan. Okay, class, the patient is giving us calcium chloride. Calcium plus calcium. Calcium plus wait lang guys ha. Nurses, again, calcium gluconate. Calcium plus gluconate. Tama ba? Okay, therefore kasi nga na, class, ang tanong, bakit na siya binibigyan ng calcium gluconate? Therefore, class, choices. Like, sa mga recall yan, class A, B. A, B. Kasi una A, B. Number one kasi, number one, number two. Una, ano purpose dito kasi? Number one, A, to treat. To treat kasi to treat hyperkalemia. To treat again, hyperkalemia. Okay kasi. Number two is to treat. To treat kasi to treat your passenger, to treat your, again, to treat your arrhythmia. So you want your arrhythmia. Okay, so to treat your arrhythmia. What is the best answer guys? Sources can be, bakit na siya bibigyan ng calcium gluconate? Ano ang purpose guys? May renal failure ka, bakit ka nga binibigyan ng calcium gluconate? Ano ang purpose? Again, A, to treat hyperkalemia, B, to treat arrhythmia. Number two, to treat arrhythmia. What's the answer? Answer is, good. Ano ang ibig ko iparting guys sources? Tingnan. Ang ibig sabihin, kapag may renal failure ka, mataas ang potassium mo. Kapag mataas yan, what will happen guys ngayon? It will increase your heart rate. Increase your heart rate. Tama ba? O ngayon, na binigyan ka ng calcium, itinas mo ang calcium sa tugo. Kapag itinas siya kayo sa ng calcium sa dugo, it gets calcium plus in the blood of calcium. Ano ngayon ang renal calculate? Ano ngayon ang calculate? Ano ngayon ang renal calculate? What is the renal calculate? Okay, what is your renal calculate? Increase in calcium, increase calcium. Sorry guys, increase your calcium. Pag tumaas, ang calcium guys, sorry. Increase ang ating calcium. Wait ako, naglag po tayo. Increase again ang calcium guys, sir says, what will happen? Class, kanina, it will decrease your heart rate. Therefore, kapag mag-decrease ang heart rate, therefore, what will happen? Therefore, it treats answer. We're going to sagot is it treat your arrhythmia. Kaya rule, hindi po binabagsak ng calcium ang potassium. Tingnan, walang kapangyarihan si calcium para ibagsak si potassium. Ginagawa nito kapag may class in the case of emergency gas sources, sinasadya mo na itaas agad ang calcium para kasi refocus to decrease the heart rate, thereby to treat your arrhythmia. Kaya the purpose class again kanina, class, the purpose it antagonize the effect, class, antagonize the effect what of your class, effect what of your, good, it antagonize the effect class of what of your potassium. Tama? Okay. Therefore, class, una, first, again, antidote is severe calcium gluconate, calcium gluconate. Tama? Okay. Number 2, ano pa? Ibigay natin. Ano pa gamot? Again, number 3, nurses, bibigyan ka rin ba ng class dito, you have your, ano gamot kayo na you have your class? Lating Excel. Tama kaya your Excel. Tama class of your Excel. Tama class. Therefore, class to give your Excel. Sir, tingnan. What is Excel nurses? Ano ba Excel? Now, sino po itong Excel guys? Now, itong Excel case sources, USRN's localist 1 sa team live po natin. Ang generic ng Excel, if you notice that, is sodium polystyrene. Sodium yan. Sodium polystyrene. So, sodium polystyrene. Sodium polystyrene is what? Polystyrene is what? Sodium plus again polystyrene. Sodium polystyrene again sabi to that is your polystyrene. Sodium polystyrene again is your plus your potassium. Is your again potassium. Tama? As is your KX-late. Sodium polystyrene is your class KX-late. Now, ano ang route when you give your KX-late guys? Sige na. Okay, ang route ito kasi class ideally. Anong route ito guys? Magbibigay mo is given. Guys, sagutin that's given because ideally it is given what given is given oral. Was given is given oral. Tama? At usually guys sources, itong effect nito class na siya. It is effective. Ano siya? Effective. Effective to guys sources, use are effective. Effective kasi kailan? Effective kasi kailan siya? Kasi effective na siya kasi 4 to 6 hours. 4 to 6 hours tas per hours tas after after administration. After administration. 46 hours tas for effective 46 hours tas after administration or after giving the drug. Doon siya mag-e-effect. Tama? Okay, good. The first step is your X-rate. Now, anong gagawin kasi ng X-rate USRNs? What is the purpose of giving you X-rate? Bakit pumigay ka? Ngayon, ito kasi sabi ng X-rate. Sabi niya, kaibigan, bakit? Gusto ko may deal tayo. Bakit? Open-minded ka ba? Yes. Gusto bang yumaman? Yes. Tama? Okay, therefore kasi na, ngayon tuturuan kita. Tama? Okay, kasi kami kotse na yan sa labas. Akin yan. Tama? Okay. Nag-classific ko. Now, ito yan. Oh. Now, ang sabi kay X-rate, ito yung gagawin natin. Now, ideally guys versus, kung gusto mo sabi kay X-rate, mayroon akong deal sa'yo. Kung gusto mo, sa'yo ng sodium ko, akin ang potassium mo. Bigay ko ang sodium ko, akin ang potassium mo. Class, ginagawa ng X-rate nurses ito yun. It exchange sodium. Anong kapalit? Kapalit ng potassium. Exchange sodium. Kasi may sodium siya, di ba? Sodium polystyrene. May sodium siya. It exchange sodium kapalit ng potassium. Once makuha niya ito, ideally, ang potassium mo is excreted through your urine. Sa kanya, once na-exchange niya, exchange sodium to potassium and eliminate through the stool or feces. Stool or feces. Nilabas niya through your stool, ha? Sa dumi mo, stool or feces, ha? Stool or feces. Tapos sa kanya, class, it exchange. Electrolytes exchange. What exchange? It exchange. Wait, guys, ha? It exchange. Exchange sodium ito, potassium kaya potassium kaya class, it exchange. Sodium. Exchange sodium kasi sodium water your potassium kasi sodium again water your potassium. Exchange sodium again water your potassium. Therefore, class, once na-exchange niya, ideally guys sources, saan po ba ideally ang normal excrete ng ating potassium? Ang potassium ideally is excreted through your urine. Tama, through your urine. Kapag ma-repair ka, sa urine. Pero guys sources, sa excrete, saan? Sa stool. Exchange sodium to potassium and eliminate through the stool. And eliminate. And eliminate. And limit us to what? Limit again through what? Through. Again through what? Through the what? Through the what? And siya through the. And then A through the stool. B through the years. Ang sagot? Very good. Through the stool. And going through the years. Matagal yun kapag through the years. Through the stool. Kasi A through the stool. Okay. Dapat ilalabas siya through the stool. Hindi po through the years. Okay guys. It exchange. So bakit exchange? Exchange. It exchange. Exchange, sorry guys, exchange, wait, that is exchange, exchange, okay. Dito, it exchange sodium again to your potassium. Exchange sodium to potassium and eliminate again through the stool, tama? Ibig sabihin guys, again, ito ang ginagawa ng exit, in-exchange na, tama? O ngayon, guys, pag in-exchange guys, USRNC yan ang rule. Pag in-exchange siya, ano ang expected effect? Kasi guys, in-expect yan, kasi ito ang dahil kung bakit bumili ka ng exit. Yan, anong ginagawa ng exit case? Exchange sodium to potassium, kaya effect niya. What electrolyte imbalance will the patient manifest after giving KX-rate? What electrolyte imbalance will the patient manifest after giving KX-rate? Ang sagot is, answer, very good, ang sagot is hypokalemia. Pag effect case, ang sagot is hypo kasi hypokalemia. Effect case is hypo kasi hypokalemia. Kasi itong expected mo, bumaba ang kanyang expected effect kasi is hypo kasi hypokalemia. Ngayon, pag siyang effect case, so siyempre, ano kang side effect? Side to side against side effect. Tama? Okay. Class game meron side effect. Tama? Okay, good. Now, therefore, here we go. Kapag in a case class game may effect class, you have your side effect. Ano ang side effect? The side effect is the another effect aside. Example class ito ngayon ha, nakita mo, hindi po siya expected. Kapag side effect, ito po yung effect where hindi mo siya ginusto. When the side effect becomes life-threatening, therefore, that is the adverse effect. Adverse effect. Kapag life-threatening siya. Example, ang pasyente nag-diarrhea. What is diarrhea? Side effect or adverse effect? Side effect or adverse effect? Ano yan? Answer is? Answer is side effect. Class can side effect. Class can recall. The patient develops bronchospasm. Bronchospasm, nakakamatay ba? Yes. Nakakamatay siya, bronchospasm, then that is the adverse effect. Tama ba? O ngayon, here we go. Dito, ano po ang side effect? Remember, nailabas ko ba ang potassium? Yes or no? Yes. Nailabas ko. Pero, may iniwan siya. Anong iniwan sa iyo maliban sa alaala? Sure, anong iniwan niya? Kasi iwan siya ng sodium. Therefore, the side effect is in the case the patient is hyper, natriumia, hyper, natriumia, natriumia. Kasi kasi dinamihan mo, plus kaya sa kanyang sodium, plus hyper, natrium. So, hypokalemia, so first kasi hyper, natrium. This is the effect of taking KX-rate. Tama? Okay. Exchange sodium to potassium and limit it to the stool. Okay, to the stool. Tama? Okay, therefore, kasi yan, kapag ginamit mo ang KX-rate, how many hours bago ma-expect na o may effect na pala ang ating KX-rate? Ilang hours? Ano yan? Within? 4 to 6 hours doon siya po mag-effect. Tama? Huwag ka ma-short KX-rate. Kaya, say, therefore, kasi ganyan kasi calcium chloride, number 2 of your KX-rate. Therefore, this is to tell us, so should we go now, you have your number 4, kasi this is your number 4. So, una kasi effect is your number 4, guys, just take number 4. Okay, the focus is called number 4. Now, class, ang KX-rate again is 4 to 6 hours. Pero, pag emergency, guys, emergency class, emergency to, sobrang mataas ang potassium mo. Anong gamot ibigay? Nurses, are you pamilya guys sa exam, pag binanggit class again, pag-get class ng entrance sa akin, your glucose, insulin, infusion, yes or no? Glucose, insulin, insulin. Wait guys, sa glucose, insulin na. Glucose, insulin. Wait guys, this your glucose, insulin. Pataglag po tayo guys. Glucose, insulin. That's glucose dito, insulin. Wait guys, taglag po tayo. Okay, this is your glucose guys, insulin, infusion. Glucose, insulin. That's insulin, infusion. Guys, glucose, insulin. Insulin kasi infusion. Or glucose, insulin, drop down. Kasi glucose, insulin kasi glucose insulin again infusion or glucose insulin of your infusion. Guys, again, nurses class, here we go. Now, class, pag glucose insulin infusion, are you familiar guys yourselves? Pag binigay kong glucose insulin infusion. Familiar ba dito guys? Yes, USRNs. Are you familiar? Yes, ano guys? Glucose insulin kasi ganito infusion. Are you familiar with this one? Yes, ano? Yes. Okay guys. Familiar ba? Yes. Narinig na? Yes. Pero hindi familiar? Yes. Pero narinig na? Yes, pero hindi familiar. Okay, therefore we go now. Class, what is glucose insulin? Now, sa hospital guys, depende po yan. Yung doktor mo is glucose insulin infusion. Now, sa hospital, ang doktor powder, depende sa gusto ng doktor mo. Usually guys, ito po, ano po to ang glucose insulin? Usually, so nurse, mag-glucose insulin po tayo. Prepare the 5 water, 1 liter po yun ha. So 1 liter again. Plus, D50, plus D50 water. Plus, D5 plus D5 again, D5 water plus ito plus severe plus D50 plus D50. D5 water plus D50 water na. Plus, habisin, tumas ang sugar plus magdadagdag pa ng insulin. Pangdagdag ng insulin. Therefore, kaya kompleto yan, tinaas ko ang sugar plus kasama sila si insulin. This is your glucose insulin infusion. Paano ibigay class effective class? Effective class kayo na. Paano ko ito ibigay class para siya magiging effective? Given via bracket as given via IV. Kasi given via IV. This is given IV. Kasi lagyan muna kayo sa given, sorry, is given IV. Lagyan muna kasi this given IV. Given kas ano siya? IV kasi given na siya IV. Tama ba? Okay, here we go. Class, kailan siya effective pag binigay? Effective binigay kasi mas mabilis pa ang effect ito kumpara guys versus kas mabilis pong effect ito given via IV. Tama? Okay, so that's effective guys. Kailan? Get ang sagot class tingnan kailan after 30 minutes. Get 30 minutes after administration. Good. Usual class 30 minutes. Usual 30 minutes after administration. Kasi effective siya kailan siya 30 minutes. Kasi 30 minutes 30 minutes after administration. Even kasi 30 minutes after administration kasi after administration. So 30 minutes guys sir sa okay, mag-effect po yan ang ating case. Tama? Okay, good. Therefore kasi yung recall yan na class. Kapag siya po ang glucose insulin infusion, tas glucose insulin infusion, therefore given IV, effective kasi nito 30 minutes after administration. Now, ano ang principle ng glucose insulin? Now, class tandaan. Ang principle guys versus ng glucose insulin, ano gawin natin guys versus? Sa exam, you need to increase the blood sugar. Dapat itaas mo. Increase the blood sugar. Increase the blood sugar. Dapat itaas mo. Increase the blood sugar. Dapat itaas mo yan. Increase the blood sugar. Itaas mo kasi increase the blood sugar. Anong purpose is? And purpose is to what? Is to decrease blood sugar. To decrease your potassium. Increase the blood sugar kasi what? To decrease your potassium. Increase the blood sugar to decrease your potassium. Increase the sugar to decrease your potassium. Sir, ha? Parang hirap naman yun, sir. Increase the sugar to decrease potassium. Ano bang principle ginagamit natin, guys? Again, increase the sugar to decrease your potassium. Now, ano yun? Bakit, guys, ganun to yun? Again, class sundan. Increase the blood sugar to decrease your potassium. Bakit anong rule? Kasi potassium, it follows glucose into the cell. Potassium follows glucose into the cell. Kasi, guys, sabi nyo ba? Kasi, sir, itong potassium kayo, sir. Itong potassium kasi, guys, it follows. Cell follows glucose, ha? Potassium kasi follows glucose. Ang follows glucose. Followers niya po ito. Follows can have your glucose. It follows glucose. Pinusundan niya ang sugar. Saan? Follows glucose. Where? Into what? Into the? Where does it stand into? Kasi into what? Into the cell. It follows glucose into the cell. Tama? Potassium follows glucose into the cell. Tama? Okay. Therefore, kasi recall na. Potassium follows glucose into the cell. That's why you need to increase the sugar to decrease your potassium. Sir, explain. Itong bagay na to, marami kang maintindihan ko bakit guys gamitin mo to ang glucose insulin. Look at this one guys versus ha. Ito yung tanda. Again, recall. Kanina guys, USRN scan, you will see this one guys versus. Ito again, kanina ang sodium polystyrene. Again, this is class again administered with 46 hours. Tama? Okay. This one class can with, kasi ito ngayon class, this is your class within 30 minutes after administration. Tama? After administration. Tama? Okay, here we go. You need to increase the sugar to decrease your potassium. Therefore, look at this one guys versus. Let's have here. Draw po natin ating blood vessels. Para maintindihan guys, i-draw po natin yan. Remember this one guys versus. Now, class. Kapag ito pa yung ating blood vessels, remember this one is your blood vessel. We have your blood kasi blood vessel. As blood vessel twice versus now. Blood vessel now. Blood vessel versus this is your cell. Blood vessel versus blood vessel now. This is your cell. Again of your cell. Ano yan? Cell po yan. Ha? Appreciate yung pinaghirapan ko. Ano yan? Cell. Blood vessel na yan. Cell ha? Ano ito? Cell ha? Mamayang gabi. Ewan ko lang. Basahin ko ano siya ito. You have your cell. Ito ang cell. Cell ni mother to. Kay mother po nang galing ang cell nito. Cell ko sa what you are? Mother. Cell of your mother. Ha? Cell. Focus ka na. Galing ka saan sa cell. Therefore, kasi dito yan, cell. Mamayang gabi, ewan ko lang. Basta guys, ito git ang ating cell, ha? Okay, therefore, kasi you have your cell. Therefore, kasi we go in class again. Tingnan. Now, kapag siyang cell muna kasi cell, ito muna cell tayo. Now, kailangan ba ng cell? Aking kasi cell ng glucose. Kailangan ba ng glucose? Yes or no? Yes. Ano yan? Cell. Mamayang gabi, ewan ko lang. Basta ngayon, cell yan, ha? Okay, therefore, ano yung cell? Kailangan ba ng glucose? Yes or no? Yes. Kailangan kasi ng glucose. Pero, bago makapasok ang glucose, diba alam guys, may tagadala. Sino po ang tagadala ng glucose? Tagadala ng glucose, sino si? Insulin. Ang insulin kasi siya po ngayon ang tagadala ng glucose. Ito kailangan mo ng insulin. Plus insulin. Tama ba? Insulin. Tama ba? Okay, the free of your insulin. Now, class, pansin mo guys, sources. Kapag yung glucose natin siya ng insulin. Siya po ang tagadala. Abisin, ano ang function kasi ng insulin? Ang insulin mo guys, sources, para pa itong grab food mo, Yes, parang food panda mo yan. Bakit class dito insulin? Insulin class dito, function insulin. It transport glucose into the cell. Therefore, kasi function ng LBC mo. Sabi insulin mo, hari ng padala. It transport glucose into the cell. Siya po ang tagadala. It transport glucose. Siya po ang tagadala. Tama ba? Okay, therefore, it transport your glucose. Class, bumili siya ng glucose daw. It transport in the glucose. Tama ba? Okay, therefore, it transport glucose. Where? Class, where? Glucose where? Saan niya papasok? Saan? Siyempre, hindi sa iyo. Saan? Into the cell. Ha? Into the cell. Hindi sa iyo. Huwag kang excited. Ha? Into the cell. Kaya gumana sa cell, kasi pumangang sa cell, siyempre, ang cell sobrang nakangiti. Kasi happy yan kapag siya ay makatanggap agad ng glucose. Yes, ano? Yes. Anong bit-bit ng insulin? Nagbibit-bit siya, nagdala siya ng glucose. Kasi ang glucose kay sir sa pagkain po ng cell. Tama ba? Pagkain niya lagi ng cell. Tama? Okay. Therefore, nurses case na now. Class, pagkain niya ng cell. Tama? Ang class, dito ngayon, pagkain siya ng cell. Tama? Okay, here we go. Class, recall. Tingnan. Oh, nurses guys, sige, tanda ito ngayon. Itong insulin test na kadala ng glucose para kasi maging pagkain niya ng cell. Tama? It transport glucose where? Into the cell. Tama? Okay, here we go. Now, class. Tingnan. Class. Nagkataon guys versus, ito ka sa ating insulin class, duman si potassium. Si potassium guys, mayaman ito. Mayaman si potassium. Bakit? Kasi mayaman siya, nang galing niya sa abroad. Tama? Sa abroad siya po nang galing niya. Okay, therefore class yan. Dito, class again recall, this will be class again po. Ito ang ating, ito ang ating class, ito ang ating potassium. Si potassium guys, ito po ang ating heavier potassium. Guys ha, heavier potassium. Okay, so guys, again, potassium po natin yan. Ngayon, here we go. Now, kapag siya po ang ating potassium, ha? Class again, syempre kasi yan, andyan po ang ating heavier potassium. Therefore kasi yan, imagine mo itong ating potassium. Tama? Okay, syempre galing abroad to, USRN, syempre kasi yan, sinus needs your potassium. Tama? Okay, potassium po natin ito. Ngayon, anong principle ng glucose insulin? Now, di ba? Nurses, kita natin again, this is your potassium. Tama? O ngayon, therefore kasi sunod. Now, ang sabi kasi ng potassium kasi dumaan siya. Kasi sabi kay insulin, insulin. Okay, saan ka ba pupunta? Tama ba? O kasi insulin kasi siyempre naka-drive. Ay kasi grab food dyan. Saan ka napunta? Ako napunta saan? Ayan, road trip. Saan? To the moon. Tama? Saan? Skirt. Tama? Okay, therefore class si insulin na kasi si insulin class yan. Ngayon, napabayaan yung sarili. Kaya class nurses class again, siya ang tagadala ng glucose. Saan ka mapunta? Sabi po class, sino yun? Ako to, kaibigan mo sino yan? Si potassium, yung dati. Yung ex mo, ano ka mo? Ikaw yung ex. Oo, ako yung sinayang mo. Masenso ka na. Saan ka pupunta? Doon pa rin sa dati. Saan? Kay Cell. Ha? Bakit? Ano gagawin mo? Nako, dadaling ko tong glucose. Bakit? Pagkain ng Cell yan. Ano? Kay Cell ka papunta? Oo, ano ba naman yan? Ang gulo mo talaga. Saan ka nga pupunta? Kay Cell nga. Ano ba naman ang gulo mo talaga, potassium? Alam mo sabi ng potassium, insulin, huwag kang mayabang. Kasi wala kang ipagmayabang. Tama? Sabi ni potassium, kaya kita tinatanong kung saan ka pupunta. Kasi kung kay Cell ka papunta dito, hindi mo ba alam na bahay ko yun? Andun ako nakatira. Intracellular. Since doon ka man lang tas papunta, ha? Kung gusto mo sumakay ka na lang. Kasi doon din ako papunta sa loob ng cell. Bahay ko ito. Doon ako nakatira. Ha? Kaya pumasok ka dito, bahay ko po yan. Ito guys, cell. Ngayon, ano ang rule? Tignan. Itong potassium guys, hindi naman talaga si insulin ang target niya. Hindi po itong insulin. Ang target niya, itong glucose. Alam mo guys, itong potassium guys, sobrang in love ito kay glucose. Parang ginayuma yan. Na kapag once may makita siyang maraming sugar, dyan saan sa maraming sugar, saan? Anyan sa blood vessel. Pipila po lahat ng potassium mo. Bakit kasi ganyan? Kasi lahat ng glucose ipapasok niya sa bahay niya. Bakit? Ano gagawin? Papakilala sa parents niya. Tama? Okay. Masi ano pala? Ay anak. Sabihin mo, anak ha? Sige, anak. May sabihin mo, anak, may kusunera tayo. Hindi ma. Girlfriend ko to. Ano girlfriend mo? Oo. Sige. Papakilala sa parents niya. Ibig sabihin, anong rule? Guys, kapag maraming potassium sa blood, siya ba'y hyperkalemia? Yes. Anong gagawin mo guys since maraming potassium sa blood? Lagay mo, akitin mo. Para maakitin na sa stress, sumayaw ka. Sabi mo, dahan-dahan lang. Tama kasi gano'n. Hindi kasi gano'n. Ano gawin mo kasi ganyan? Ano gawin mo? Magpadala ka ng maraming glucose. Kasi once nagpadala ka ng maraming glucose, lahat na yan class, ipapasok yan ng potassium sa loob ng cell. Naintindihan? Yes. Ngayon, again. Now, tandaan mo guys versus ang principle na ito. Walang namamatay kapag dumami ang potassium sa cell. Bakit? Bahay niya ito. Mamamatay ka kapag maraming potassium sa blood. Kaya ang rule mo, class nurses, tandaan, kailangan mong alisin ang potassium yan, ipasok mo sa loob ng cell. Paano mo class ganyan ipasok yan? Class nurses, itaas mo ang glucose. You need to increase again the sugar to decrease your potassium. Bakit? Potassium follows glucose into the cell. Nang tinaas ko ang sugar, ang tawag doon, glucose insulin infusion. Naintindihan ba guys? Yes or no? Yes. Ang ibig pala kayo sabihin class ng concept natin, kung mataas ang sugar mo, habang tinataas ko guys ang sugar mo. Tama? Ang sugar mo. Ibig sabihin guys, yourselves, habang tinataas ko ang sugar mo, ang ibig sabihin, kapag sa exam, markang hyperglycemia. Ha? Tandaan guys, kapag markang hyperglycemia, increase blood sugar. Hyperglycemia. Pag may hyperglycemia, mataas ba ang sugar mo? Yes. Pag may hyperglycemia, ano ang potassium mo guys? High, low. Ang sagot, mataas ang sugar. Ang sagot is low. Kaya markang hypokalemia. Mga hypokalemia. Tama? Okay, good. Therefore, class, again, recall again. Pag may hyperglycemia, markang hypokalemia. Ibig sabihin guys, yourselves, tinaas mo ang sugar para mag-decrease again ang potassium. Tama? Okay, ano ginagawa mo? Glucose insulin infusion. Ngayon, balikan guys, USRNs class, almost pala po sa tayo dito sa potassium. What approach nurses ginagamit natin when you exchange sodium to potassium? Exchanging sodium to potassium, ano ang tawag doon sa principle when you exchange sodium again to potassium? Ano yun guys, nurses? Ano yun? Answer? Okay, good. Answer is answer. Class, kanina reference again to your, again, answer, you have your reference to your Kayeks rate. Yun, you have your Kayeks rate. Tama? Okay, now, when you increase the sugar, when you increase the blood sugar, nurses, ano po ang ginamit natin? To decrease your potassium, that is your glucose insulin infusion. Tama? Good. Question. Nurses, class, ganyan. Oh. Now, between the two, Kayeks rate in glucose insulin, that's glucose severe insulin. Between class Kayeks rate, glucose insulin. Guys, sino ang uunahin natin sa dalawa? Kayeks rate or glucose insulin? Sino sa dalawa? Unahin natin. Sino yan? Kayeks rate, glucose insulin. Answer sila si glucose insulin. Sir, bakit naman guys 30 minutes ito? Ito 4 to 6 hours pa. Dito 30 minutes ang effect. Tama? O ngayon, sir, paano pa itong tanong? Paano pa itong tanong, sir? Which one should you administer first? Choices. A, cascade A, cascade A, calcium gluconate A, calcium cascade, calcium gluconate A, class A, calcium gluconate, again for us. Choice, again, tingin na, okay, class, anong line natin? Choices, cascade A, cascade dito kas calcium gluconate, okay, calcium gluconate. Now, letter B, cascade, kayeksalate. Number 3, glucose insulin. So, pag dyan tatlo, ano pipiliin natin? Which are supposed to administer first? Class can calcium gluconate, kayeksalate, again, or glucose insulin. Sinong unahin? Ang sagot is, very good guys. Nurses, are you sure? Sure ba kayo dyan? Yes, very good nurses. Kapag yung tatlo class nurses, tandaan class, ang dyan tatlo, class again recordingan, ano ang best class? Anong unahin natin? Ang sagot sa class, unahin mo sino yun? Good. Ang sagot sa exam class, walang iba. Class, ang sagot unahin mo sila si, good. Ang sagot is glucose. In this calcium, gluconate. Sir, bakit siya? Kasi siya nga ang antidote. Pag antidote, pangontra, ikaw yung unahin. Ibig sabihin, anong rule? Tingnan. Ang ibig ko sabihin guys, sources, ang rule mo kapag mataas ang potassium, kasi life 13 ito, ang pinaka-goal mo, dapat guys, i-decrease mo ng heart rate. Kasi tingnan mo naman guys, USRNs. Tingnan again, 30 minutes pa bago mag-effect ang glucose insulin. Kung in the case again, therefore kasi nga kanina, kung mataas yung heart rate mo nurses class, ako ang pasyente, bago pa ma-attain ito nurses class, ang pasyente rigor mortis na, nanigas na, namatay due again to arrhythmia. Kaya ang goal mo dapat class kanina is to decrease the heart rate. To decrease the heart rate. Tama? After ma-decrease mo yung heart rate, then you have to give your glucose insulin. The last is of your class and siya, you have your kayeksalate. Sabi ko kaya, say it. Basta antidote ka, ikaw mauna. Kasi pangontra ka, ikaw yung gamot. Then therefore class, mauna mo na sila si calcium. Wala ko na calcium. Look at it antagonize the effect again of your potassium. Tama? At syempre the forecast in the last class, here we go. Dito, ay ganabuti guys versus guys, 2 is 1. Ha? O ngayon, hindi ko alam guys kung narinig mo na kasi again doon ang management na ito. Kapag mataas ang potassium, makinig USRNs again. Makinig. Tingnan. Nurses, pasyente, binibigyan natin siya ng albuterol. 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 Again, albuterol. That's albuterol. 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 Salbutamol. Against albuterol. Salbutamol. Tapos again, albuterol. Salbutamol. Tama, sir? Bakit salbutamol? Therefore, kasi balikan natin na, okay. bakit ka nga bumigay ng salbutamol? Bakit bumigay ng salbutamol? Wait guys. Bakit bumigay ka ng salbutamol? Bakit ka nagbigay nito? Sir, pansin mo guys ang pasyente na may classical may hyperkalemia, may renal failure, nagbibigay ka ng salbutamol. Sir, bakit sir? Ano ba salbutamol? Again, anong effect ng salbutamol guys? Again, actually guys, mga bronchodilator. Yes, yes, tama? Sir, ha? Sir, diba sir? Sabi hyperkalemia, bakit siya naka-nebulize yan, may salbutamol? Bakit may albuterol yan? Ha? Bakit daw may salbutamol? Ang sagot, sige. What is the answer guys? Bakit guys again may salbutamol? O sige, bakit guys again tingnan na? Anong effect guys again ng salbutamol? Ang salbutamol, siya may bronchodilator. Yes, Yes. Bronchodilator. Pero walang kinalaman ang bronchodilating effect. Bakit binibigay? Bakit ang pasyente may renal failure o ang pasyente may hyperkalemia, bakit nagbibigay ka? Kasi ang salbutamol guys, may effect ito. One of the effect guys of your salbutamol or albuterol, where hindi mo lang alam, the albuterol class, it pushes potassium into the cell. It pushes your potassium. Itutulak niya. Si Kets, doon ka. Sa'yo na to. Ha? Itutulak niya. Saan niya itulak? Siyempre, itulak plus into the cell. It pushes potassium. Pushes potassium into the cell. Pushes your potassium. Pushes your potassium into the cell. Pushes your potassium. Kasi your potassium where? Saan kasi yung potassium where? Into the cell. Into what? Into the cell. It pushes your potassium into the cell. Kasi intulak niya papunta sa cell. Tama? At syempre guys, sources yan. Plus, in a case again, plus patas ang potassium, bibigyan kita ng diuretic. USRNs, again, makinig. Anong diuretic bibigyan natin? Sige, potassium wasting, potassium sparing. Galingan. Wasting sparing. Good. Potassium wasting. You have to give your potassium wasting, guys. Ha? You have to give your potassium wasting. Potassium wasting diuretic. Kasi potassium wasting diuretic. Potassium wasting of your diuretic. Tama? Okay, therefore, alam ng potassium wasting, di ba? Sino pa ba ang potassium wasting nurses? Your RNs can recall. Sino yun again? Sino ang potassium wasting, guys? Galingan. Sino pa ba ang ating potassium wasting? Sino ang potassium wasting, guys, nurses? Sino ba ang potassium wasting? Sino yan? Again. Now, refers to sino ang potassium wasting? Again, nurses, aldactone furosemide. Aldactone furosemide. Ang sagot is, break it aldactone. The aldactone or the spironol, lactone, guys, sorry. Guys, ano siya? Furosemide. I mean, your furosemide. Aldactone or spironolactone is sparing. Ito wasting is furosemide. Furosemide. Furosemide, brand name is Lasix. Brand name what of your Lasix. Tama? Okay. Furosemide or Lasix. Tama? Okay, good. Tapos again, tingnan na. Furosemide again or Lasix. And therefore, syempre, the last again recall, you have to give patient an advocacy of your dialysis. Dialysis. Kasi pag sobrang mataas na, hindi na po effective yan later on. Ating kasi ito ay yung dialysis na forecast. Dialysis dito ngayon, ano po ba ang dialysis, guys? Dialysis na forecast yung recording na yan dito ngayon. Class 8 excrete siya. Excrete of your, class excrete na siya. Excrete again. Class 4 eliminate excess potassium. Eliminate plus excess of your potassium. Eliminate. Palabas siya kasi through your urine. Siyempre, eliminate excess. Okay, excess or excess of your potassium. Eliminate excess of your potassium. Excess of your potassium again plus in the case of your hypers and hyperkalemia. Tama, eliminate excess of your potassium. Tama ba? Okay, good. Therefore, here we go. That means, kanina guys, sources task, last time nurses task ganyan. Here we go. Guys, sige, balikan po natin. Ano po ang binibigay guys sources kapag kulang ka ng potassium? Dalawa yon. Kapag kulang ka ng potassium, ano yung kanina? Kapag oral, calindrol. Kapag IV, ano pag IV guys? Anong pag IV? KCL. Kapag hyperkalemia guys, anong unang gamot? Tandaan, ibibigay mo pag may hyperkalemia. Anong unang gamot yon? Ang sagot is very good, calcium gluconate. Bakit? Anong effect of calcium gluconate? It antagonizes. It counters the effect of your potassium. Tama? Okay. Number 2, what approach? Classical recall is one, it exchange sodium to potassium. Exchange sodium to potassium. Sino yan? Ang sagot is very good. Is your class na sure? Okay, excellent. Kaya, excellent. Ano ang expected effect of giving excellent? Expected. Sino yun? Ang sagot is answer. Expected effect. Answer is ang siya of your class hypokalemia. Ano ang side effect? Side effect ko dito, answer. Can you click into what hyper? Hypernatremia. Tama ba? Okay, good. What principle is used kapag in a case ginagawa mo class UX class kanina, ginagawa natin class kanina, recall, you have to increase the sugar to decrease potassium. Increase the sugar to decrease your potassium. Bakit guys? Potassium, it follows glucose. That's your glucose, insulin, infusion. Glucose, insulin, infusion. What approach? It pushes your potassium. Tinutulak niya, push your potassium. It pushes potassium into the cell para makapasok. That is your obvious albuterol. At syempre guys, singan, anong type of diuretic? Potassium wasting. Potassium wasting. Tama? Okay, therefore, these are the drug choice for the approach class in a case when the patient is having a pure class dito hyperkalemia. Tama? Guys, balik na natin when you answer the exam. Ito mga gamot na to guys, usually makita mo to in the case when you manage this patient kapag may diabetes, last yan kapag ang pasyente may renal failure, may glucose insulin infusion po tayo. Tama? Okay, good. Ibig sabihin guys, pumapasok na yan sa disorders po natin. That's the reason kung bakit, sir, bakit may renal failure, sir, may salbutamol, bakit na ba nangyari, sir? Kasi it will push potassium plus into the cell into the cell. Tama? Okay, get this. Therefore, these are the management class in a case for a patient again with your class in hyperkalemia. Tama? Okay, guys, sige guys, wait na guys, wala ko ng tubig, eh. Last of the last electrolyte. Let's manage already class where we get your calcium. After this one, guys, we'll just start class concept already. With your class with regards again to concept class with regards again to your class patient again with your class cardiovascular disorders. Okay, wait lang guys, wala ko ng water guys, saglit lang po ha. Kasi again, wait lang po. Wala ko ng tubig guys, wait lang po saglit. Ha? Okay, saglit lang po. Open nyo mo muna saglit na. Okay, so yan po guys, nurses guys, balik na po kayo guys, nurses. Okay na po ba? Nurses, okay na ba tanggalin ko po yung sa screen? Yes, ano guys? Okay na ba connect the screen? Tanggalin ko po yung nakalagay sa screen. Okay na ba erase po natin guys, nurses? Connect this one. Good. Okay, so ayan po. Yes, ma'am, same lang po yan sa inyong D50, D50, 50. Basta guys, ang Google class again ng glucose insulin, trip guys, sir, tandaan nyo ito palagi guys, sir, says. Tandaan na? Okay guys, ito guys, depende sa doctor's preference mo. Depende guys, may doktor na D50 lang plus insulin. Minsan yung iba class, D50 lang po binibigay. Basta sa glucose insulin, pag may nakita ka sa question na tinataas ang sugar, then he is using the glucose infusion. The glucose again, ito you have your infusion. Okay? So, ayan po. Glucose infusion. Tama ba? Okay, sir. Okay, ayan po. Now, in a case, glucose insulin dito, you have your glucose insulin. Tama ba? Okay, therefore kasi we go ngayon. Guys, ayan. Now, in the case, therefore kasi kayo na-recall nurses, case same po again effect. You could give that one, guys. Pwede ka po magbigay again ng iyong class kinab your class. Sabi nyo, yung ACE inhibitor, yes. Yung ACE inhibitor, guys, you could give, ang ACE inhibitor, guys, says, ano bang ACE? Yung ACE, guys, inhibitor sa renal. Okay, guys, ACE inhibitor, guys. Erase ko ito muna. Okay, ang ACE inhibitor mo, ito kasi ACE, di ba? Angiotensin converting enzyme inhibitor. Ito yung effect ng ACE. Kasi guys, ikaw sasagot ito kasi are you a safe nurse? Kung pwedeng ibigay. Ang ACE, ano bang ACE? Ano bang ACE? Anong lahat? Example ng ACE inhibitor. Those are the drugs. Reference ito yung ano bang ACE inhibitor? Includes lahat ng mga na maggamot plus includes mga ACE. Ano yun? Captopril, enalapril, tama? Kasi parang girlfriend nung sa April. Basta may pril. That's your class captopril. Captopril, enalapril, captopril. So basta may pril is ACE. Ang ACE nurses, inhibitor guys, nagkamot, di ba? Anti-hypertensive ito, yes and no? Yes. Ang ACE nurses, inhibitor class ganito, decreases sodium plus water retention. Pag decrease sodium plus water retention, di ba, class sodium plus water dito, you have your retention. Decrease sodium plus water retention. Thereby, class it decrease the BP, di ba? Decreases your blood pressure. Look at the effect, guys, nurses. Therefore, class nga, ano ang effect ng ACE? Ito cause hypernatremia. Ang effect ng ACE guys, says it will cause again hyponatremia. Kasi hyponatremia. Ngayon, kung hyponatremia, pagbagsak class ang sodium mo, again hyponatremia, class sodium is opposite to potassium. Kapag hyponatremia, anticipate mo ng hyperkalemia. Tama ba? Kaya itataas niya ang potassium mo kung in a case nagbibigay ka ng ACE. Tama? Kaya therefore class of don't give ACE inhibitor. Tama ba? Yes. Kasi guys, itataas niyang iyong potassium. Tama ba? Okay, kid. Tama ba? Okay, so yan guys, sources. Nakuha na ba guys? Naintindihan na ba tayo dyan? Okay, kid. Tandaan po yung guys, sources. This will be guys ang dahilan kung bakit nurses. Again, this will be get a short management. Tama ba? Okay, good. At this case, again, kung nag-duty ka na ako, nakita mo na class kung pwede kang bibigay o hindi. ACE decreases sodium plus water retention. Pag decrease sodium, tataas ang potassium, ay naku, lalong tataas ang potassium mo, lalo ka magkaroon ng hyperkalemia. Tama, hyperkalemia. Tama ba? Yes. Tama ba? Okay, good. Guys, nurses? Okay na ba guys? I-erase na po natin ito guys, nurses. Connect this one. Yes, ano? Good. Okay, guys. Therefore, let us get nurses. So, in 3, okay, class again 2, 1. Sa team live po natin guys, nurses. Okay, class again, tingnan class. Shout out kay Ma'am Mavik. Again, class, don't kill you, ma'am. Thank you very much. Thanks for dropping by. Okay, class again, nurses, class. Is number 3 na po natin na nag-visit again for today. Again, class, kinabago pong passers po natin. Almost every day guys, nurses. Pinabalikan kayo at binibisita ng ating mga passers, nurses. Ibig sabihin guys, kayo na po ang susunod na papasa. Tama? Okay, it's worth a shout out, nurses. Kasi alam ko guys, hindi lang po basta-basta class. Again, ang pinagdaanan nyo para maipasa ang exam na ito. You give up a lot again, nurses class, yung puyat mo, yung pagod mo guys, nurses class, and all throughout guys, marami kang bagay na sacrifice para dito. Kaya guys, nurses class, again, sayo palagi, class again, lahat class ng sacrifice is all paid off guys after this NCLEX exam. Aba? Okay, kid. Again, thank you po mga thanks for dropping by again. Thanks you po again, Ma'am Mavik. Again, don't kill you. Again, bagong passers po natin for the NCLEX again. INAP, tama? Guys, alam ko bakit palagi. Every time kasi may nakapasa. Sabi ko palagi, nurses ako yung INAP, ginawang NLE, yung NCLEX, pambira. Alam mo guys, bakit? Every month, plus all throughout sa mga gitik ng mga NCLEX, ang INAC ang pinakamaraming passers almost every month. Napaka-sobra napakaraming passers. Class again, that only shows nurses. Again, class again, na dito sa INAP guys, almost class, lahat na nag-exam guys, again, tingnan ngayon, almost can pumapasa. Ba? Okay guys, kasi pagbutihan nyo lang po, nakabisaduhin, pagtyagaan, lahat naman lecture po natin ito. Guys, have you seen guys, kapag during the exam nurses class, kusa ka pong class itatawid ng concept mo na ito when you take your NCLEX exam. Tama? Okay, salamat ma'am. Thank you very much po. Guys, class again, si ma'am class, stop also at the question again 85. Have you seen, kahapon pa guys, nurses, marami kang question 85 again naman nakakapasa. That shows nurses na tama po yung pattern natin class when you answer, when you are having your lecture class against the NCLEX. Okay guys, again, guys, napakasaya. Ang hirap guys mag-shutdown sa question 85. Ibig sabihin ka sobrang ginalingan nyo po yung pagkukuha agad ng NCLEX exam. Tama? Guys, kunting-kunti na lang guys, sources. Kaya na pong susunod niya. Tama? Okay, good. Okay guys, sources kasi yan. Let's continue the remaining concept guys. We have NCLEX concept already with regards again to your patient class with your hypokalemia ngayon. Therefore, let's try. Bago ko ilagay guys, sources. Tingnan. Palagay po kasi in 3, 2, 1. Hypokalemia guys. Again, class, lagay din arrhythmia, manifestation plus management. Arrhythmia, manifestation plus management. Guys, don't look at your notes. No cheating. USRS class again, INAP. Ang tanong, syempre, handa ka naman pumasaya sa no? Yes, let's do this guys. Again, team live po natin guys. Makisabay na rin. And of course, guys, we're testing yan. Galingan guys. Sabi yung video on guys para mas marami po tayo makita all throughout ng ating lecture. Okay, here we go. Let's take us in 3, 2, 1. Hypokalemia guys. Again, pabilisan po tayo. Nurses, balikan natin. Hypokalemia. Number 1. Here we go. Number 1. Una. What causes tachycardia? Class, galingan. Tachycardia. Hypo. Answer. Good answer. Hyperkalemia. Very good nurses. Abdominal cramping. Abdominal cramping. Sino yun? Hyperkalemia. Get abdominal distension. Pag distension, sino yun? Hypokalemia. Very good nurses. Paralytic ileus. Paralytic ileus. Sino yun? Hypokalemia. Good nurses. Balikan. Hyperactivity of the heart and brain. Hyperactivity of the heart and brain. Sino yun? Good answer. Good. Hyperkalemia. Very good. Kas galingan again. Recall nurses. Weakness of the lower extremities. Lower extremities. Sino yun? Good. Hypokalemia. Very good nurses. Kas balikan natin. Class, in the case again, sabi ko na, recall ang patient nurses fatigue. Pag fatigue, sino yun? Hypokalemia. Kas muscle weakness. Sino yun? Hypokalemia. Diarrhea. What causes diarrhea? Sino yun? Hyperkalemia. Good. What is the complication of severe or prolonged diarrhea? Complication answer is good answer is hypokalemia. Good nurses case galingan again flattened tube kasi flattened tube. Siyang flattened tube. Answer is good. Answer hypokalemia. Taller peak T wave. Tall. Answer is hyperkalemia. Very good. Last ST elevation. Hyperkalemia. Very good. That's in widening of QRS. Widening. Answer is yun. Good answer. Hyper narrowing of QRS. Case pag narrowing syllable, narrowing. Answer is. Answer. Good. Hypokalemia. Very good guys. Again, galingan. Therefore, nurses again. Tingnan. Dito, presence of U wave. Sino yun? Hypokalemia. Good nurses. Tapos again, bigyan mo siya ng glucose-insulin. Glucose-insulin fusion. Sino yun? Hyperkalemia. Very good. Tapos again, kayexalate. Sana kayexalate. Answer. Good. Hyperkalemia. What is the complication of taking kayexalate? Answer. Hypokalemia. Good. Balikan nurses class can recall KCL. What is the KCL? Answer is. Yan, very good. Hypokalemia. Very good guys. Nurses can recall. Guys, bibigyan mo siya agad ng albuterol. Class, bibigyan mo siya agad ng albuterol. Pag albuterol. Sino yung albuterol? Answer is. Very good. Hyperkalemia. Good. Nurses ko ang gagaling guys. Nurses can recall. Nurses guys. Kaliumdurul. Pag kaliumdurul. What is kaliumdurul? Sino yan? Saan? Good answer. Hypokalemia. Good nurses guys. Galingan again. Case patient again class again would undergo hemodialysis. The patient would undergo hemodialysis. Answer good is answer. Good. Hyperkalemia. Tama ba? Okay ngayon. Management guys. What is a drug that exchanges sodium to potassium? What is a drug that exchanges against sodium to potassium? Answer. Kayexalate. Tama ba? What principle is used? Class, when you increase the glucose to decrease your potassium, what principle is used when you increase the glucose? A glucose-insulin infusion. Glucose-insulin infusion. Tama ba? Okay, next again, recall nurses. Tandaan again. Ngayon, pag sinabi sa exam guys, sources again kanina, recall, binanggit natin. Class, this one, it antagonizes the effect of potassium. It counters the effect of your potassium. What is the answer, guys? Answer with the exam. Answer is get calcium gluconate. Tama? Okay, good. There's the second thing yan. Last one yung concept, guys. Alam kong gumagaling ka there for class. Last about the last echo, right? Last about concept already with regards again to your nurses of your calcium. Tama? Okay, last class. Here we go, class. Already of your calcium. Good. Again, guys, gumagaling ka na ngayon. Last na po ito, guys, nurses. Concept already with regards to your calcium. Guys, tingnan na. Magamit mo to class again, later on class sa lahat ng mga disorders na pagdadaan mo, will you take class again ito ngayon, your NCLEX exam. Dito po class again, ito po again class again, again, class again, this is the, again, itong highlight po again ang mga concepts nyo when you say about the specific disorders with your electrolytes. Last again, recall, that's about the concept now with regards to your calcium. Pagtamas hypercalcemia, kasi hypercalcemia. This is your hypercalcemia. Guys, team live po natin guys. O hopefully guys, makasabay pong team live po natin dyan. O team live po natin naging hypercalcemia. Ngayon, sa kita guys, sagay ko ang ating calcium ha. Lagay ko effect ng ating calcium. This is your calcium, maybe your calcium. Tama okay guys, says, what is the normal value class of your calcium guys? Again, class again, normal value ng ating calcium. Ilan ang normal value ng ating calcium guys? Ilan kayong class again pag MEQ? Ilan yun? Naku, kirang-kira mo ito, ilan siya? 4.5. Again, up to 5.5. Ano siya? You have your MEQ, plus again, MEQ, plus again, MEQ. 4.5 to 5.5. Good, that is your MEQ. Plus milli equivalent, plus again, milli equivalent, plus 4.5 to 5.5. Plus again, pag milligrams per DL, class again, yan, anong oras? Best time. Unang gatas, guys. Anong oras? Very good. 8 to 10. Let's get 8 to 10. Let's get 8 to 10. Class 8 to 10. Okay, good. Again, guys, kung magaling ka na ngayon, here we go. This is now you have also class patient with your hypocalcemia. Tama? Okay, this hypocalcemia. Ngayon, dito guys, sir says, kahit hindi ko na kasi sabihin sa inyo, class, alam kong kaya-kaya mong sagutin ito. Because class, alam mo ang effect already ng ating calcium. Tama na ating calcium. Tama ba? Okay, here we go. Now, first, again, class, in the case, if this is your calcium, guys, ha? Okay, this is your calcium. For number one, kasi here we go, class, ganito ngayon. Now, first effect, class, of your calcium. Number one, una, class. Ano po ba ang effect ng calcium? Dapat kabisado mo to. Ang effect ng calcium, guys, again, calcium initiates or maintains a contraction. Does it initiates or maintains a contraction? Answer? It initiates cardiac contraction. Tama? Okay, what drug? It delays the impulse SH2AV node. This drug, it delays the impulse SH2AV node. Ito yung calcium channel blocker. Calcium channel blocker. This is calcium channel blocker. It delays the impulse SH2AV node. This calcium channel. Si function is, this one, it initiates. It initiates na siya cardiac contraction. It initiates a cardiac contraction. Initiates cardiac contraction. This is your calcium. It initiates your cardiac contraction. Tama? Okay, good. Number two, guys, there says, tingnan, gagamitin mo to in case of brightness wrong. I want you to shut down your question class at question 85. Guys, sundan niyo na po ang masusunod na mga pumapasa. Class again, here we go. Kapag calcium initiates the contraction class kanina, anong function ng potassium? Responsible for the contraction of what muscle? Pag potassium contraction, what of your? Smooth muscle. The smooth muscle. Now, while calcium class ngayon is a responsible for contraction class of your large and skeletal muscle. Large and skeletal, guys, responsible for the what kind of contraction? You have your contraction class. Contraction, what of your? Ang target niya, contraction, what of your? Answer? Large and skeletal. Large and skeletal. Contraction, what of your large? Large contraction, large what? Large and skeletal. Large again and skeletal muscle. Contraction large in your skeletal muscle. Contraction of large and skeletal muscles. Ito naman class ang target ng ating calcium. Target niya mga large, ang mga malalaki, ang mga ducts. Tama? Yung mga ducts talaga class ang target niya. Tama? Class tingin ha, sino tumatarget sa mga malalambot? Malalambot sino yun? Potassium. Class yung mga paskin, mga malalaki, mga ducts. Sino yun? Sino si calcium? Sir, bakit nurses? Large and skeletal. Bakit class ganyan? Kasi saan ba abundant ang calcium? Sa blood or sa bone? Most abundant saan sa bone? Saan sa bone? Andun siya kasama na kay mong buto. Tama? Ibig sabihin kasi tandaan. Nano rule. The more calcium in the bone, the stronger the bone. The more calcium, the stronger the bone. Ibig sabihin kasi kailangan ba ng calcium para tumigas ang buto? Yes or no? Yes, very good. Tandaan. Class, sabi natin, para tumigas ang buto. Ha? Para tumigas ang buto. Anong kailangan para tumigas ang buto? Nurses class, anong kailangan? Calcium class. Ang kailangan ng calcium class, kailangan para tumigas ang buto. Anong kailangan? Calcium, bihahawakan. Anong sagot? Calcium ang sagot. Ha? Huwag mong hawakan. Ha? Hindi pwede matutulpo ka. Ha? Kasi hindi pwedeng hawakan at talong huwag pisilin. Unang bises, hindi ito prutas. Tama ba? Okay. Tanda. Ba't ganun kayo guys? Pag bilang prutas, pisil kayo ng pisil. Tama? Pag pisil kayo ng pisil. Guys, tandaan nyo. Pag bilang prutas, huwag yung pisilin. Unang beses, hindi ito titi. Hindi kasi. Kawawa po yung tindera ng prutas. Kasi here we go. Now, tingnan ito. Now, the more calcium, the stronger the bone. Large and skeletal. Mga malalaki. Tama ba? Yes, and last and skeletal muscle. Siya responsible nurses ang gantingan saan sa mga malalaki. Tama? Sila ka-tender date ni Angelica mga too big. Tama? Okay, class mga last and skeletal. Tama ba? Okay, now, look at this one, guys, versus. Tingnan again, here we go. Kanina, class, anong effect to the muscle? Look at this one, guys. Alam kong gumagaling ka na ngayon. Anong effect to the muscle? Now, kapag sinabi sa exam, guys, effect to the muscle, this is the effect to the muscle. I said class, effect to the muscle. Class, effect to the muscle. Effect, class, effect what, where? To the muscle. Effect what to, again, to the muscle. Effect into the muscle. Tama? Okay, effect to the muscle. Anong effect into the muscle? Now, again, now. Pag effect to the muscle, therefore, nastandan. Effect to the muscle, class, anong rule? The effect to the muscle, class, again, recall, ano yun? The calcium effect is opposite to potassium. Ulitin ko namin. The calcium effect is opposite to potassium. I don't say na calcium and potassium are inversely proportional. I say only effect to the muscle. The calcium effect is opposite to your potassium, guys. Calcium effect, ha? Calcium effect. That's the calcium plus calcium effect, guys, USRNs. Calcium effect is opposite. Effect is opposite. Opposite what? Opposite side. Opposite what saan to your potassium. The calcium effect is opposite what to your potassium. What to your potassium. The calcium effect is opposite to your potassium. Tama? Ito ang kanyang effect to the muscle. The calcium effect is opposite what to your potassium. The calcium effect is opposite to what to your potassium. This is the effect. The calcium effect is opposite to your potassium. Tama? Okay, good. Therefore, class, ano ang ibig ko ipating, guys, USRS? Here we go. Look at this one, guys, versus. Tingnan, yun. Class, kapag sa exam nakita mo, ito, tumaas again sila si potassium. Tumaas si potassium, tumaas ang calcium. Increase potassium, increase calcium. Tama? Okay, tumaas sila si potassium, tumaas po ang ating again calcium. Increase potassium, guys, increase ang ating calcium. Therefore, look at this one, guys, versus. Tingnan, here we go. Now, class, in a case sa exam, guys, versus, increase potassium, guys, versus, increase again calcium. Increase potassium, increase calcium. Look at the effect to the muscle. Calcium, you have your potassium. Look at the effect again to what to the muscle. That's the effect again to the muscle. Ay, sorry guys, again. Guys, sa live po ba? Wait lang po. Hindi ko nakakita sa live eh. Sa live po ba? Nakikita ba yung sinusulat ko? Wait lang po. Pasok ako sa live natin. Wait lang po. Pwede ko nakita. Nakikita ba sa live po natin, guys? Ang kabila na side po yan. Nako, you still? Nakita ba sa live? Wait lang po, guys. Pasukin mo muna yung live po natin. Wait lang po. Nakita ba dito na side yung hypocalcemia? Could you see that one, guys, sa live? Okay, wait lang po. Papasok po sa live. Wait lang po sa grid, ha? Para mapasok po natin, guys. Live po natin. Wait lang po. Hindi po nakita. Guys, wait lang. Okay. Wait, guys. Again, para masilip ko muna ating live po, guys. Here we go. Sa team live po natin dyan. Okay, nurses, live po natin. Wait. Ayan. Okay. Ako mismo po ang hindi makapasok sa live. Okay. Okay, guys. Again, dito. Okay. Wait lang, guys, ha. Okay. Ako mismo ang hindi makapasok sa live. Wait lang po. Live. Dapat nakapasok ako yung team live. Ayan. Wait lang po. Ayan. Ito nakakita ka pala. Okay, guys, again, tingnan. Nurses, shout out sa team live po natin dyan. 150 class team live po natin nandyan po. Shout out po sa inyo sa team live po natin. Okay, good. Okay, yan, nakita po tayo. Okay, sige ko muna lagay sa kabila. Okay, now, here we go. Now, in a case again, nurses class, again, recall. Anong rule? Kanina, kapag tumaas ang potassium, ano mangyari kapag maraming potassium? Increase or decrease contraction? Increase or decrease answer? Very good. Increase contraction. Tama? Kapag maraming potassium, effect to the muscle is increase in your contraction. Good. Guys, here's a team live po natin, guys. Increase muscle contraction yan. Increase muscle contraction. Kapag marami again ang potassium, kaya naging irritable ang muscle mo kapag marami kang potassium. Kapag maraming potassium plus, naging irritable ang muscle mo. Tama? That's the reason, tingnan again, kapag yung girlfriend mo na sobrahan siya ng potassium nurses plus, irritable siya. Tama ba? Napamura siyang, tama ba? Kasi sobrang taas ng kanyang contraction, irritable. Tama ba? Ngayon, ang effect ng calcium is opposite. Ano ibig sabihin? Class again. Kapag tumas ang calcium, ang effect dito, what will happen? Get decrease muscle contraction. Tingnan rin guys kung tama po ang tinuro ko sa inyo kanina. Here we go ha. Okay guys, decrease muscle contraction. Now, yan po napapatunay guys, sir says. Ito kanina. Di ba binanggit ko guys yung mga tama ha? Blood vessel, cell, blood vessel, cell, blood vessel. Sino nga nakatira guys sa cell? Kasi cell. Sino nakatira? Nakatira guys sa cell. Sino si? Very good. Andyan sino si? Potassium. Good. Guys, tingnan po natin. Sino yan? Sino si? Potassium. Sino sa blood vessel? Sino si So si sodium. Tama? Pag magkita ang dalawa, may sodium-potassium pumping. May pumping ba? Yes. Sodium-potassium pumping. Mayroong pumping. Tama? May pumping. Basta makita may pumping. Huwag kang pumayag na walang pumping. Hindi 20 class nurses. Ha? Naku, sayang yung day off mo pag walang pumping. Ha? Okay, ngayon. Now, sir, my guard. Di ba may guard? Sino ang guard? Yan po ang ating katipunero. Andyan sa gitna, nakabantay. Ha? Andyan kasi nakabantay siya ang ating katipunero. Kasi na nakabantay siya. Tama? Okay, therefore siya ang calcium. Ang ibig sabihin para sir, kapag tumaas ang calcium, hypercalcemia. Pag hypercalcemia, saan mataas ang calcium guys? USRN. Saan? Sa bone o sa blood? Where? Sa bone or sa blood? Where is calcium high? Bone or blood? Hypercalcemia? Bone or blood guys? Sige, type in your answer. Bone or blood? Saan? Saan mataas hypercalcemia? Bone or blood? Answer saan? Very good. Ang sagot saan? Very good. Ang sagot is blood. Ha? Sagot saan sa blood? Kasi linya is blood. Plus, kapag mataas yan, ano pa mangyari guys? By guard, di ba nakita mo, it decreases the contraction. Plus again, plus, pag hypercalcemia, decrease contraction, it causes muscle relaxation. Di ba? Muscle relaxation. Nagre-relax ang muscle mo kapag tumaas ang iyong calcium. Kapag tumaas ang iyong calcium, it causes muscle relaxation. Bakit? Siya bang guard? Yes. Kaya tama ba tayo guys kanina? Na kapag may hypercalcemia, may guard. Decrease bang contraction? Yes or no? Yes. Decrease ang muscle contraction. Good. Guys, USRN second class INAP. Nasusundan ko ba tayo dyan? Nakakasunod ko ba lahat? Yes or no guys? Versus? Nakakasunod ko ba? Yes or no? Team live po natin. Nakakasunod ko ba? Yes or no? Guys? Okay, good. Here we go. O anong rule? Let's connect your concept. Kapag tumaas ang calcium, what happened? Ano sa calcium again? May guard? Yes or no? Yes. Pag may guard, increase or decrease contraction? May guard. Increase or decrease muscle contraction? Pag may guard, answer? Very good answer is decrease muscle contraction. Kasi pag decrease ang muscle contraction, kapag may guard, nurses guys, signs of decrease muscle, signs of decrease in muscle, kasi muscle contraction, signs of decrease muscle contraction. Ibig sabihin yan bang muscle relaxation? Yes or no? Yes, muscle relaxation. Muscle relaxation. Muscle relax. Tama ba? Okay, good. Therefore, guys, let's put your concept, guys. Use RNs to look at this one. Again na, ngayon. Balikan. Kapag tumas ang calcium, guys, my guard. Makita pa ng boyfriend mo? No. Pwede makita class o Taki or Brady. Taki, Brady. Class, may bantay sa gitna. May bantay sa gitna. Kasi tingnan, Taki, Brady. Ano yun? Regular skin, bradycardia. Kasi cause bradycardia. Ngayon, guys, analyze the question USRX. Ngayon, kapag sinabi sa exam, what are the two electrolyte imbalance that causes bradycardia? What are the two electrolyte imbalances that causes bradycardia? Dalawa. Una, a hypo. Very good nurses. Damang-dama. Okay. Uy, mag-type kayo. Kasi mga hayop na to. Hypo. Kalemia. Hypercal. Semi-hyper. Semi-hyper. Semi-hypokalemian. Hypercal. Semi-pambira. Kasi hindi yan hyper. Kasi tamba. Okay, good. Tandaan po yan, ha? Okay, kasi here we go. Oh, kapag may cardiac forecast, ano ka forecast? Tachybradycardia. Brady. Hyper o hypoventilation? Hypoventilation. Sagot, yes, answer. Hypoventilation. Magdidikis ang yung respiration. Hypoventilation. Kasi hypoventilation. Hypoventilation. Ngayon, sige, hypoventilation. Ngayon, o sige, kung ikay nag-exam class at last din ng crossroad coaching, basta natandaan mo lamang yung tinuro ko. Kapag hypercalcemia, hypoventilation. Therefore, which of the following acid-base imbalance the patient should be given calcium gluconate? Which of the following acid-base imbalance will the patient given calcium gluconate? A. Respiratory acidosis. B. Respiratory alkalosis. O sige, sino makasigot guys? Ang makasigot plus again nurses plus again tingnan. Siyempre guys nurses, my secret passage again nurses para pumasa at question 85. What's the answer? What's the answer? What acid-base imbalance the patient is given calcium gluconate? A. Respiratory acidosis. B. Respiratory alkalosis. Sagot, answer? 5 seconds to analyze. Team live po natin. Let me see guys. Sa team live po natin guys. Yung sasal po natin. Here we go. What acid-base imbalance? Ang patient should be given calcium gluconate. In 5 seconds, type in your best answer. In 5. Team live po natin. Makisabay na rin. 4, 3, 2, 1. Okay guys. Ano kaya ang tamang sagot? Bibigyan mo daw ng calcium gluconate. Ha? Nurses class, are you a safe nurse? Anong rule? Now, ano ba ang acid-base imbalance? Again, recall, anong effect ng calcium? It decreases your heart rate. Kasi mayroon siyang guard. Tingin sa akin, kasi mayroon siyang guard. Ngayon, Kapag respiratory alkalosis, ano ba ang cause of alkalosis? Alkalosis due to hyper o hypovent? Anong cause ng alkalosis? Hyper, hypovent. Sino yun? Hyper, hypovent. Ang sagot is, answer? Okay guys, sige tingnan. We inhale oxygen, we exhale carbon dioxide. We inhale oxygen, oxygen is alkaline, we exhale acid. Kapag nag-hypervent ka, hypervent. Pag hypervent, do you lose carbonic acid? Yes or no? Yes. Hypervent, you lose carbonic acid. When you lose carbonic acid, therefore, ano matitira sa'yo? Kapag naubusan ka ng acid, guys, versus nag-hypervent ka, kapag naubusan ka ng acid, matira sa'yo is alkaline. So what is hyperventilation? Class, respiratory, acidosis or alkalosis? Ano siya? Alkalosis. Ngayon, pag hypovent ka, hypovent, umiipon bang carbon dioxide? Yes, umiipon yan. Dadami bang acid? Yes. Kapag hypoventilation, class, dadami ang carbonic acid. Kapag dadami kasi di makalabas, therefore nurses class yan, ano yun? Respiratory acidosis. Kaya therefore, last correct. What is hyperventilation? Acidosis or alkalosis? What is hyperventilation? Acidosis, alkalosis. Answer? Alkalosis. What is hypoventilation? Respiratory acidosis. Question. O ang tanong, class, tiyatin ko tama ang sagot mo. Kumanda. Ang tanong, sige, sino ang bibigyan ko ng calcium glucarate? Acidosis, alkalosis. Ang sagot, answer is respiratory. Guys, live po na answer. Very good nurses. Sabi si class, ang sagot is very good nurses class. Ang answer is very good nurses class. Yan perfectly wrong. Tama ba? Okay, class. Perfectly wrong. Okay, kasi ang sagot is balikan. Ano bang effect ng calcium? Sa live natin, tama ang sagot. Sa Zoom po natin, mali ang sagot. Ha? Class, naku, class, ayusin nyo. Ha? Class, tingnan. Naku, class, tumino. Agad, class, ayusin nyo. Ako, malapit lang, may lisensya kang bago. Ang goal ng calcium is to decrease the heart, like the respiration. Kaya ang bibigyan mo is ang pasyente na nag-hyperventilate. Kasi ang goal mo is to decrease the respiration. Ayusin nyo, pag bulbulin ko palup yung tube nyo, tumino kayo, class, tingnan, ayusin. Answer, sino yon? Si alkalosis. Kapag ako sa hypervent ka, bibigyan ka ng calcium gluconate nurses to decrease your respiration. Naintindihan ba yan? Ano? Naku, tandaan niya na. Kasi pag NCLEX ka, tapos sinagot mo pa rin class, ganyan, bibigyan ng calcium gluconate, ang acidosis, lalabas na yung kamay ko sa screen ng monitor nyo. Pag sasakalin ko isa't isa para mga class, matandaan mo na ang sagot is alkalosis ang binibigyan para mag-decrease ang yung respiration. Naintindihan niya? Ano? Yes, tama. Nasa tandaan po yan, ha? Kailangan ka pa bang hampasin ng bombilya para maliwanagan ka? Ha? Ayusin yun. Ang sagot is, binibigay sa alkalosis to decrease the respiration. Tama ba? That's the reason to decrease your respiration. Bibigyan mo siya ng calcium gluconate. Tama? Guys, sabihin, madali po i-apply ang mga principle ito kapag naintindihan mo yung effect ng mga electrolytes. Tama? Okay, good. Bigyan mo si alkalosis. Kasi hyperventilate siya. Pag binigyan mo siya, ma-hypovent yan. It will decrease the respiration. Good. Okay, therefore, here we go. Kapag in-increase mataas ang calcium, increase or decrease alertness, ang sagot is, very good answer is, decrease in your alertness. Decrease what in your alertness. Tama? Kasi therefore, decrease in your alertness, guys. Decrease in your alertness, therefore, decrease, ha? Decrease mental alertness. Therefore, kapag decrease in your mental alertness, nurses, decrease mental alertness. Kapag decrease alertness, therefore, nurses, guys, anong tanda natin class recall? Kapag tumaas class anong class kanina, o insomnia, drowsiness. Ano yun? Drowsiness. That's the reason, guys, pag uminom ka ng gatas, nurses, tapos recall tingnan, inaantok ka kapag ka ng gatas kasi milk is high in calcium. Kaya the best time to drink your milk, kailan, nurses class? Morning or evening kapag in case you are an adult? Kailan na? Very good, evening. To induce sleep. Tama? To induce your sleep para makatulog ka. Tama? Yes, ano? Yes, tama ba? Okay, therefore, kaya alam mo na, nurses, ha? Anong gagawin mo para makatulog yung jowa mo, nurses class, ha? Anong gagawin mo, ha? Alam mo na, class, ganting na, bibigyan mo ng, ano yon? Calcium. Again, class, bigyan mo siya ng gatas, ha? Nurses, bibigyan mo, ano, breastfeeding. Breastfeeding is the best baby after 37 years old. Bibigyan mo ng milk, ha? Breastfeeding, bigyan mo siya ng milk, ha? Yung bata, nurses, kapag breastfeeding, mataas yung immune system. Kaya tandaan mo, guys, nurses, kapag para class, ang boyfriend mong sakitin, alam mo na, class, again, ang pinagbabawal na technique para tumaas ang kanyang immune system. Anong kailangan? Breastfeeding. Breastfeeding na ba? O, tandaan ka. Here we go, tingnan ito yan, ha? O, class, recall, class, drowsiness. Ibig sabihin guys, nurses ha, okay kasi na, ibigay mo yan. Kaya tandaan palagi guys, yan ang dahilan, alam mo na ang purpose kung bakit dalawa yung breast mo. Ang isa kay baby, ang isa kay daddy. Huwag madamot. Tama ba? Okay nurses. Huwag madamot ha. Ang problema ngayon nurses kay sa panahon ngayon, dapat puro kay baby. Ang problema nurses, lahat yan puro kay daddy. Ang baby nurses, puro na lang nurses. Again, puro na kas ang baby, naka-formula feeding na. Si daddy na lang ang nag-breastfeeding. Yung bata sakitin, yung daddy mataas yung immune system. Okay, tandaan yan. Okay, bakit si kumpare na kasama ha? Kung hindi kasali si kumpare ha? Bakit si kumpare sinali nyo? Si kumpare. Class kita na. Okay, therefore class, here we go. Now, dito guys, tandaan, drowses. Therefore class, kapag tumaas ang calcium mo, di ba? Decrease alertness. Therefore, drowsiness, ano kasi magkaroon ng lethargy? Lethargy. Alam ba yung letter G guys? Letter G. Ano bang letter G? Next to letter F. Ano letter G? Next to letter F. Letter G? Next to letter F. Ang class ganun. What is letter G? Class ganun letter G. Class ganun. Ang letter G na ba yung class ganun? Sir, gumising ka. Gumising ka. Letter G kasi para kasi occasionally sleepy. Okay, sleepy kasi palagi ka lang inaantok, letter G yun. Kapag in a case class difficulty in arousal, kapag difficulty in arousal class, ang tawag doon, letter A, letter B, letter G. Letter G ang tawag doon. Tama? Sir, ang boyfriend ko mahirap i-arouse. Naku, hindi po letter G ang tawag doon. Class kina, iba po ang problema noon. Tama? Bigyan mo siya ng drive max. Drive. Bakit may drive max? Kasi hindi po calcium ang problema noon, nurses. Ha? Hindi po calcium ang problema noon. Tama? Okay, kapag mahirap siyang i-arouse. Tama ba? Okay, tingnan ha? Okay, therefore, here we go. Now, again, kapag tumas ang calcium, class, decrease contraction, muscle weakness, muscle spasm, weakness or spasm, muscle weakness or muscle spasm. Answer is? Okay, very good class. Answer, muscle. My guard. Weakness ba? Answer? Muscle weakness. Manghihina ka. Tama? Kaskin mahina. Muscle. Weakness kas muscle weakness. Manghihina ka. Bakit? Matutuyo ang flower garden. Tama? Matutuyo ang Garden of Babylonia. Tama? Okay, nurses class ha? Hindi pwede class again. Manghihina ka kapag kulang, kapag class sobrang mataas ang calcium. Muscle weakness. Manghihina ka. Tama? Yes or no? Yes, tama. Therefore, class again, tingnan ngayon, muscle weakness, kaya nagkaroon ng fatigue, yes or no? Yes, if your weakness, also if your fatigue. If your fatigue, wala kang ganang gumanaw, you have your fatigue. Yes, if your fatigue, of course, and fatigue also kasi your apathy. Weakness, fatigue, if your apathy, of your apathy. Tama ba? Okay, apathy. Plus, again, recall, guys, tandaan. Effect po yan ng inyong calcium, ha? Okay, therefore, again, muscle relaxation. Question. Pag hypercalcemia, saan maraming calcium? Bone or blood? Bone or blood? Answer. Bone or blood? Bone or blood? Answer. Saan maraming calcium? Bone or blood? Answer ko, isaan? Ulit, saan sa? Blood. Kapag maraming sa dugo, ibig sabihin, maging bato lang ba yan? Yes, maging bato yan. Complication, renal calculi. Kidney stones. Good. Kidney stones, ha? Kidney stones, class ng mga renal calculi, mga kidney stones yan. Kapag uminom ka ng gatas, anong gawin mo? Samahan mo ng maraming tubig. Tama? Renal calculi. Renal calculi. Kasi renal calculi. Tama ba? Alam mo kasi renal calculi. Complication is kidney stones. Renal kasi renal calculi. Tama? Maging bato lang po yan. Ha? Kapag nasubran ka ng calcium, guys, again, kidney stones po yan. Tama? Okay, good. The focus, here we go. Now, class, ito na naman. Class, kapag kulang ka ng calcium, kapag kulang, walang guard. Pag walang guard, walang guard. Contraction, walang guard. Masaya ka na? Yes. Bakit? Kasi mayroon bang pumping? Yes, ano? Yes. Kaya pag may pumping kasi, huwag mo lang palagpasin. Bakit? Kasi minsan na ito mangyari. Kaya therefore, kasi ganyan, kapag hypocalcemia, ibig sabihin, class, kulang ka ba ng calcium sa blood? Yes. Bakit kulang? Saan pumunta ang calcium? Saan pumunta? Saan pumunta ang calcium? Wala sa batang road trip, ayusin nyo. Saan pumunta? Kulang ka sa blood. Pag kulang sa blood, saan pumunta? Pumunta saan sa? Fergus, sa malaki mong buto. Andun sila sa bone. Saan sa, anong bone? Saan sa bone? Pumunta sa bone. Kapag pumunta sa bone, masigla ang muscle mo. Kapag once masigla, therefore class can recall, walang guard. Therefore class, it increases muscle contraction, guys. Increases muscle contraction. Increase muscle contraction, guys. Increase muscle contraction. Tama ba? Muscle contraction. Therefore class again. Kasi guys, ando na naman siya sa malaki mong buto. Increase muscle contraction. Tama ba? Okay, good. Ibig sabihin, increase muscle contraction, that is irritability. increase muscle irritability. Plus again, sobrang napaka-hyperactive ng muscle mo, increase muscle irritability, irritability. Tama? Irritability, increase in muscle contraction. Tama? Okay, good. Here we go. Ano ang tandaan natin, guys? Because RNC nga now. Ang ibig sabihin, guys, when you answer the exam, kasi yung RNC, here we go, kasi kanina, para mo ito palagi, guys. Again, here we go. Kapag in the case again, hypercalcemia, kapag again, hypercalcemia, kapag hypercalcemia versus hypercalcemia, decreased muscle contraction. Kapag hypocalcemia, doon siya sa muscle, increased muscle contraction. Tama? Here we go. Okay, ano yung makita natin? O, tachybrady. Tachybrady, walang guard. Tachybrady answer? Very good, tachycardia. Tachycardia, pwede din your tachycardia. This is your tachycardia. Good, I think that's it will increase your heart rate. Yeah. Now, pag sa exam, therefore, what are the two electrolyte imbalance that causes tachycardia? Sino ang dalawang electrolyte imbalance that causes your tachycardia, guys? Again, sa live po natin, sorry, hindi nyo po nakita sa yan, ha? Basta, guys, sa live po natin, guys, tinakpan, increase contraction po yan. Okay, class. Ano yun? Hypocalcemia in hyperkalemia. Hypocalcemia, hyperkalemia. Good. Again, here we go. Now, nurses na ko, alam mo, guys, nurses, ang gagaling na how to analyze the question. Kung ganun ang way you how to analyze the question, guys, maniwala ka. Sunod-sunod yan, mag-shot on the question 85. Galingan nyo lang, guys, sources how to answer this question. Here we go. Now, dito, pag increase the focus, hypervent, ano ka? We're getting hyperventilation plus hyperventilation plus hyperventilation. Increase in your respiration, hyperventilation, increase in your RR. Tama ba? Increase in your respiration. The focus ko dito na hyperventilation. Sir, hyperventilation plus hyperventilation. Tama. Okay, hyperventilation plus recording nga ngayon. Oh, increase again in your contraction. The focus, increase the focus. What will happen? Okay, increase or decrease alertness answer? Very good. Increase in your alertness. Increase mental again alertness. Tama? Increase mental class again ito alertness. Increase alertness for nurses class. Ano ibig sabihin? Now, class to recall. Nurses, guys, use RNs. Insomnia or drowsiness? Insomnia, drowsiness. Anong sagot? Answer is very good. Let's keep going. And very good. Insomnia. Okay, guys, insomnia ka lang. Insomnia. Give your insomnia. Tama? Hindi ka makatulog. Tama? Insomnia. Bakit? Nurses, iniisip mo na ang jawa mo kapag kulang ka ng calcium. Kawa ng insomnia. Di makatulog sa gabi sa kaiisip. Sa diwa man ikaw ang aking panaginip. Ibig sabihin, guys, kapag kulang ka ng calcium, magkaroon ng insomnia. Tama ba? Okay, class again. Class again, recording nga ngayon. Oh, class insomnia. Magkaroon ba ng restlessness? Yes or no? Yes. Pag restless ka, I don't say kaskit ka sa rest, gumaganon ka. Restless means napaka-busy ng utak mo, parang palengke, restless ka, ang dami mong naiisip. Natari ba minsan na kasi kahit nakatulog ka, pero yung utak mo kasi pagising mo pagod na pagod ka kasi kagabi nag-iisip ka, ano kayong gagawin ko bukas? Diba? Paano kayo kasi papunta sa test-taking area ko para hindi ako malate? Habisin, restlessness ang tawag doon. Diba? Kaya sige tingin, restlessness. Yung restlessness is hypo. Kasi restlessness, ha? Restlessness. Restless ka po. Diba? Okay, here we go, class again. Sign again of your increased irritability. Guys, here we go. Okay, so ano ka? Class. Muscle weakness, muscle spasm. Guys, yours are answer. Analyze, walang guard. Weakness, spasm. Answer, muscle. Good. Magkaroon ka ng muscle spasm. Good. Muscle spasm. Guys, good. Naku, ang gagaling, guys. Muscle spasm. Bakit? Due to hyper contraction, muscle spasm. Minsan napupulikat ka. Therefore, kasi nga na, kasi may jawa mo, kasi nga na, nagka-hypocalcemia ka, kalagitnan sa bisag bitang, nag-cramps ko, be? Nagkaroon ka ng leg cramps. Nagkaroon ka ng leg cramps, napulikat ka, leg cramps. If your leg cramps, sama ba? Maroon kang leg cramps, sama ba? Okay, therefore, kasi anong rule? Kaya saan ang leg cramps? Hyper o hypocalcemia? What electrolyte imbalance? Answer? Hypocalcemia. Tama? Okay, hypocalcemia. Tama? Okay, here we go, class again. Kapag mag-cramps ka, this is one of the cause. Again, guys, tandaan again sa exam. Nurses, anong rule? Kapag when you answer class again, have you seen class your entrance exam? Kapag muscle weakness, ano yan? Hypercal. Kapag muscle spasm, hypocal. Tama? Okay, ulit ko. Pag muscle weakness, hypercalcemia. Pag muscle spasm, hypocalcemia. Tama? Okay. Plus, again, recall nurses, alam kong gumagaling ka na. I-increase yan in your contraction. Tama ba? Kapag increase the focus, contraction, the focus, o ngayon, alam mo to. Anong side, guys, nurses? You tap the face near the earlobe. Pag you tap the face, press ko ng facial, o twitching. Voluntary, involuntary. Ano yan? involuntary. Kapag facial twitching, tawag na reverse your cheek. Chivostic. Kapag cheek, chivostic. Kapag your vostik sign ha. Reverse your vostik. Tapos kaya reverse water ng sign yan. Reverse your very class in vostik sign. Tapos reverse vostik sign ha. Vostik sign is in vostik sign. Tama ba? Okay, the forecasting yan. Vostik sign. What is vostik sign? Reverse the facial twitching. Facial twitching. Ang facial twitching represents your vostik. Facial twitching. Facial twitching represents your vostik sign. Tama? Represents your vostik sign. Tama ba? Okay, here we go kasi recall now. Ang vostik, you tap the face near the earlobe, saka po nagkaroon na ng facial twitching. Now, ito masaklap. Kaya tayahan mo lang po saan gumaganon. Class, extreme facial twitching. Mataon na gumaganon. Class, pumunta ka sa bahay ng girlfriend mo. Lola, ano ba, yung apo mo, Lola, tayo nasampal sa tuloy ng Lola, bakit involuntary yan? Class, facial twitching. Kapag facial twitching, class, ang tawag ito refers to extreme, tawag tetanay, tetanong. Tawag ito, tetanay. Refers to tetanay, ha? Kay tita to, hindi kay tito. Ha? Tetanay, ha? Tetanay. Tetanay sa palmos. Tetany, ha? Tetany, Sir Palmus. Tetany. Ano bang tetany? Kasi tetany. Ang tetany kasi yung reference hindi tetano, ha? Tetany po ito, ha? Tetany, Sir Palmus yan, ha? Okay, kasi tetany. Extreme facial twitching. Sobra-sobra extreme facial twitching, guys, ha? Extreme facial twitching, guys. Extreme facial, ha? O extreme facial twitching, guys. Sige, tingnan, ha? Okay. Extreme facial twitching, ha? Okay, napagkamalan mo kasi, akala mo kasi Sir Palmos nagka-twitching siya. Akala mo kasi manyakis. Yun pala kasi involuntary pala. Nasampal siya tuloy. Tama? Plus extreme facial twitching, guys. Involuntary. Nakulangan lang pala siya ng calcium. Extreme facial twitching. Kaya alam mo na pala kasi ang boyfriend mo, class, ha? Kapag gumanon ka sa nurses, ha? Ibig sabihin, nurses na kumaawa ka, ha? Upper both breasts simultaneously. Class to compensate the calcium. Here we go, class kid. Extreme facial twitching. Extreme facial twitching. Nurses kasi yan. Ito yun. Matatapos nurses ang MS series nurses na hindi nyo na igagalang si Sir Palmos. Tama? Bawi-bawi lang. Bawi-bawi lang. Okay, here we go, class kid. Itong sign again recall. Here we go. Now, class. Anong sign yung class kid recall? Ito. I-wrap po ito ng BPK. Pag-wrap mo, class, it was carpopedal spasm. Ito, ha? Carpopedal spasm, guys. Gumagano'n siya. Pag irap mo to, ito take the reverse to ano yan, your very good tas TNT, truso. Sabi ko, truso. Sabi ko, tingin sa class, tingin tas, ang tawag ito, truso. Dapat ganon yan. Carpopedal spasm. Sabi ko, ganon yan, truso. Dapat ganon. Hindi ganon, ha? Class, iba yun, ha? Sabi ko, ganon, ha? Hindi po ganon, ha? Class, hindi pwedeng ganon. Matutulpo ka. Iba, class, gana. Ganon. Sir, mag-BP ang kamay, sir, ang pasyente ka ganon. Balik tarin mo, ha? Hindi ka ganon siya. Dapat carpopedal spasm. Hindi po ganon, ha? Okay, therefore, class, kapag nakita mong gumaganon yan, baka hanapin mo ang student nurse. Ma'am, gusto ko si ano? Sino yung nurse, ma'am, na magaling yung, kasi na may ganon po siya kahit, si yung Wong at apelyido nun. Anong Wong? BJ. Ano? BJ po. Yung anong BJ? Buko juice po. Kasi kita na. Okay, meron siyang T. Truso. Ha? Truso. Truso po ang pag-review. Truso. Your truso. Tama? Okay, truso. Ha? This is your truso sign. Ha? Truso. Tama ba? Your truso. Okay, now here we go. Sa truso, ano bang truso? Truso. Truso stands for carpopedal, ha? Carpopedal spasm, guys. Carpopedal spasm. Tanda na gina? Okay, nurses, carpopedal spasm. Tama ba? So, maganda pala kapag ang boyfriend mo may hypocalcemia at may Parkinson's disease. Malamang hindi mo na iiwan ito. Lahat ito involuntary. Maring gusto mo pero hindi po nila yan kagustuhan. Involuntary po yan, ha? Okay, carpopedal spasm, ha? Carpopedal. Kasi carpopedal spasm, carpopedal spasm. This is carpopedal spasm. Saan ba kasi recall, ha? Saan ba ang truso? Saan? Sa kamay, sa paa? Okay, ikaw, papayag ka ng paa ang gagamitin? Siyempre, hindi. Sa kamay. Paa ang ginamit. Kasi carpals, isilig sa kamay. Carpopedal spasm, ha? Carpopedal spasm. Okay, therefore, class again. Ibig sabihin, guys, again, lahat ng irritability that is due to hypocalcemia. Kaya tandaan naman, padakalimutan mo, pag may guard, decrease contraction. Pag walang guard, increase contraction. Kasi increase again ang contraction. Tama? Tandaan po yan, guys, nurses, ha? Okay, guys, alam mo na, class, in the case, you have your hyper, you have your hypo, kasi may guys, tandaan para makatulog yung jowa mo. Therefore, bigyan mo ng gatas sa gabi. Tama? Yes, very good. Para in the case naman siya, magkaroon ng insomnia, nurses, at magkaroon siya ng twitching, nurses, class, ibig sabihin, class, ibagsak mo rin ang kanyang calcium. Tama? Okay, here we go. Class, kanina, Sinong acid-base imbalance bibigyan ng calcium gluconate? What acid-base imbalance by calcium gluconate? Sino yun? Answer, respiratory alkalosis due to hyperventilation. Tama? Okay, good. Let's manage guys kasi patapos na po tayo dito. Here we go. Class, tandaan ha? Okay, tandaan guys, sources na ngayon. Here we go. Now, kapag sa exam guys, USRN, second class can recall this will be a short month's plan of care. Siyempre, pag kulang dalagan, pag sobra, pawasan. This is your plan of care. Ano pong gawin natin kasi plan of care, ha? Okay, plan of care. What is the management guys? Intervention. Plan of care kapag may hypocalcemia. Kapag kulang ka, calcium. Kulang ka ng calcium. Tama ba? Okay, kasi kintingan, kulang ka ng calcium therefore nurses. Here we go. Class number 1 class 2 ngayon class, kulang ka ng calcium. Sa live po natin guys, shout out kasi kay Ma'am Melissa Ann. Okay, class all our class. Thanks for visiting po Ma'am Melissa. Thank you pa for dropping by. Ha? Okay, here we go class kina. Kapag kulang ka ng calcium. Here we go. Now class, sige. Class, pag kulang dalagan, pag sobra bawasan, ano ang diet mo guys? Kapag hypocalcemia, what's your diet? Answer is, answer? Again, high in calcium. High in calcium plus high in calcium plus in high calcium plus in high calcium. Ako sir, high calcium plus. Tama ba? High in calcium. Tama ba? O ngayon, here we go. Alam mo, high in calcium guys includes those of the milk. Milk in dairy products. Milk in dairy products. Some milk in dairy. Milk in dairy. Kasi pag milk versus again, milk in dairy guys. In milk and in dairy. Now, pag dairy kasi ko, kasabay na agad ang ano, kasabang cheese. Yes or no? Yes. Yogurt. Yes. Class na cheese sige na yogurt cheese sige class yogurt. Yes or no? Yes. Class cheese curls. Hindi kasali po 'yun ha. Okay, tandaan po 'yan again. Class cheese snack hindi din kasali po 'yan ha. Okay, kasi for class nga. Ito class again yan. Yep, milk and dairy products again high in calcium. Anyway, question. What is the cheapest source of calcium? What's the cheapest source of calcium guys? Sige na. Ano ang cheapest source? Anong pinakamurang source ng calcium? Sige guys, anong sagot sa NCLEX guys? Kapag lahat again class again dito high in calcium, anong pinakamurang source ng calcium? Ano mik ha? Bakit may mik kasi yung mik nurses, yan yung shabu kapag bata ka pa, tama ba? Yan shabu kapag bata ka, inihigop mo. sa mukha mo, di ba? Wala kang magawa sa buhay, minsan hinihipan mo, di ba? Yan yung shabu kapag bata ka pa, mik. Okay, class. Kaya nang bata ka pa, nurses class, by prospect ka na maging drug addict, ha? Kaya lumaki ka, natukhang ka. Kaya nang bata ka, pinag-practice mo yung mik. Okay, class, here we go. Okay, class, kaya cheapest source is very good, nurses. Ang sagot, guys, very good. Ang paborito mong anchovies. Anchovies, basta siya anchovies. That is the cheapest source of calcium. Ano yun? Dilis. Alam mo yung dilis, guys, diba? Kay social, diba? Dilis. Kaya kapag inakiskin mag-breakfast ka, hello bes, kamusta naman? O, breakfast. Ang breakfast mo ngayon, ito, scrambled egg with anchovies. Pinasosyal mo lang, class, dilis lang pala yung ulam mo. Klaskin, anchovies, ma'am? Okay, klaskin, anchovies. Dilis lang po yan. Kaya pala guys, ng bata po, palagi ko pinapagalitan tatay ko, anak, ubusin mo yan. Ano po? Yung dilis, huwag ka magtira. Yung ulo ng dilis na yan, 10 baso ng gatas equivalent na yan, ha? Kasi napaisip ko ng bata ko, paano kakasya yung gatas sa ulo ng dilis? Yun pala guys, siya pala ang pinakamurang source ng calcium. Pero guys, kung isipin mo, ang mahal na rin ng dilis ngayon, tama ba yes or no? Yes, tama? Okay, kasi ganyan na, anchovies, tama? Okay, syempre kasi ang mahal na rin ng dilis ngayon, tama ba? Okay, good. Again, guys, ang paborito mo, anchovies, ang paborito mong dilis, tama? This is the cheapest source of calcium. Ang mikmik piso lang. Piso lang na taba. Okay, get therefore, here we go. Guys, again, class gettingan. Dito guys, this anchovies. Sama. Okay, class, congrats po kay Ma'am Melissa Ann. Again, all our class gettingan passers po natin sa team live po natin dyan. Again, class 2, class may class 31. Okay, congrats po again, Ma'am. Again, Ma'am Melissa. Guys, thanks for dropping by. Okay, thank you po. Salamat po for being here. Thank you. Okay, class. Okay, sige tingnan. Now sa choices, kung may mikmik at dilis nurses, wag mong isagot ang mikmik ha. Nako kasi na, ang sumot ang mikmik kasi sa exam nako kasi ayusin yung nurses ha. Okay kasi na, kasi dapat walang sumot ang mikmik ha. Okay kasi mikmik talaga. Kasi ganyan. Notice your bakit mikmik ang pangalan? Alam ba yung tawag na mikmik 'yon? Bakit mikmik ang tawag doon guys? Kasi guys, ang mikmik kasi milk yan. Nang bata kasi bulol ka. Kaya pag bulol ka sa milk. Kasi guys, pag bata ka, bulol ka. Pag niyog yun, di ba? Pag milk, kaya milk, sabi sin class, kaya milk ang tawag po dyan. Tama? Okay, class na. Okay, therefore, this is class includes that is your high in calcium. Ano pang rule? Again. Now, ito pa kasi again. Now, class. In a case again class, sabi sin class yan. Ito yun. Now, class. Anong rule? Class, in a case kapag kulang ka ng calcium, dapat it must be high in calcium. And take note, nurses, as high in calcium. Recall of this concept, guys, again, nurses. Again, recall, tingnan na. Class, high in calcium. Therefore, class, high in calcium. And take note, nurse, number 2. Class, number 2, class number 2. Here we go. Now, kapag kulang ka, therefore, class, recall, anong rule? Pag kulang dadagan, pag sobra bawasan. Class, recall, high in calcium. Anong vitamins ang kailangan mo para ma-absorb ang calcium? Anong vitamins kailangan mo, guys? Anong vitamins ang kailangan mo? Again, class, ha? Anong kailangan mo, class, again? Vitamin? Very good, guys. Nurses, you need to increase your vitamin D. Again, vitamin G, kasi vitamin D, ha? Vitamin D po, ang kailangan mo, vitamin D. Tama ba? Okay, class, vitamin D. Tama ba? Okay, therefore, class, ano bang vitamin D? Vitamin D is calciferol. Calciferol. Calciferol is your vitamin D. Calciferol is your vitamin D. Good. Again, class, bakit ang vitamin D? Nurses, vitamin D absorbs calcium. Absorbs what? Absorption of your calcium. Actually, guys, it absorbs calcium in the bone. Absorption what of your calcium what in the bone. Plus vitamin D. Kaya sabihin dito, yung pag bumili ka ng mga calcium supplement mo, mayroon siyang, for example, Calciaid with vitamin D3. Palaging may vitamin D yan. Tama, mayroon palaging may vitamin D. Tama? Okay. That's again, absorption what of your calcium. Tama, of your calcium. Tama? Okay. Therefore, syempre, kasi of course, there's a calcium supplement. Plus calcium supplement. Plus calcium severe supplement. Take your calcium kasi take your calcium supplement. Tama? Okay. Take your calcium. Tama? Okay. Take your calcium supplement. Tama? Okay. Tingnan again. Here we go. Now, in a case, again, tanda again, recall nurses, guys. Pag may hypocalcemia ka, guys, there's hypocalcemia, tandaan, pag class kulang ka ng calcium, anong rule kapag kulang ka ng calcium? Guys, avoid milk. Avoid coffee. Alam ko guys, avoid coffee. Sir, bakit avoid coffee, guys? Bawal ang coffee. Alam ko bakit bawal ang coffee, guys? Kapag inakis ka calcium, bawal ang coffee. Alam ko bakit? Coffee is diuretic. If it is a diuretic, guys, ano nangyari? The coffee, it eliminates your calcium in the urine. Kaya that's the reason, guys, pag palagi ka nagkakape, pagkakape ka nurses palagi, guys, dapat nagagatas ka rin. Kaya dapat, guys, bakit? Kasi rumurupok po yung buto mo, guys, nurses. Kapag kape ka ng kape, walang gatas. Kasi lumalabas ang calcium through your urine, through your diuretic. Tama? Avoid coffee. Tama? Avoid coffee. When you are taking your calcium, coffee latte. Tama? Ito nakakatuwa kasi palagi, di ba? Ano sabi ng coffee latte nyo class again? Dito ngayon, ang sabi niya, ang dating creamiest. Ngayon, creamier. Ay, pambira, nagulo yung bata, guys. Ano bang nauna? Di ba? Nauna ang dating creamiest, ngayon creamier. Ang dating pinakamasarap, ngayon masarap na lang. Kasi nawala sa advertise, di ba? Okay, sabihin kasi nga na, okay, kasi minsan wrong grammar. Wrong grammar. Sino ka ng director ng advertise na yun, tama? Ang dating creamiest, ngayon creamier. Ang bumaliktad yun. Ang sabay coffee. Bakit? This one, it excrete, ha? Calcium through the Refit na ba? Okay, klase B ko. Klase na. Okay, das nawala, di ba? Okay, may nakapansin ha? Nagreklamo ang DepEd ha? Tuturuan yung mga bata maging bobo. Dating creamiest, ngayon creamier. Tama, okay, here we go. Klase tingnan. Here we go. This one, it excrete calcium through urine. Excrete calcium. Excrete your calcium kasi guys through diuresis. Through diuresis. Nilalabas niya through your urine, ha? Through your urine. Kasi ihi ka pag nagkakape ka, ha? Through diuresis. Okay, that's why guys, tandaan palagi dito ngayon, ha? Okay, therefore class again, ito, in a case, this will be class as your, again, hypocalcemia. Therefore, here we go, class, ano pa guys? And that again, dito ngayon, ano ang rule guys for you will give your calcium? Now, kapag nagka-calcium ka, therefore guys, anong gamot kailangan mo kapag kulang ka ng calcium? Kapag kulang ka ng calcium, where's the drug of choice? Kapag kulang calcium guys, anong gamot? Bibigyan ko ng jacket. Hindi class. Bigyan mo ng answer? Ang sagot is, answer. Bigyan mo ng answer. Ano yun? Bigyan mo ng very good nurses class. Wala na naman akong kausap. Hoy, mag-type kayo. Ang hayop na to. Ang sagot is, answer, calcium, gluconate, calcium, gluconate, calcium, gluconate. Tama ba? Okay, bigyan mo ng calcium, calcium. Tama ba? Calcium, gluconate. Bigyan calcium, gluconate. Tama ba? Okay, calcium, gluconate. Guys, anong rule? Ano palagi? Diba? Binanggit ko last time. When you give calcium gluconate ang rule, never give calcium in saline solution. Diba? Never give calcium in saline solution. Never give your calcium. Calcium kasi where? In saline. in saline solution. Ibig sabihin sa NSS, huwag kang bumigay niyan if your IV is NSS, saline solution. That is your NSS. Sir, bakit therefore, bakit bawal? Anong rule bakit bawal? Kasi, anong NSS? Sodium loses calcium. Good, tama po yan. Kasi nga sabi nyo kasi sodium loses calcium. Sodium kasi sodium loses your calcium. Loses your calcium. Kaya class, tandaan class, kapag nag-exam ka class in this July or August, when you give calcium conate, it must be given in D5 containing IV. D5 containing D5 containing D5 containing. D5 can D5 containing. Tama? The best IV guys. Wala na akong audio guys. Wala na akong audio. Wala. May audio ba ako? Wala. May audio ba? Yes, you know? May audio ba? May audio ba? Narinig ba ako? Could you hear me po? Meron. Okay, meron. Tama? Okay. Kasi meron. Okay, the forecast can dito. D5 contain in IV. Guys, the best IV for this one is yes, D5 water. D5 was D5 water. D5 water is the best IV, guys, when you give your calcium gluconate. Basta bawal ang NSS. Bawal agad ang NSS. Tandaan mga class, mga points to remember class, one of the manners in safety when you give this electrolytes. Tandaan ha? Okay, can never give calcium again in saline solution. Bakit class sabi ko, class sodium, it loses your calcium. Tama? Okay, therefore class sodium loses calcium, loses your calcium. Tama? Okay, guys, tandaan po yun guys first. So here we go. Now, last one is class in the case of your hypercalcemia. Guys, almost patapos na po tayo class. Here we go. Ang class again, last one is one class in the case of the hypercalcemia. Hypercalcemia. Here we go guys. Again, last one is one guys. Again, after this one class, mag short break tayo with the start concept already with your class with regards again to your concept with your class cardiac disorder. So here we go class. Here we go. Dito ngayon. Sir, plan of care, hypercalcemia. Ngayon guys, tandaan again. Ngayon, kapag hypercalcemia guys versus, anong diet natin? Sige, what is your diet? What will begin as your diet class? Ano class kan dito ngayon? Ano ang iyong diet class? What will begin as your diet, guys? Again, use RNs. Ang diet mo, it must be very good, low in calcium. Low in calcium plus low in calcium. Dapat low in calcium. Bawal sa'yo ang paborito mong mikmik, ha? Okay. Low in calcium plus low in calcium diet plus low in calcium. Tama ba? Okay, good. Low in calcium. Tama ba? Okay. Low in calcium, guys. Low in calcium, therefore. And anong sodium natin kayo na? Para bumagsak mas ang calcium, you have to give, ano siya, it must be high in sodium. High in sodium. Low in calcium, pero dapat siyempre, high in sodium. Kasi pag ginas ko yan, sodium loses calcium. Sodium loses calcium, again, high in sodium, plus high in sodium. Tama ba? High in sodium. Tama ba? Okay, therefore, class, low in calcium, high in sodium. Tama ba? Okay, good. Therefore, class, here we go. Ayan. Dito guys, again sa exam, again, we call, look at this one, nurses class yan. Ito yan. Class, in a case kapag may hypercalcemia, mataas ba ang hypercalcemia? Mayroon ba siyang renal calculi? May kidney stones? Yes. Kapag may kidney stones fluids, increase or restrict fluid intake? Increase or restrict? Increase or restrict fluids? Answer is, answer niya. Very good. And second answer is, very good. Increase fluid intake. Ngayon, bakit plus may renal calculi? Ngayon, unik, alam kong gumagaling ka na. Ano ang dalawang electrolyte imbalance na kailangan mo ng increase fluid intake? Sige, dalawa yon. Let's continue ngayon. Okay, kasi recocos ngayon. Right minus wrong. Sinong dalawang increase fluid intake? Answer. What's the answer? What's the answer? What's the answer? What's the answer? Answer? Okay, answer is good. Hypernatremia. Isa pa. Good. Answer. Hypernatremia. Sir, isa pang hypernatremia. Ayusin nyo, tumino kayo, ha? Kasi inulit nyo. Ang sagot, answer is hypernatremia and hypercalcemia. Hypercalcemia. Sila ang kailangan ng increased fluid intake. Increased fluid intake. Hyperkalemia, hypercalcemia. Dito kasi ito, increased fluid intake. Sir, class, can recall, o class 6 class, increased fluid intake. Ibig sabihin, sir, bakit kailangan ng increased fluid intake sa hypernatremia? Ano ang purpose? Bakit class increase ang fluid? Sa hypernatremia, to dilute sodium. To dilute your sodium. Kasi sabi ko last time guys, is kapag yung niluto mo sobrang alat, magdagdag ka ng tubig. Tama ba? Plus, what in the case of hypercalcemia, ang purpose is to prevent renal calculi. Para hindi ka magkaroon ng so, ha? Prevent renal calculi, kidney stones, prevent renal calculi. The purpose is to prevent renal calculi. Tama ba? Okay, therefore, here we go. Look at this one. What is calcium, guys? Ano bang calcium? Acidic alkaline. What is calcium? Acidic alkaline. Ng calcium, acidic alkaline. Ang sagot is, ano siya? calcium is alkaline. Calcium again is alkaline. Since alkaline, kasi again, ano ang calcium? Anong calcium? Alkaline. Ha? Alkaline ang calcium. Since alkaline guys ang calcium, therefore, ibig sabihin, anong kailangan ko na vitamins? Kapag hypocalcemia, vitamin D. Kapag hypercalcemia, guys, vitamin C. Vitamin C. Guys, tandaan again. Recall, kapag hypocalcemia, vitamin D. Kulang ka ng calcium, DDD, down. Pag hypercalcemia, vitamin C, vitamin C. Vitamin C. Ano purpose, guys? Ang purpose is to acidify the urine. To acidify the urine. To acidify the urine. To acidify the urine. Tama ba? Acidify what? The urine. The urine. Tama? Okay. Yung focus. Last sabi kasi bago tayo mag-short break. Here we go. Let's again recall. Ito na ngayon. Guys, again, syempre, ano po again ito ngayon ang gamot, guys? Anong gamot? Drug of choice, dalawa po yan. The first drug you would give again for number 1 is you have to give your class MM drugs. Give your MM drugs. MM class drugs. The first M plus M stands for M. You have to give the first M stands for. Bigyan mo siya ng M. M stands for M, metrocin. Stands for M, metrocin. That's in metrocin. Ha? You have your metrocin. Sir, what is the purpose of metrocin? The metrocin, it blocks the parathyroid to absorb calcium in the blood. Remember guys, ang parathyroid increases the calcium in the blood. So therefore, it blocks again the parathyroid. It blocks the parathyroid. It blocks your parathyroid. Blocks again parathyroid. When para sa parathyroid again, parathyroid again, to absorb calcium in the blood. To absorb your calcium where in the blood. Calcium where in the blood. Tama? Okay, plus in the blood. Tama? Kasi hypercalcemia. And the second drug stands for M. Guys, kailangan mo ito M, magnesium sulfate. Magnesium sulfate. Yeah. Let's can recall magnesium sulfate. Therefore, kasi can recall na, ano ang purpose kasi na magnesium? Magnesium, guys, again, tingnan. Kaya palaging magka-antidote yan. Magnesium sulfate, calcium gluconate. Pag nasobra ka ng magnesium, bigyan mo ng calcium. Pag nasobra ka ng calcium, bigyan mo ng magnesium. Bakit magnesium? Maintains calcium in the bone. Kasi maintains calcium. Maintains calcium in the bone. Maintains calcium what? In the bone, in the bone. Guys, again, for last sabi guys, pakinggan na buti ito guys, maintains calcium in the bone. Ito yun. Recall. Let's connect guys, bago mag-end ang topic natin for this phase electrolytes. Where is calcium abundant? Bone or blood? Saan? Bone. Saan sa bone? What vitamins absorbs calcium in the bone? Sagutin na mabuti, team live po natin. Sagutin answer? Vitamin D. What maintains calcium in the bone? Ano yun? Answer? Magnesium. What maintains calcium in the bone? Answer yes? Magnesium. Ngayon, pakinggan na mabuti. Now, itong calcium, dapat dito siya sa bone. Class, mas marami sa bone kumpara sa blood. Pero minsan guys, again, there's again tingnan, class, anong ginagawa kasi ng magnesium? Now, yung magnesium, pinapanatili niya na ang calcium, andyan lang siya sa bone, hindi pupunta sa blood. Pero minsan, ang calcium pasaway. Ang calcium pupunta sa blood. Sabi niya kay calcium, "Hoy magnesium, bakit? Gusto kong pumunta sa blood." Ha? Huwag kang pumunta doon. Bakit? Huwag kang pumunta, maging bato ka lang, maging rena ka, kulay ka. Ayoko. Gusto ko pumunta doon. Ang pasaway, ayaw ko nga. Huwag kang pumunta doon. Ang calcium minsan kasi case pasaway yan. Lalabas minsan ang calcium, pupunta yan sa blood. Pag pupunta sa blood, tawag hypercalcemia. Since hypercalcemia case your cells, ang lagay ng magnesium. Kapag pumunta sa blood, walang magawa si magnesium, kundi sunduin niya ang calcium sa blood. Kapag tumaas ang calcium sa blood, magpadala ka ng magnesium para ibalik niya ang calcium sa bone. Kasi ang goal ni magnesium is to maintain calcium in the bone. Kaya alam mo na guys, your cells, kapag may hypercalcemia, tumaas ang calcium sa blood, anong ipapadala mo para sunduin siya? Pasundo mo kay magnesium. Magbigay ka ng magnesium sulfate. Ang purpose, para i-maintain niya ang calcium pabalik sa bone. Naintindihan? Yes. Tama ba? Okay. Therefore, kasi the magnesium, it will maintain calcium in the bone. Naintindihan? Yes. Very good. That's the recall. Now, ibig sabihin, that's the reason guys, sources, para ito lang yan, to maintain calcium in the bone. That's the reason, binibigyan ka ng magnesium sulfate. Now, guys, again, bago mag-short break, here we go. Anong gamot? Kapag hypocalcemia, calcium gluconate. Anong vitamins ang kailangan kapag kulang ka ng calcium? Vitamin D. Kapag hypercalcemia, anong vitamins kailangan? Vitamin C. Vitamin C. Sinong binibigyan ng calcium gluconate? Answer. Hypocalcemia. Hypocalcemia. Sino ang binibigyan nurses ng magnesium sulfate? Hypercalcemia. Tama ba? Yes. What is that drug? This one, it blocks the parathyroid para i-absorb ang calcium sa blood. Ano yun? Metrazine, metrazine. Anong gamot ang gagamitin ko para sunduin ang calcium sa blood at ibabalik sa bone? Ang sagot is magnesium sulfate. Magnesium sulfate. Guys, nurses, naintindihan ko pa tayo dyan, guys? Yes, ano? Yes, tama. Okay, guys, nurses, kasi yan, ang consequently class already with your concept class Tito fluids and electrolytes. Okay? The forecast last because your 20 minutes break us after this one, guys, nurses, with the start class concept already. What I guess your cardiac again, this order. So, guys, iwan ko yung screen po natin, guys. You will have your coffee break. See you in a short while, guys, nurses. Kasi tuloy-tuloy po tayo after the break. So, time sa exactly again to 6 again to 6 again 10. Have your break, guys, in a short while, guys, nurses. So, team light po natin, guys. See you in a short while. Okay, sige, huwag mabula. We'll start class concept already with regards to yung cardiac and cardiac disorders. Okay? Let's have a short break muna, guys. Have your coffee and see you po again after the short break. Kasi team light po natin, guys. See you in a short while sa team light po natin. Okay? Sige po yan. Ayan, unmute. Ayan, okay na. Ayan na ba? Okay, dyan na po guys. Ay, kay pambihira to. Kasi bakit ako naka-mute ha? Okay, class kit. Ayan na. Ginto. Okay, ginto na kayo ha? Kasi ha? Mga ginto ha? Okay, class kit. Okay, class kit mga ginto girls yan ha? Ginto boys. Okay, so andyan na po tayo. Okay, so guys. Okay, so andyan na po lahat. Okay, team live po natin guys. Balik na rin po guys, team live po natin. Of course guys, team Zoom po natin. Have your video on guys, nurses. Okay? So have your video on. Be sure lang guys, nurses, na wala ka po tao sa likod mo ha. Baka guys, masisar Montano ulit tayo dito ha. Okay. Okay guys, last sa class again yan. Okay, good. Hopefully guys, andyan po lahat. Okay, so thank you guys. Again, have your video on. Okay, sige po. Now, here we go kasi nga balikan. Yung pasaran na. Okay, good. Again, the class, let's have here. Last class concept guys, already class with regards to nurses or cardiovascular disorders. Okay, the class nurses can pag-usapan guys si Cardio Darisay, ang batang Quiapo. Tama? Okay, the for last section guys, concept your cardiovascular again disorders. Tingnan, here we go class, tingnan now. When I say class cardiovascular, does this pertains to heart? Yes or no? Yes, very good. The first can your heart. Again, the class can talan anong rule. The size of your fist is the size of the heart. Yes or no? Yes. The size of your fist is the size of your kidneys. Tama ba? Kung nakita mo sa heart mo, labdab. Same muscle class that contracts, it supplies oxygen to all part of the body. Tama? Yes. Ibig sabihin, this also the size of your kidneys. Tama? Kung gaano kalaki yung kamao mo, tama? Na sinuntok mo dati sa ex mo nurses, ganun po kalaki yung heart natin. Tama? Okay, this is the size of your heart. Tama? Okay, therefore, class nurses, let's check class kinto ngayon. Concept already with regards to your cardiovascular disorders. Okay, therefore, class, here we go, nurses, guys. Let's have your shared screen class concept with your cardiovascular. Okay, therefore, class, nurses, ito na po tayo ngayon. Now, in a case of nurses class, when say class cardiovascular, guys, pag-usapan natin muna class tingnan, balikan natin ngayon, class, all those concepts na dapat mong tandaan because we have to connect this one on your specific, again, ito ngayon, disorders. And specific, again, disorders. Last time, guys, sa phase 1 ng ating MS, we have talked about arrhythmias. Hinihiwalay ko po yung arrhythmias, guys, sa disorders para, guys, kapag ikay mag-review, guys, kung mauna ka pong mag-exam, just review class again to the replay again of your arrhythmias para, guys, again, all throughout, lalo sa malapit na pa mag-exam. Guys, nurses, ha? I always say this one, guys. Sa mga mag-exam, guys, for this July and August, please, again, guys, again, kindly i-replay nyo po yung may pre-board ratio ko po last time na binigay ni Sir Jay. Hindi ko alam po ng pre-board ano ba yan guys. Maraming lumabas dun last time guys sa mga pre-board exam. Sa pre-board na ratio ko po last time na binigay po ni Sir Jay na ratio ko po. Okay guys, tandaan. Class, try to replay that one bago po kayo mag-exam for this August. Again, for this again July and August. Kasi we have expect some of the concepts doon na maaring class again ngayon, maaring maulit again for this August exam. Okay, please again guys kasi mahirap yun. Nakita mo pala ang sagot guys, andoon pala, tapos guys hindi mo po na-replay. Okay? So guys, nakita ko yung replay ng pre-board po, andyan lang po sa pre-board ng private group natin po na nilagay ni Sir. Again yung sa lahat ng lectures ko, may pre-board ratio po doon. Please, my concepts about class again about last time kasi about your urinary overflow, about this about sa exam doon, overflow, about last skin concept with your arrhythmias, concept with regards your pacemaker. Okay, guys, please. Okay, class, niya na. Okay, class, review this one. Kasi maraming lumabas po doon. Lalo sa malapit na may exam for this August. Okay? So, yan po. Now, kasi guys, again, baka makalimutan mong paalala sa inyo. Kasi guys, baka mag-exam ka tapos sayang. Kasi doon ka po dapat again mag-exam. Pre-board 25 po ba yun? No? Tama ba? Nakalimutan nyo kasi guys. It's pre-board 25 ata yun. Okay? So, guys, basta guys, again, please have your review. Kung ano nyo po yun, ulitin mo po bago ka po mag-NCLEX exam. Ulitin po ulit yung replay nun, guys, again, kasi marami po tayong again abangan doon with regards to your exams. Okay? So yan po. Here we go. Now, in a case again, kasi in consequence with your cardiovascular disorders, again, as discussed last time, we have talked about arrhythmias. I have talked again with regards again to your heart sounds. Pinag-usapan ko doon class concept already with regards again to your class again ECG. Dito class, less focus already class concept already. What are the type of your cardiovascular disorders? Okay, therefore, last okay muna class, the first disorder. Let's have your class concept already class with regards again to your problem class with regards to your CAD. Taba? Okay, therefore, this is now concept class with your CAD. Taba? Okay, here we go class, you recall now. Now, examining CAD guys versus, ano ba CAD? CAD stands for what? For your coronary artery disease. Very good. This refers to your coronary artery disease. This is your CAD stands for your coronary artery disease. Tama ba? Okay, coronary ha. This is your coronary. Kasi nurses get artery kasi artery disease. Tama ba? Coronary artery disease. Tama ba? Okay, good. Guys, USRNs, tingnan. Now, dati guys, palagi mo ito makita ang word again na CAD. Ngayon guys, sources, tas ang bagong term na ginagamit kayo class for CAD is your ACS. So first your ACS. ACS. Tama? Tagagawa ng Star Wax. Tama yun? ACS. ACS. Tapos ang ACS class, sabi ko, this is your ACS class. Ano bang ACS stands for? Your, ano yan? Very good. Acute coronary syndrome. That's acute coronary syndrome. This is the first. So ACS, again, class team live po natin, stands for the class acute coronary, kasi again, coronary syndrome. Class ACS stands for the acute. Again, you have your coronary, class coronary syndrome. This is your ACS, acute coronary, kasi you have your syndrome. Tama? Okay, here we go. Now, kapag sa exam class, you will see the word ACS or acute coronary syndrome nurses, guys. Ano ang problem ng patient na may CAD nurses? Ano pang problem guys ito ngayon sa exam? What is the problem kapag meron kang CAD? The problem is, answer na yun, class. Kulang ba ng oxygen ang myocardium? Yes and no? Yes, kulang. Since kulang, class, you can recall, the problem is decreased myocardial oxygenation. Dapat andyan ang word na myocardial. Kasi guys, ang problem is the muscle of the heart. Muscle of the heart. Ang problem is decrease. Ano siya decrease? Myocardial kasi decrease, again, myocardial kasi oxygenation. Decrease of your myocardial. Decrease myocardial siya of your oxygenation. Ibig sabihin guys, kulang ng oxygen ang ating kasi myocardium or your heart. Decrease myocardial oxygenation. Therefore guys, tingnan. NCLEX exam question. Kapag may CAD, ang problem is decrease myocardial oxygenation. Therefore, class ito ngayon, what is your goal? Kasi what's your goal? Kasi tingnan ngayon, ha? What is your goal? Kasi what's your goal? Again, kasi what's your goal? Your goal mo is to enhance. Enhance means promote. Promote, again, class promote, again ito, class enhance, again, enhance myocardial oxygenation. Therefore, since decrease myocardial oxygenation, ang goal is to increase, is to increase your oxygenation. Increase. Your goal again is to increase, enhance again is to enhance. Again, enhance class enhance, or you have to increase, enhance or increase. Increase na siya. Increase again ito ngayon. You have your class again, increase. And class again, increase again. The goal again is to enhance or increase class again oxygenation. Increase again your class goal is to enhance, increase your myocardial, kasi myocardial perfusion or oxygenation. Myocardial, if your perfusion again or oxygenation. So dapat guys, tingnan, tataas po yan ang kanyang again O2 perfusion. Na ba? Okay, good. Guys, exercise, tingin-tingin sa exam. Here we go. Now, pagka naging their forecast, sinong isipin mo? We have two major type again pag sabing CAD. Na ba? Okay, dalawa yung naging recall class includes, again, tingnan ngayon, in the case of your ACS class, the types includes, again, the forecast, ino yun. Diyan mo pasok as una, pertains sa one refers again to your una, refers again to your MI. Una refers again to your what your MI kasi MI. Kasi MI, number 2 kasi refers again to your, na siya of your angina. MI and number 2 of your angina. Sir, ibig pala sabihin, ang problem ng MI and angina, siya bang myocardium? Yes. Ibig sabihin, kulang ba ng oxygen ang muscle ng heart? Yes or no? Yes, tama. Kulang siya ng oxygen. Tama ba? Okay, good. MI and of your angina. Good. Again, for nurses class, let's okay muna kasi pag-usapan natin ito as concept una. Pag sabi ko, in the case again of your class in myocardial. In the case again of your MI. Therefore, let's okay muna kasi recall, una class, let's start here class, una class concept now with regards to your MI, of your MI. Tama? Okay, here we go kasi recall now, guys. What is MI kasi MI? Kasi ano bang MI kasi MI? Again, what even again by MI kasi MI? Anong MI stands for? MI stands for? Anong MI? Ano yan? Anong MI? Anong MI? Ano yan? Yan ang maling intention. Ay, hindi class, ano yan? Stands for yun. Myocardial infarction. Kasi myocardial infarction class. What is myocardial infarction? Ang sagot, MI. Tama ba? Okay, good. Again, now this is your myocardial infarction. Ngayon, what is another term for MI? Guys, anong another term for MI? Pag CVA, CVA is stroke or brain attack. Pag CVA is brain attack, therefore, what is MI? MI refers again to your very good class. This refers again to your good answer is very good heart attack. Refers to the heart attack. Then may also boost kung known again show what is your heart attack is heart attack. Please then my class known again show heart attack. May have your heart attack. Aba? Okay guys, nurses, isulat mo na. This is now for the person with MI. Tama ba? Okay, good. Therefore, class, here we go. Ayan. Now, kapag ang pasyente kasi merong MI, therefore, guys, tingnan po natin, guys, huwag mawala, ha? Okay, here we go, class, recall. Ano ang problem? Now, kapag ang pasyente ka ng MI, kasi MI refers to disease condition, refers to disease, ha? Disease condition, guys, refers to disease, and siya, disease condition class. This refers to a disease condition class, which causes, which causes. The disease condition, which causes what? Which causes class again yan? Which causes myocardial tissue necrosis. This condition which causes ano siya? Myocardial, myocardial guys, ano yan? Tissue necrosis. Okay, therefore classing yan. Oh, now, myocardial tissue necrosis. Have you seen class? Ang damage is the myocardium. It is the muscle of the heart. Tama? Yes. Ibig sabihin, may necrosis. Pag may necrosis, ibig sabihin, what is necrosis, guys? Yan by cell death. Yes or no? Yes, cell death. The causes myocardial tissue necrosis. Bakit may necrosis? Good. Nurses, gumagaling ka na ang sagot. That is due to ischemia. Due to ischemia. Due to what? Due to ischemia. Due to what? Your ischemia. Your ischemia. Due to your ischemia. Tama? Class. Ano ba ang ischemia nurses class? Ang ischemia class, what do you mean by ischemia nurses? Ang ischemia nurses class, what is ischemia? Okay, very good. Nurses class, ischemia nurses class yan. Yan po again ay decrease in your oxygen. Again, class in the heart. Tama ba? Okay, class. Ideally, ang pinaka-term guys, when you say about the term, kapag in the case, kapag si heart nakulangan ng oxygen, ischemia. Pag si brain nakulangan, natagyan hypoxia. Tama ba? That is what the term again. Kapag specific na term ang ginagamit. Ibig sabihin, dito pa lang guys, dapat may sagot ka na sa exam. Kapag sabing therefore, what causes MI? The cause of MI is due to myocardial ischemia or decreased oxygen in the myocardium. In the myocardium. Have you seen? Dapat andyan ang word na myocardium, andyan ang word again na ischemia. Kasi ang cause is myocardial ischemia. Tama ba? Okay. Tandaan guys, isa ito sa pinakamadaling question class when you have your NCLEX. Here we go. Now, then USRN. Here we go. Kapag sa MI, therefore, class nurses, class question, the exam. Alam mo, gumagaling ka na. Here we go, class nurses, guys. Ay, ito about the USRN. Sige, class. Pag MI, what's the most common cause? MI, class. Common cause is going to be your MI. Anong common cause is going to be your MI? Anong common cause ng MI, class? Choices, again, tingnan. Ayan. Ay, hypertension, smoking, again, or thrombus. What's the most common cause? Hypertension, smoking, stress, or thrombus. Anong most common cause? Lahat yan are all those factors. Sa lahat ng factors, common cause, hypertension, smoking, thrombus. Ano ang common cause? Again, class, can recall na class, again, ang most common cause. Again, what is the most common, guys? Nurses, guys, ano ang most common cause? Answer is, pag sa exam, the most common cause, ang isagot mo, walang iba. Ang sagot is answer, thrombus formation. Tandaan, kapag CVA, common cause ng CVA, thrombus. Common cause ng MI, same din po. Thrombus formation. Tama? Same ang common cause ng CVA at MI. Kahit tingnan class, when you have your disorders, the common cause of CVA is same again as MI. Okay, that's the reason kapag may thrombus ka, nagkaroon ka ng atrial fibrillation, nagkaroon ka ng atrial fibrillation, class, maaaring nagka-thrombus ka, high risk ka, makadevelop ng MI or CVA. Kasi ang common cause is due to thrombus. Can you get your thrombus formation? You get your thrombus formation. That is due to your thrombus. Yung thrombus formation. Guys, nurses class, USRNs, alam ko gumagaling ka with team INAP, USRNs. What is thrombus? Thrombus is clot. Kapag na-dislodge ang blood clot, ang tawag doon, embolus. Tawag doon, embolus. Good. Or emboli. Ba? Okay, good. What is clot formation? Thrombus. Kapag natanggal ang thrombus, guys, anong tawag doon sa kanya class? Refers to emboli or embolus. Tama? Okay, good. Here we go. Thrombus is clot. Ngayon, kung last day ng closer coaching mo tag-exam ka guys, pag pindot mo, ito nakita mo. Which of the following is the most common cause of MI? Pag walang thrombosis, nakita ko coronary artery thrombosis. Isagot ba sa NCLEX exam? Yes or no? Coronary artery thrombosis. Isagot mo yes or no? Yes, isagot mo na. Kasi pag hindi, sasakalin kita. Ang sagot, answer, yes. Answer, yes. Bakit coronary artery? Kasi ang coronary artery is the arteries that supplies oxygen to the heart. Tama ba? Okay. Ibig sabihin, hanapin mo, coronary, plus coronary, artery, kasi artery of your thrombosis, coronary plus artery, thrombosis. This is last again, coronary artery of your thrombosis, Tama ba? Okay, coronary artery, thrombosis. Tama ba? Okay, good. Habisin guys nga ng class can coronary artery. Kaya nga ang MI, it belongs to CAD kasi isa siyang coronary artery disease. Tama ba? Yes, coronary artery thrombosis. Tama ba? Okay. Good. Again, here we go. Now, class, coronary artery class get thrombosis. Therefore, kasi again, recall. Now, question. Class, what part of the heart suffers the most damage? Sino kasi ganito kasi most commonly affected? Suffers the most damage. Most commonly affected. Anong part ng heart, guys? Most commonly affected kasi most commonly of your affected. Anong part ng heart class ang nagsasuffer kasi palagi ng most damage? In the case again of your MI. Sino po most commonly affected? Answer is, sino yun? Answer is, what of the heart? So then A, left ventricle, B, left testicle. Ang sagot? Very good ha. Huwag pakialaman ang testicle nurses ha. Kasi tingnan na, hindi po rin. It's the left ventricle ha. Left ventricle po yan. It's the left again, left ventricle. Good. Again, the answer is your left ventricle. Here we go, sir. Bakit naman kasi left ventricle? Kasi bakit left ventricle? Kasi sa heart natin, ano bang part of the heart has the thickest myocardium? Sinong makapal na myocardium? Makapal pa sa mukha ng chismosa mong kapitbahay. Sino yun? Ang sagot is, very good, left ventricle. The left ventricle is the thickest myocardium. Kaya it is most commonly affected in the case of your MI. Tama? Okay, good. Here we go. Guys, versus case, gumagaling ka naman. Here we go. Now, kapag ang pasyente may MI kasi we have two types of your MI. We have two major types of MI. Sir, plus the types, yes. What are types? Includes the types, includes MI class, includes number one. Una guys, pakinggan na buti. The first one is, una kasi refers, nurses, are you familiar kasi when say kasi una refers to your transmural. Refers to your transmural, transmural. The first one refers to your transmural type, again, your MI, transmural. Tama ba? Transmural. Guys, nurses, are you familiar guys when say transmural? Familiar ba sa transmural, USRNs? Yes and no? Transmural, familiar ba hindi? Familiar ba hindi? Transmural, familiar ba hindi? Yes, very good. Narinig na? Yes. Pero hindi familiar? Yes. Pero narinig na? Yes. Pero hindi familiar? Yes. Pero narinig na? Let's go now. Sagot kasi ganyan. Now, what do we mean by transmural, pambira? Kasi with transmural. Here we go now. Class, number one is transmural. Okay, number two, pambira. Number two is refers to your subendocardial. Again, subendocardial. Transmural is number two is refers to your subendocardial. The first one is transmural. Number two is refers to your subendocardial. As again, subendocardial, guys. There's a subendocardial. Transmural. Number two is subendocardial. Subendocardial. Okay, therefore, kasi let's have here again, kasi minsan, may nakita ka, kakilala mo, kapitbahay mo, naku, si tito mo nagka-MI, ha? Bakit kaya nangyari daw? Hindi ko maintindihan, basta sabi ito, pag transmural daw. O pag transmural, kasi ano kaya ang problema kapag transmural? Kapag inakis sa MI, ano siya, subendocardial, ano po, again, ang problema. Here we go, guys. Sige sa word, guys. Sige sa word. I-drawing mo, yung pangit na drawing mo, ito po, again, ang dahilan kung bakit papasa ka at question 85. Tama ba? Okay, good. Here we go. Now, class. If this is a structure class of your heart, kasi itong heart, natin is structure class of your heart. Ano to, nurses? Ano yan? Heart yan. Appreciate yung pinaghirapan ko to. Ano yan? Heart po yan, ha? Heart po yan. Ano yan? Heart. Tama ba? Heart yan. Tama ba? Okay, heart po yan, ha? Tandaan. Kailan ang chamber ng heart inan? Apat. Bakit? Ayan. Right atrium, left atrium, right ventricle, left ventricle. Apat ang chamber ng heart. Apat ang chamber ng heart. Tama ba? Okay, apat po yan. These are the four chamber kasi ng your heart again. These are the four chamber class in your heart. Tama ba? Okay, guys. Here we go. Class tingnan. Balikan. Itong heart natin, guys. Dito ngayon, class. Also dito, class. This is also kasi of your heart. Ha? Lagyan natin. Ito yung structure ng ating heart. Tama? Okay, this is a structure class also of your heart. Tama ba? Okay, good. Nurses, have your video on, guys. Nurses, para guys, may kausap po tayo, guys. All throughout ang ating lecture. Okay, good. Okay, tapos have your video on. Again, here we go. Now, kapag in-a-case again with us, guys, nurses, tingin. Class. In a case again sa heart natin, again recall, if there is just the structure cast of your heart, again recall tingnan. Now, ang heart natin, kahit siya po ay siya ay nagsusupply tas ng oxygen all throughout your body. Kailangan niya rin po ng oxygen. Sir, bakit kailangan oxygen? Kasi ang heart ba, muscle din ba siya? Yes or no? Yes. Since muscle din siya, kailangan niya rin ng oxygen. Sino ang nagsusupply ng oxygen sa heart? What blood vessels supplies oxygen to the heart? Sino ang blood vessels supplies oxygen to the heart? Sino ang blood vessel yun? Ang sagot, sino yun? Ang sagot is your very good nurses, damang-dama o kayo, pambira. Okay, sino yun? Answer is? Yes. Sino yun? Very good, guys. Coronary arteries ang dyan na kayo sa class again. Coronary arteries, nurses, ha? Okay, coronary arteries again. This is the blood vessels that supplies oxygen to the heart, ha? To the heart. Okay, therefore, class, tandaan, ha? Ibig sabihin, class, kapag siyang heart natin, we have a blood vessels that's class again, mayroon kang great cardiac vessels. These great cardiac vessels, sila po yung mga malalaking ugat that supplies both right and left side of the heart. That's right and left side of the heart. Ang tawag doon, these are the coronary arteries. So pupunta sa right and left coronary artery. Papunta sa ginto, right coronary artery circumflex. And of course, again, class, this is your coronary arteries. So sa labas ng puso mo, may mga malalaking ugat yan na makita. Tama ba? Class, again, tingnan ha, may malalaking ugat yan, sir. Again, class, again, mayroon siyang ugat. Tama ba? Yes. Again, now, anong tawag sa kanyang ugat? Class, ang tawag doon, coronary arteries, ha? Okay, class, again. Tingnan, saan ang coronary arteries? Inside, outside ng heart. Saan ang coronary arteries? Inside, outside. Saan? Inside or outside? Nurses, answer? Nurses, pag hindi mo lang ito, sini ka tao, Android ka. Pambira kasi tingnan, ha? Okay. Okay. Saan yan? Inside, outside. Saan? Very good, nurses, sa labas. Huwag ipasok sa loob. Nasa labas po yan. Sa labas ng heart mo, may malaking ugat na parang varicose veins. Ang malaking ugat yan, that is the coronary arteries. Coronary arteries. Tama ba? Okay, for coronary arteries. Tama ba? Here we go. Now, pag sinabing transmural, anong problem? Class, delikado to. Bakit? Pag transmural nangyari, nurses, ito yun. Pag transmural, that means, guys, ano ang problem pag transmural? Ibig sabihin, delikado. Bakit? Both, ito guys, anong common cause? Thrombus. Pag thrombus, ibig sabihin, both right and left coronary artery is obstructed. Ibig sabihin, obstructed yan both right and left coronary arteries. Ibig sabihin, kasi may bara. Tama ba siyang bara? Masyagin bara. Tama ba? Both right and left coronary artery is obstructed. Kaya pag dalawa, guys, anong tawag sa kanya kapag dalawa? Tawag doon? A, transmural, B, intramural. Ang sagot? Transmural, ha? Kasi kinuha sagot ng intramural. Ang sagot na siya? Transmural. Both right. Again, both siya, both. Ang siya, team light po natin, both right, ha? Right and left coronary artery is obstructed. Right, again, give your left and left coronary, kas coronary, ha? Coronary kas artery. Coronary artery is obstructed. Coronary artery is obstructed, guys. Ay, siba muna, guys. Wait lang po, guys. Ay, siba muna, guys, para mas klaro. Okay, here we go, guys. In both the coronary artery, kasi artery is, ay, siba siya is obstructed. So, dalawa yan. Obstructed mo siyang para. Tama ba? Okay, is obstructed. Tama ba? While, pag sabing subendocardial, that means, sabihin ito yan, nurses case use are only kasi one coronary artery is obstructed. Plus only one coronary artery is obstructed. Plus dito kasi only one, isa lang. One coronary artery siya is obstructed. Plus only one, ha? One. Plus there's been one coronary artery because only one coronary plus one coronary. One coronary artery kasi artery is obstructed kasi siya is obstructed. One coronary artery kasi nurses is obstructed. Ngayon, ano ang ibig ko iparating? Guys, kapag yung kakilala mo nagkaroon na ng MI, ibig sabihin, guys, nurses, sino ang mas life-threatening? Ibig sabihin kasi ganyan, sino ang mas delikado? Transmural, subendocardial. Sino mas delikado yan? Sino? Very good. Ang sagot is, very good, nurses. Ano yun? Yes, magnificent nurses. Ano yun? Very good, superior nurse. So what is answer? Transmural. Ang ibig sabihin, guys, nurses, class again, sino ang aring unang hugutin ng puting ilaw? Sino yun? Transmural. Tama ba? Sino ang unang magkita ng inang lumikha? Sino yun? Transmural. Siya ang mauna. Tama ba? Yes, ano? Transmural. Therefore, class again, tingnan ha. Okay, siya ang unang mawawala. Tama ba? Yes, ano? Yes, tama. Siya ang unang class again mamamatay. Tama? Nurses, tandaan mo, huwag kang matakot mamamatay. Tandaan yan. Kasi walang lumilisan sa mundo na ito na buhay. Tama ba? Okay, guys. Kapag excited ka, mauna ka na. This is your transmural. Again, transmural. Tama ba? Ba't ganun, guys, nurses? Bakit ganun, di ba? Ba't ganun, bakit? Kapag kasal, again, nurses, kasi tingnan may tumatapon agad ng bulaklak, nag-aagawan para malaman kung sinong next na kakasal. Yes, ano? Yes. Bakit pag in a case may namatay, pag may magtapon ng bulaklak, bakit walang sumasalo? Ayaw ba yung malaman kung sinong susunod? Lahat sa umiiwas. Okay, diba? Bakit ganoon? Okay, class. Here we go. Dito guys, you can recall ngayon. Diba? Pagkasal na yung pag namatay, iwas ng iwas. Tama ba? Okay, here we go. Dito kay class, recall. Now, ibig sabihin, nurses, again, tingnan dito kayo. Okay, class, tingnan. Ito yun. Imagine mo lang guys, nurses, tapos imagine this is your blood vessel. So this you have your blood vessels. Look at this one, guys, versus. Now, imagine mo na kasi ito yung ating class again, blood vessels. This is your blood vessels, guys. I-drawing mo, guys, versus class of your blood vessels para malaman mo kasi maintindihan. Alam mo, guys, napakadali po ng cardio guys sa exam. Nagmukha lang siyang class again dito mahirap kasi akala mo complicated po. Tumayin nyo, guys, madali po tandaan nyo. Here we go. Now, imagine mo, this is your blood vessels. Ano ang tawag sa blood vessel ito, guys? Ang tawag doon, this is your coronary arteries. This is your coronary arteries, same coronary arteries. Now, but this is your coronary artery, guys. Coronary, ha? Coronary arteries. These your coronary arteries. Tama ba? Okay, good nurses guys, coronary artery yan. Tama ba? Okay, ngayon. Now, pag siyang blood vessels natin, let's go recall, nurses again. Recall now. Imagine mo, this is your blood, ha? Ito ating blood, ha? This is your blood. Last imagine mo, this is your blood. Again, this is your blood. Tama ba? Okay, sirs, ano yan? Ano to? Blood yan. Ano yan? Blood. Appreciate ko, pinaghirapan ko pa na yan. Blood. Mamayang gabi, ewan ko lang. Basta ngayon, blood nurses, ha? Ngayon, blood, ha? Mamayang gabi, makita kayo, iba na siya. Tama ba? Okay, nurses, depende sa sitwasyon. Basta ngayon, ano siya? Blood po yan, ha? Ano yan? Blood. Tama ba? O ngayon, here we go, guys, nurses. Tingnan. Under normal blood flow nurses, pag walang obstruction, lahat ba ng dugo nurses class Ken, makakadaloy ba no? Yes, nakakapasok yan guys kasi walang obstruction, nakakapasok po lahat ng dugo. Tama? Kaya free flowing of blood mo nurses, napakaganda po again habisin kas ng blood flow mo kasi sa heart natin. Tama yes no? Yes. Ibig sabihin, your heart again is oxygenated as well, not siya well oxygenated. Tama ba? Well oxygenated. Tama ba? Okay, here we go. Now, class. In a case pag siya kasi normal blood flow, habisin guys again nurses guys, sige tingnan ngayon, malaman ka normal again. Now, in a case of MI binanggit natin, ano ang common cause? Anong common cause? Due to number one, anong common cause is due to ano yan? Ano yan? Varicose thrombus. Due again to your thrombus. Tama ba? Okay, due again to your thrombus. Tama ba? Due again to your thrombus. Guys, mamaya, basing on the types, diyan mo siya malalaman kung ang pasyente, ang kailangan niya, sino kaya ang gagamitan natin ng heart bypass at sino kaya kailangan mamaya ng klase ganito ng your cardiac catheterization. Kasi guys, diyan mo siya malaman saan ginagamit ang cardiac cath, saan ginagamit again ang CABG. Tama ba? Basing on the types of your MI. Tama ba? Okay, here we go. Now, dito. Ang common cause again is due again to your thrombus. Common cause due again to your thrombus for, mention this is the most common cause. Number one. Una, anong cause is? Number one, thrombus. Okay, una cause due again to your thrombus. Again, thrombus formation. Number one is due again to your thrombus. Due again to your thrombus. Tama ba? Okay, due to your thrombus. Tama? Okay, wait. Unmute. Ayan. Okay, naka-mute na naman ako. Ha? Ayan. Now, the one class cause again is due again to your thrombus. Wait lang. Ayun, para unmute na tayo. Okay, here we go. Class tingnan. Oh. Una sulat mo, number one cause is due to your thrombus. Thrombus. Tama ba? Okay, now, class again, thrombus. Again, recall natin yan. Oh. Thrombus again is clot. Number two class cause, again, recall. What refers again to the cause? Refers to formation of plaques. What is plaque formation, guys? Galing natin USRNs. Galingan. Again, what is plaque formation, guys? Plaque formation class, ano bang plaque? Plaque formation class due to the formation again of your plaques, into the formation of your plaques. Calcification yan actually guys your sasa. Okay, therefore pass rin. Number 3 one, plaque is atero. Siya atherosclerosis. This refers to atherosclerosis. Refers to the atero. Okay, sa atero po yan, atero. Atherosclerosis. Atherosclerosis. Again, what is atero, guys? Ano atero is refers to your bracket plaque formation. Refers to plaque and plaque forming. Atherosclerosis refers to plaque and plaque formation. Wait na guys, okay, kasi this is refers to the plaques. Okay, wait na guys. Natin muna guys, again, refers to the plaque. Okay, plaque formation, kasi plaque formation. Ngayon, ang kasi pag formation guys, says, pero saan tumubo class ang plaque? Saan tumubo? Saan tumubo? Siyempre hindi sa inyo. Saan? Coronary artery. Saan sa coronary artery? Kasi in the coronary artery. Plaque formation is in the coronary artery. Tama ba? Team live po natin guys. Makasagot rin po. Wait na guys. Silipin po team live po natin. Okay guys. Sige tingnan ngayon. Class again dito. This is again dito ngayon. Your pure class. Plaque formation where? In the coronary artery. Tama ba? Okay, here we go. Silipin ko yung live po natin. Yan. Class again tingnan now. Class. Pag formation guys again is plaque. Therefore class again recall. Now, ang problema guys versus again. Kapag formation is plaque, later on, class, ito may titigas siya sa loob? Yes, tama ba? Ito lang po yung titigas na hindi mo magugustuhan. Tama ba yes, ano? Yes, tama ba? Okay, class nga na. Ito lang po ang titigas nurses na hindi kaaya-aya. Kasi kapag tumigas ito, nurses, hindi masaya. Tama ba? Yes, ano? Yes. Ano class again nga? Kapag tumigas, what is hardening of plaques? Again, kapag tumigas yan, nurses, kapag tumigas yan, refers to your arteryo. Now, pag sabing hardening, meron bang R? Yes. Arteryo, meron bang R? Yes. Kapag tumigas yan, pag refers to your arteriosclerosis. Tama ba? Okay, class again, tingnan na. Lahat, class again, patigasin mo na. Wag lang ito, ha? Kasi delikado, class arteriosclerosis. Ito, class again, arteriosclerosis. Tama ba? Ito lang po ang wag mong patigasin. Tama ba? Okay, kasi delikado to. Arterio is the hardening. Kasi hardening what of your Plaques and hardening, class, and hardening what of your plaques. The hardening of plaques is represented arteriosclerosis. Hardening class of your plaques. Tama ba? Okay, good. Hardening is arteriosclerosis. Again, sclerosis. Tama ba? Okay, the class. Guys, last ko na. Tatlo ang maaaring cause. Again, recall. Una, class. Balikan natin. Una, what is the circle? What is formation? Guys, formation. What is formation? Represent ano yan? Formation is, ano yan? Atero. Kapag tumigas na, ang tawag sa gas, pag tumigas na class, anong tawag doon guys? Versus kapag tumigas na, ang tawag doon, refers to your yun, arterioclast, arteriosclerosis. Tama ba? Okay, get arteriosclerosis. Tama ba? Okay guys, sige class, bago passage po tayo. Sorry guys, di ko po nakita. Again, sorry. Now, congratulations po guys. Shout out po kay Sir Patrick. Again, class, Sir Patrick, class, again ngayon. Again, here we go, class, again, ayan po. Okay, kasi tingnan class bagong passes pa natin ito guys again for the NCLEX for the NCLEX exam. Guys, ang dami nyo, ang dami talaga guys ano. Everyday nurses, sobrang napakadami, and nurses, dito siya nakita yung gratitude nyo for the INAP na after pumasa kayo bumabalik. Tama ba? Guys, ibig sabihin guys, hindi ka po makasarili. Ang ibig sabihin class, again, kung bakit binigay ang license na yan nurses class, ibig sabihin guys, nurses, again class, kahit na pumasa ka, nilingon nyo po yung makasamong hindi pumasa. Nurses, bakit? You want them, the nurses, dapat sila man susunod. Tama ba yun? Ano? Yes. Alam kung bakit guys, nurses class, continue to be a blessings. Alam kung bakit guys, again, hindi class again, minsan class nabubuhay tayo sa araw-araw. Hindi dahil class again for the purpose para sa sarili mo. Kung every time class again naraman mo class na umaga class pagising mo, maganda yung pakiramdam mo, wala kang sakit nurses class, napaka-healthy mo, ibig sabihin class, again tingnan, class na mga tao lang ilangan sa'yo. As long nurses na andyan po mga tao nang ilangan sa'yo guys nurses, class again tingnan, ang ibig sabihin nurses, pasalamatan mo yan. Ibig sabihin class again tingnan, binibigyan ka ng pagkataon to live for another day, Father Day. Darating ang time guys, pag tumanda ka nurses, nilingunin mo lang yan, marami ka na parang tao na tulungan. Tama ba? Yes. Kaya guys, nurses, galingan. Sign up guys, nurses, class yan, family po kayo dito. Dapat guys, ang goal po natin guys, nurses, dito ngayon class, may nauna man nurses, pero sabi ko guys, dapat class again, dapat yung susunod papasa din. Tama ba? Guys, again, class, nurses, class, hindi ko alam guys kung saan hanggang ang maabot ng INAP. But what I mean guys, gusto ko po guys, darating ang araw, nurses, gusto ko pang makita guys, nurses, again, tingnan, na dating araw kas marayo pa po mararating po again ang INAP family. Tama ba? Guys, even though guys, alam mo kahit lecture lang po ako dito guys, again, so I'm so pleasure that palagi guys, i-invite po ni Sir Jay again to have a lecture this one. Siguro guys, again, yung pinakamalungkot na part again, nurses, kapag hindi na po ako mag-lecture dito, siya pa nakakalungkot yun. Okay guys, but as far as possible guys, hindi. Kasi alam mo Sir Jay, sobrang napaka tawag ito, well-respected ko po yun na sa pagsabi class in the case of your lecture. Kaya that's why guys, nang sinabi niya, sir, gusto ko ikaw hahawak ng ganitong concept, hindi po naglalawang isip guys, sir, again, to handle you all as far as possible. I try talaga guys, sir, to have your live lecture sa inyo, and as far as possible guys, again, na class, yung lecture po natin, again class, again dito, tuloy-tuloy po yan, again all throughout, kahit guys hanggang ikaw pumasa sa exam. Tama ba? Okay, guys, minsan please, again class, always pray for my lectures niyo po. Kasi guys, every time kami nag-lecture sa inyo, pag upo po namin guys dito, may mapagkakataon guys na hindi maganda yung pakiramdam namin. But what I mean guys, bakit ninyo nakakita yan? Kasi nurses guys, every time kami umupo guys, nurses, nakatanggal kasi ng stress, nakatanggal ng pagod kapag nakita po namin kayo na marami po kayo guys umate ng lecture. Ibig sabihin guys, wala kaming karapatang mapagod kasi nurses guys, andyan po kayo nag-aantay at gustong-gusto magkaroon ng bagong lisensya. Tama ba? Yes. As long manangarap guys na yung USRN, hindi po kami titigil guys again para po ito sa inyo. Tama ba? Okay. So guys, again nurses, klase nga, kapag klase again tingnan, sabi ko, all throughout guys, magalingan niyo po. Kasi alam ko bakit nurses, yung mga maliit na bagay na ginagawa niyo, yung sacrifice niyo po, everyday kasi binibilang po yun sa taas. Kung gaano man kasi kabigat na nandawan mo yung guys nurses, klasingan, hindi po aksidente or hindi po class again dito, it's not only coincidence na nag-met po tayo sa INAP. Ibig sabihin, you are being destined to be here because nurses class, you are guided to pass this NCLEX exam. Tama ba? Yes. Ibig sabihin class again, kung bakit guys na nakikita dito, alam mo kung bakit guys, maraming centers again for the NCLEX. But what I mean is, bakit dito kayo napunta? Kasi you are guided na mag-met po tayo dito. You met the great lecturers, nurses, kasi these lectures, again, dito ngayon, dito mag-guide sa inyo guys para guys maabot na pang lisensya na ito. I always say this one, team live po natin guys at team Zoom po natin. Kapag andyan class ang pagkakataon guys, again, tingnan ngayon, you will see those persons na feeling mo sila po, again, nakakatulong sa inyo para pumasa ka. Don't lose those persons. Kasi hindi lahat na mga student guys na bibigyan ng pagkakataon na ma-expose po sa amin. Taba? So that's why guys, every time ako mag-lecture guys, sabi sin guys, lagyan ko palagi guys, I was driven by passion to teach. Because guys, I do believe nurses, nakatuwa pa rin at the end of the day kung saan tayo magkita, nurses guys, nurses is a pleasure to be part again ng success nyo, kung saan na abot ng lisensya nyo, kumanda yung buhay nyo, class again, far after ilang years guys, nurses, is a pleasure. Nag-bet po tayo guys again for this review. Tama ba? Okay, so guys, nurses guys, again, thank you guys sa araw-araw po, kinagasawa po again to attend again all throughout for ng ating lecture. Salamat po guys, all throughout guys, nurses. Yan po ang bagay kung bakit lalo po kami nagsumikap na lalong gagalingan ang lectures. Kasi guys, versus, kasi we do believe, alam mo guys, ang hirap kitain po itong pera. Ang hirap kitain kung bakit nag-enroll kayo dito. That's why guys, yung tiwala nyo, guys, gusto din namin po ibalik yan. Not twice, but thrice na ibabalik po ito. That's why guys, again, gusto namin ibalik sa inyo dito guys, after this one, kasi ang sarap ng pakiramdam guys, versus, na after this, ng inyong review guys, lahat po kayo guys, versus, nakakatuwa, that after this one class, hindi na sayang po yung pagod natin, yung effort natin para po kayo maipasa. Tama ba? Okay, so ayan po. Okay, so guys, yung GCash, so guys, mamaya na po. Okay, guys, kasi mamayang gabi, gagamitin pang GCash kasi mamaya after guys, pag klase na by 9, guys, kailangan ko talaga guys, kailangan kumita ng pera. Pagkatapos mag-a-adonis pa ako kasi alam mo, bibis po ako. Class, through the years, I never let you down. You turn my life around. Tapos GCash, sabay insert sa brief. Sayang, patawid gutom din to. Hindi. Okay, guys. Pag wala na lecture, sa Adonis na tayo. Hindi. Guys, sige, tingnan. Ito na mo. Okay, class, here we go. Nothing yan. Class, sige, tingnan. Nurses class, this will be case in the case again of your troubles. Question class, the exam. Balik po tayo, guys. Thank you, guys, sa bagong passes. Thank you, guys, for visiting us, Mama. Again, Ma'am Melissa. Again, thank you po. Again, and Ma'am Sir Patrick, thank you po. Okay, here we go, guys. Tingnan, balikan po natin. Now, kapag sa exam, again, recall. Class, kapag sa exam, thrombus, atero-arteries. Sa tatlo, ano most common cause is? Answer? Very good answer is thrombus. Tama ba? Okay, let's connect this one again. Recall. Now, guys, tingin sa board. Now, kapag in a case kanina, kapag may thrombosis, siya may obstruction, yes. Kapag obstructed, therefore, what will happen to your blood flow? Increase or decrease blood flow? Guys, sundan class ang flow ng concept. Increase or decrease? Answer? Very good, guys. Magdi-decrease po yung blood flow. Yes or no? Yes, nag-decrease po ang ating blood flow. Tama ba? Okay, nag-decrease ang blood flow. Tama ba? Okay, here we go. Now, guys, once mag-decrease ang blood flow, ibig sabihin, mag-decrease pang oxygen. Yes, decrease again in the oxygen. Therefore, class, kapag decrease oxygen, that's the reason kung bakit nagkaroon ka ba ng ischemia. Yes or no? Yes, the patient develops ischemia. In this ischemia, that's the reason kung bakit ang patient complains. Kaya nagkaroon ka ng chest pain. Kaya nagkaroon ka ng chest pain. Kaya nagkaroon ka ng chest pain. Tama? Okay. And chest pain, guys, sa exam. Class question. What is the major manifestation of MI? A, cyanosis. B, dyspnea. C, chest pain. What's the major manifestation of MI? Ang sagot is chest pain. Your chest pain. This is the major classical manifestation kasi of your MI. Ang sagot is of your chest pain. Ha? Okay, so this is the major manifestation of MI. Hindi cyanosis, hindi dyspnea, hindi fainting. Ang sagot is chest pain. Kasi again, major manifestation of your MI. Because this is your chest pain. Okay, major manifestation. Okay, class again of your MI, of your MI. Tama ba? Okay, here we go, class nurses, guys. Kung nakita mo, ang daling sagutin ng question. Here we go. Now, question class in question by exam again. Recall. Pag sabing therefore nurses sa exam again, tingnan. Here we go, guys, nurses. Again, therefore, let's connect your concept. Diyan. Kapag sinabi sa exam nurses, ang sagot, andun lang rin. Class again, tingnan ha. Okay, andun lang rin. Bakit? Pag sabi sa exam again, nurses, ito yun. What causes chest pain naman? Anong cause? Due to myocardial ischemia. Sir, bakit may ischemia? Kasi nag-decrease ang oxygen. Nag-decrease again ang oxygen. Bakit nag-decrease? Kasi nag-decrease ang blood flow. Sir, bakit nag-decrease ang blood flow? Kasi nagkaroon ka ng occlusion. Anong cause ng occlusion? Ano yan? Either thrombus formation, atherosclerosis, arteriosclerosis. Tama ba? O ngayon, sa tatlo, ano most common? Ang sagot? Thrombus. Thrombus formation. Kaya diyan mo siya malaman, what causes chest pain is due to myocardial ischemia. Myocardial ischemia. Tama ba? The cause of this one, sabi ko, that is due again to your guys versus myocardial ischemia. Tama ba? Okay, good. Therefore, guys, balikan. Anong tawag sa MI kapag both right and left is obstructed? Dalawa. Both right and left coronary artery is obstructed. Ang tawag ito refers to your, ano yun? Very good. Transmural. Only one coronary artery is obstructed. Pag isa, ang tawag ito refers to your good subendocardial. Good subendocardial. Good subendocardial. Tama ba? Okay, good. Again, guys, gumagaling ka na ngayon. Here we go. Now, ito po ang ibig ko sabihin, guys, when you answer the exam. Guys, minsan ang sagot dito lang po umiikot kasi when you answer the exam. Guys, guys, okay lang ba ka na i-clear? Can I erase this one, guys, sa upper part? Upper part, okay lang ba erase po natin? Yes or no, guys? Okay, good. Again, therefore, nurses classingan. Let us clear skin nurses 3, 2, okay, 1. Guys, i-erase ko sa taas ha. Here we go guys. Ngayon, so mo itong gagawin ko, isentro po sa gitna ng notebook mo. Kung paano ko isulat guys, ganun din ang pagsulat mo dapat sa notebook mo. Para guys, sige tingnan, ma-maximize po yung space at mas maintindihan niyo po kayo yung notes niyo guys. Here we go guys, tingnan na, doon natin mabuti. Here we go. Now, isentro po sa gitna. Now, kapag sinabi sa exam din, what course am I? Class, bakit talaga by class? Una class, ang course ko, kaya may sentro mo sa gitna guys, una talaga kasi una mayroong presence what of your occlusion. Sir, mayroong presence what of your occlusion. Class, una presence of your occlusion. Guys, move ko lang konti, baka sa live kasi hindi makita. Okay, this presence what of your occlusion. Sir, my occlusion. Tama? Occlusion or obstruction. Tama? Okay, here we go guys. Again, sentro sa gitna guys, versus. Ngayon, here we go. Kapag siya occlusion therefore class, ano ba ang tatlong uri again na mangyayos ng occlusion? Sino po ba ang 3 major causes kung bakit ang pasyente nagkaroon ka ng occlusion? Ano yan? Una, maaaring due to sa baba. Anong kanina? Thrombus. Very good. The first one is jogging short, thrombus, thrombus for machine. Una kasi nagkaroon pressure of your thrombus. Okay, good. Okay, thrombus. Tama ba? Okay, this is your thrombus. You have your thrombus for machine. Tama ba? Okay, this is your thrombus. Tama ba? Okay, tingnan. Here we go. This is your thrombus. Okay, number 2 kasi. Number 2 is due to atero. Ang sagot is adjective. Number 2 is atero kasi atherosclerosis na atherosclerosis. Now, this is due to atherosclerosis. Diba? Okay, focus. Ano yan? Due to your atero. At syempre guys, pag tumigas na, anong tawag guys? Pag tumigas na, ang tawag doon, very good, nurses class. Ano yung tawag ito? Refers to your arterio. Kasi arterio kasi pag tumigas na, refers to arterio. Arteriosclerosis. Therefore, this will be classically recalled as your 3 causes. Ngayon, sa tatlo, ulitin ko, ano ang pinaka-cause talaga? Bakit ka nagka-MI? Ano pinaka-cause? Answer is due to thrombus. Sa tatlo kasi, the most common cause is due to your thrombus. Good. Guys, sources, kung magaling na sabi ko, this is the most common na. Ito talaga ang common. The most, kasi again, ang common cause. Ang common cause talaga, guys, sources, is due to thrombus. Tama ba? Okay, good. Guys, galingan natin yan. Now, due to this occlusion, guys, again, sabi ko ayun, may process what again of your occlusion, guys. Balik ko rin sa ko, process what of your occlusion. Ayan. Now, due to this occlusion, guys, what will happen next? This occlusion, that's the reason ang patient, guys, nagkaroon ka ng ischemia. Nagkaroon ka ng myocardial. Myocardial is ischemia. Myocardial, ibig sabihin, affected is the muscle of the heart. Myocardial ischemia. The cause is myocardial. Myocardial is ischemia. This is the cause. Again, myocardial ito, ischemia. Guys, erase ko ito muna sa baba, ha? Okay, erase ko po muna. Kasi again, that is due to your myocardial. Ano siya? Myocardial, again, ischemia. Tama ba? Okay, therefore, klase yan. Alam natin. In this ischemia, sabi ko, that's the reason ang patient class nagka-develop ka nagkaroon ng chest pain. Very good class, ischemia. That's the reason, guys, again, ang patient. Ito ngayon, class, dugtungan mo na ngayon kung bakit ang patient nag-complain ka ng very good class. Ang tawag dito kasi nagkaroon ka ng chest pain. That's the reason, class, nagkaroon ng chest pain. And chest pain is the major manifestation of your MI. Kaya nagkaroon ka ng chest pain. Tama? Okay, therefore, kasi sabi ko kanina, okay, you have your chest pain. Ngayon, ano ang ibig ko ipatin, guys? USRS, guys, tingin sa board. Here we go. Now, kapag sa exam, guys, nurses, madali pong tanda nito kasi when you answer the NCLEX. Here we go. Mas balikan na, ang sagot kasi andun na rin. Question. Class, give recall. Class, in a case kin pagsabing, what causes chest pain naman? What causes chest pain? Dito myocardial ischemia. Bakit may ischemia? Nagkaroon ka ng occlusion. Anong cause of occlusion? Thrombus formation, atherosclerosis, arteriosclerosis. Tama? Okay, good. Ulitin ko. What causes chest pain? Bakit nagka-chest pain? Due to A, myocardial ischemia. B, mitral ischemia. Ang sagot is myocardial. Hindi po valves, dapat may word na myocardial ischemia. Ngayon, question. Paano kung walang word na myocardial ischemia? Now, nakita ko therefore clusters as myocardial insufficiency. Isasagot ba sa NCLEX exam? Myocardial insufficiency. Sasagot ba natin? Yes, ano? Answer is? Yes. Kasi guys, sige tingnan, hanapin mo, minsan sa exam guys, kung bakit nurses, kung bakit minsan naging mahirap ang exam. Kasi as a student minsan, may gusto kang alam na kapag nakita mo ang question na to, alam mo talaga ang sagot guys. Ang problema, pag click mo nurses ako, wala ang sagot na gusto mong ilabas. Minsan, ako sa sobrang mahirap, hindi mo alam, class magkakamukha lang pala. Sa NCLEX guys, hanapin mo ang word, nurses na nag-class, ibig sabihin, na magkasing kahulugan sa sagot na gusto mong ilabas. Ibig sabihin, kung walang ischemia, ang pinakamalapit na word is insufficiency. Ibig sabihin, kulang ka ng, anong kulang sa'yo? Kulang ka ng A, oxygen, B, dilig. Ang sagot, oxygen gas, ha? Hindi dilig, ha? Klase, hindi po. Kulang ka ng oxygen, ha? Oxygen po ang kulang, ha? Okay, hindi po tilig sanol. Tama ba? Okay, class na. Okay, nurses class, kulang ka na, ha? Ano yan? Very good. Oxygen ang kulang, guys, nurses, ha? Okay, hindi po ang class ng tilig. Kamakas, kulang ka ng oxygen. Tama ba? Myocardial ischemia. Ngayon, question. Ibig sabihin, guys, last connect. Let's talk about the analogy of this exam. Kasi guys, kahit anong ikot ng question, guys, again, class again, madali pong sagutin. Now, here we go. Class again, recall question. Kapag sinabi, what causes class again, class again, chest pain? Ang sagot is ito, myocardial ischemia. Myocardial ischemia. Tama ba? Yes, ischemia. Ang ibig ko iparting, guys, says, kapag natanggal ang ischemia, matanggal bang chest pain? Yes or no? Yes. Kasi anong cause? The cause is ischemia. Tama ba? Anong effect niya? Kapag cause, nagkaroon ka ng chest pain. Ibig sabihin, pag natanggal ang ischemia, matagal ba ang chest pain? Yes. That's the reason case kapag MI, the patient is given oxygen. That's why binibigyan ka ng oxygen. That's the reason case the patient is given oxygen. Kaya binibigyan ka ng oxygen administration. O2 plus O2 administration. O2 plus O2 administration. Binibigyan ka ng oxygen. Tama ba? That's the reason case ang patient, sabi ko, binibigyan ka ng oxygen. Ngayon, first question, guys. Dito lang po ikot ang sagot ko yung answer class, your end class exam. Tingnan, here we go, class. Tingnan. Kasi, guys, the rule class ginabisin lalo sa NGN type of question, just know the physiology of the disease. Then, the management always class would follow. Sa papasok po, again, ang tamang management na alam mo. Ang ibig sabihin, guys, first yun, again. Now, ibig sabihin, first question, what causes chest pain? Class, again, INAP USRNs, as with myocardial ischemia. Class, pag walang ischemia, myocardial insufficiency. Second question, again, recall. Sabi natin kayo na, pag nawala ang ischemia, matagal ang chest pain. That's the reason the patient is given oxygen. Kaya question, the nurse is caring for a patient with MI. Now, the doctor orders that the patient should be given oxygen. Then sabi, what is the purpose of oxygen? Ang sagot, to relieve ischemia, thereby relieves chest pain. Relieves ischemia, thereby relieves chest pain. Ang ibig ko sabihin kasi yan, what is the purpose daw? Bakit nagbibigay ka ng oxygen? Ang purpose daw, giving oxygen, answer is, to relieve the skin, and purpose of giving oxygen. Answer is to relieve the skin, to relieve ischemia. Therefore, nurses, thereby it relieves chest pain, relieves your chest pain. Tama? This is the purpose of giving your oxygen. To relieve ischemia, thereby relieves chest pain. That means, sa MI, ibig sabihin, what relieves chest pain? Saying that, nurses, guys, analyze the question. Class again, what relieves chest pain? Morphine, oxygen. Ang sagot, morphine, oxygen. Ang sagot, answer is, very good, oxygen. Kasi unang beses, nurses, hindi ka naman nagka-MI kasi nakulang ka ng morphine. Tama? Kundi ang heart mo mismo, nakulang ka ng oxygen. Ay, nagka-chest pain ako. Bakit? Ay, nakulang ka ng morphine. Ayusin mo, ha? Nakulang ka ng morphine kasi kitingan, ha? Nurses, kasi ako mag-triplanting ka na lang, ha? Nurses, madali yun. Hindi kailangan ng utak yun. Tama? Okay. Okay, kasi bakit ka nagka-MI? Kasi nakulangan ka ng oxygen. Kasi guys, isipin mo to, hindi dahil nakulangan ng morphine. Later on, when we talk about plus morphine, the main purpose of morphine, it's not primarily to relieve chest pain. But the goal of morphine, since siya again ay narcotic, the goal of morphine is to decrease the oxygen demand, thereby decreasing oxygen consumption. This is the main purpose of morphine. Ngayon, pakinggan na buti guys, nurses. Tingnan again. Class, analyze the question. Class, dapat maintindihan mo yung concept na ito. Yun. Class, ang purpose, again, kanina kas, what relieves chest pain? Ang sagot is your oxygen. Sir, bakit? The purpose is to relieve ischemia, diba relieves chest pain? Kasi bakit ka chest pain? Kasi kulang ang heart ng oxygen. Tama ba? O ngayon, kasi parang ito lang guys, nurses. Now, does all muscle needs oxygen? Analyze the question. Does all muscle needs oxygen? Lahat ba ng muscle natin, kailangan ba ng oxygen? Guys, yes or no? Guys, tanggalin ko muna, ibabalik ko lang po. Again, does all muscle needs oxygen? Yes or no? Yes. Tama ba? For example, now, na ikay tumatakbo, therefore kasi tumatakbo ka. Habang tumatakbo ka, gumagamit ba ng oxygen ang muscle mo sa paa? Yes or no? Yes. Kapag once ba ubusan oxygen kas ang muscle mo sa paa, kaya nagkaroon ka ng muscle pain. Kaya nagkaroon ka ng muscle pain. Kapag sa umaga pagising mo, ang sakit na makasukasuan mo kasi na-overuse yun kahapon, lumabas ang lactic acid, nagkaroon ka ng muscle pain. Tama ba? Kaya therefore, kasi kapag si muscle na ubusan, magkaroon ka ng muscle pain. Pag si heart, again, naubusan, therefore, kaya nagkaroon ka ng chest pain. Nagkaroon ng chest pain. Pag wala kang chest, ang tawag ng back pain, hindi guys, yung chest pain pa ang tawag dito. Huwag kang ha? O bakit? Mana sa papa niya. O bakit? Okay, sige na. Nagantingan tawag pa rin doon. Chest pain. Guys, tandaan mo. Class, tingnan. Class, wag mong dibdibin ang problema kung wala kang dibdib. Ay, hindi kasi ganun. Anong ibig ko sabihin guys? Pag wala kang dibdib, tandaan guys, versus. Tingnan na, class, wag mong class, class, okay lang po guys, versus. Tingnan na, class, bakit therefore necessary? Kaya na class, kapag inakis, pag heart yun, class, chest pain, patawag. Tandaan class, tingnan na, okay, necessary, tandaan. Class, pag wala kang dibdib, class, okay lang. Tandaan mo, may likod ka pa. Tama ba? Okay, therefore, class, this is your class again. In a case again, kapag nagkaroon ka ng chest pain. Tama ba? Okay guys, nurses ha, tandaan po to. Kasi sabi nila kasi tingnan ha, ang sabi nila, kapag tumatakbo ka daw nurses at hindi umaalog yung dibdib mo, therefore class, isa kang lalaki. Oy, hindi po totoo yan ha. Okay class, wag ganun ha. Okay class, hindi ganun ha. Okay class, wag kayong ano ha. Okay. Okay class, here you go. Tingnan, tingnan. Dito class again, tandaan po to ngayon. Ang ibig ko sabihin guys, tandaan. All muscle needs oxygen. Pag si muscle pain. Pag si heart, nagkaroon ka ng chest pain. Pag si heart kasi nagkaroon ka ng chest pain. Tama ba? Same lang po yan. Kasi nagkaroon ka ng chest pain. Tama ba? Okay. Kapag si muscle pain, pag si heart nagkaroon ka ng chest pain. Tama ba? Okay, good. Therefore, classing yan ha. Okay, class, nagkaroon ng chest pain ha. Pasmado ang bibig ng beshi ko. Bakit may... Okay, sige. Okay, therefore, classing yan ha. Okay, dyan. Classing, bakit ganun kasi guys, nurses ha? Patandaan po yan. Okay, therefore, class, this is now, you have your class chest pain. Therefore, class, question. Balik po tayo, class. Here we go. Third question of the exam. Class, in a case of MI, kulang ba ng oxygen yung heart? Yes or no? Yes. Kapag kulang dadagan, pag sobra bawasan. Pag kulang dadagan, pag sobra bawasan. Kaya therefore, what oxygen should be given? High or low? USR and high or low? Ang sagot is pag kulang dadagan, pag sobra bawasan. High or low? Ang sagot po sa exam answer is very good. Ang sagot is high. Ang sagot is of your high oxygen. You have to give ano siya? High oxygen. Kasi high oxygen. Kasi parang ikaw lang, di ba? Pag kulang allowance mo, ma. Kulang allowance ko. Tara na, punta ka dito, bawasan natin. Ha? Bakit na bawasan? Ba kulang na nga, di ba? Nagkabawas ka pa, ha? Siyempre, high. That's why class again, high. Class, as class in a case again, since kulang, you have to give high. Class, binibigay at least 6 to 8 liters. 6 to 8 liters again per minute class high. Sir, bakit daw high? Bakit daw high class kinibigay? Ano ang purpose? Bakit bibigyan high? Kasi class again, high, bakit itaas mo ito? Doon mo na to. Tama ba? Bakit high? Bakit high? Mataas ba? Yes or no? Yes, dapat ano siya? High. Yes, the best. Ano siya? High. Bakit nas high? Kasi ang purpose is to saturate the ischemic myocardium para masuplayan mo ang kakulangan ng myocardium. Tama? Okay, the purpose of is to saturate. Ginawatugin to saturate. This is the main purpose, to saturate the ischemic myocardium. Alam ko sa mga exam dati, ito yung exact word again na nakalagay doon. What is the purpose of giving high oxygen? Ang sagot is to saturate the ischemic myocardium. To saturate what? Ang siya ischemic myocardium. Saturate din the ischemic. Kaya sa live pa natin, hopefully guys, nakita pa sa screen pa natin. Let me see, silipin natin. Ayan, okay. To saturate the ischemic again, myocardium. This is the purpose. Again, saturate the ischemic. Again, you have your myo plus in myocardium. Tama? Okay, good. Guys, sources, guys, tatlo na po again ang NCLEX exam question na maaaring iikot po dito when you answer the exam. Here we go. First question. Sagutin ng mabuti, guys, sources. Sagutin ng mabuti, guys. Tingnan. Here we go. Class na kaskintingan, sagutin ng mabuti. Here we go. Tingnan, ito again. Una, guys, sources class, balikan natin. Una, the nurse is caring class for Mr. Clarkson, diagnosed with acute myocardial infarction. The patient complains of chest pain. First question, what is the cause of chest pain? Ang sagot ng INAP, myocardial ischemia. Pag walang ischemia, ang sagot sa exam, myocardial insufficiency. Myocardial insufficiency. Second question, the doctor ordered that the patient should be given oxygen. Should be given class oxygen. What is the purpose of oxygen? Ang sagot mo, class, to relieve ischemia, thereby it will relieve your chest pain. Maybe your chest pain. Okay, what relieves chest pain? Morphine, oxygen. Ang sagot, walang sagot ng moxygen. Ayusin nyo. Ang sagot, oxygen. Moxygen. Answer is oxygen. Answer is oxygen. Tama? Third question, guys. USRNs. Team live po natin, guys. Pakisabay na rin. Team live again. Now, class, what oxygen should be given? High or low? Ang sagot is high. Bakit daw high? Ang sagot, bakit high? Ang sagot, answer is to what? Is to saturate the ischemic myocardium. myocardium. Para guys, masupplyin mo ang kakulangan ng myocardium. Kaya the first time again na ma-admit yan pag sa ER test, pag unang-una, pag-admit yan guys, dapat mataas yung oxygen para masupplyin mo ang kakulangan ng ating myocardium. Tama ba? Okay, good. Later on, class, can recall nurses, look at this one. Now, class, later on, ang patient kasi may characteristic yan ang chest pain na ng patient. Guys, again, here we go kasi later on, sabi ko, ang chest pain class, the patient mayroon siyang specific characteristic para kasi malaman mo if this is already class in your MI. Class, ngayon class, leave it blank muna guys, so di mo ito mabuti. Here we go. Dito muna tayo kasi we go. Ngayon, kapag ang patient kasi by MI, therefore kasi question again from my MI, therefore class again, recall question. Now, class, in a case of MI, what is the specific characteristic of MI class? How would the nurse describe again the chest pain? What is the characteristic of chest pain class? How would this best describe the chest pain? Characteristic. Characteristic. Therefore, this is your characteristic. That's your characteristic. Okay. Characteristic again of your chest pain. How would you describe the chest pain? Choices again, class ganyan. Oh, guys, A, stabbing, B, knife-like, C, crushing, D, tightness. Guys, alam mo, lahat na sources sa libro nakikita ko yan, iba-iba ang ginagamit ng author. Paano kung lahat na yan na sinabi ng author, andyan guys sa exam mo, ano ang pinaka-best na gamitin mo? Kasi ikaw mag-decide. Kasi guys, sige na, ikaw mag-decide yun. Stabbing, knife-like, crushing, tightness. O, class, ganyan na. Okay, class. How will you best describe? Sige, best answer. Ano yan? Class, ano siya? Answer yes. Ano siya? Okay. Stabbing, knife-like, crushing, tightness. Pag-guys ka ba chest pain, guys? Team live po natin. Let me see in 5. Dapat masigot 4, 3, 2, 1. Nurses, guys, okay lang magkamali. Tandaan kasi, magkamali ka, hindi talagang parents mo na puro mali sagot mo ngayong araw. Tandaan yan, ha? Hindi talagang anak mo na puro mali sagot lagi ng mama mo. Tama ba yan? Ano? Basta, guys, alam niya kasi nagre-review ka lang. Tama? Okay, therefore, class, here we go. The best answer is very good ang sagot sa exam. Answer is, very good sagot is chest tightness. Okay, sabi ng pasyente, naninikip ang dibdib ko na para bang inuukuan ng elepante? Yes, agad kasi na, sabi niya, naninikip ang dibdib ko. Ang sagot, the best answer is chest tightness. Kaya kung lahat yan ginamit ng author, ang gamitin mong sagot is chest tightness. Sabi niya, naninikip ang bibig ko. Hindi po sinabi kasi hindi pwede kasi na stabbing. Hindi pwedeng sinasaksak ang bibig ko. Hindi pwede. Kasi pag nakita mo yung jowa mo, kasama yung best friend mo, pumunta ng Baguio, magkasama as a friend. Tama? Ayan. Plus, sinasaksak ang bibig mo. Tama? Yes or no? Yes. So, class Emma ito, naninikip ang bibig ko. Tama? Okay, therefore, ha, na Paulo contest ka, ha? Ang class dito ngayon kasi, ano yan? Chest tightness, ha? Okay, chest tightness. Kasi dito kasi with chest tightness, tama? Okay, therefore, chest tightness. This is the characteristic. Sabi, chest tightness. Naninikip ang bibig ko. Tama? This is your chest tightness. Tama? Okay, here we go sa chest. Okay, tightness. Naninikip ang bibig ko. Tama? Okay, here we go. Sige, balikan natin. That's your chest. Okay, tightness. Okay, here we go. Now, kapag siya therefore kasi in a case again, specific characteristic of chest again, tightness. Question kasi the exam again recall. Now, kapag ang pasyente guys may amay, kasi we go nurses kasi ngayon, guys, pahinga na buti guys, USR, natin nga. Now, class, what is the universal sign? How yun ang pasyente kasi nagka-MI nurses, tingnan na, nagka-MI siya. What is the universal sign? Tama? You have your universal sign. Tama? What is your universal sign? Tama? Guys, sa po class, tingnan na, universal sign, class, again, in the case of your MI. Guys, may napadaan naman class ng ating mga class, ating pastors. Naku, ang dami sobra. And guys, again, class, congratulations, guys. First, a shout out kay Sir Franz Adam Lopez. Class, again, sir, congratulations po. Salamat po, guys. Thank you for parting. Guys, salamat po, sir, guys. Thank you. Okay, sir, again, for being here. Again, sa pag-grab sa classmate niyo po, guys, again, saying that we will be the next again dito and test passer. Salamat po sir, congratulations po. It's a pleasure to be part of your success. Salamat po sir sa tiwala po all throughout guys again. Sign up. Thank you po sir again. Thanks for dropping by. Salamat po. Thank you po sir again. Class pleasure po again seeing you here again sa ating lecture. Okay, here we go class tingnan. Balikan po natin. This will be guys as your universal sign. Okay, here we go class tingnan. Now, class. In a case again is your universal sign again for a person class. Pag universal class, sabihin class universal. Class universal, ibig sabihin lahat na may ito po ang kanyang sign. Universal, kasama na po sa busan. Ito rin po ang manifestation kapag nagka-MI si Sardos. Tama? Class, kasi universe, di ba? Universe niya, di ba? Ibig sabihin, ito na po, class, again, ha? Ang sign again, kapag in a case, again, nagka-MI si Sambujin. Tama ba? Pambihira kasi na ang kalaban ni Voltis Fine. Tama ba? Okay, here we go, class, again, ha? Okay, therefore, class. Ano po ba ang universal sign? Paano mo siya malaman, guys? Sa may MI siya kasi again, paano mo siya malaman din pag choking, di ba? Pag choking, di ba, the person holds the neck, di ba? Class, in the case, kumain ka ng balot, class, kumain ng balot na buo. Tama? Class, pinakain mo ng balot na buo or bumili ka ng turon na malaki sa SM. Tama ba? Habisin yung turon doon. Ang laki ng turon doon, guys, nurses. Yung OB, class, langka na turon again ng SM Hyperbart, ang laki. Pag sinubok mo, nurses, dako, sir, class, again, makita mo, nurses, sobrang laki. Nang sinubok mo, hinawakan mo, guys, yung liig mo. Universal sign, kapag choking, ano yun? The person holds the neck. Tama? When a person holds the neck, therefore, class, diba? Class, yan bang choking? Yes or no? Yes, tama? Anong best question we're going to ask kapag class in choking? Sagot mo sa kanya, tanong mo sa kanya, A, hey, are you choking? B, are you joking? Ang sagot mo, hey, are you? Hey, are you choking? Hey, are you choking? Yan po ang choking. Kasi in class, universal is, ano yan, the person holds the neck. Pero in a case, kapag pumasok ka sa kwarto at nakita mo hinawakan yung leeg niya, ba? Tapos may sigaw na, choke me daddy, choke me daddy, choke me daddy. Nurses, hindi po emergency yun, ha? Okay. Huwag ka mag-intervene, ha? Iba po yung choking na yun, ha? Okay, kasi sabi, choke me daddy, kasi hindi po yun hindi po yun emergency, ha? Okay, therefore, okay, kasi na, hindi ka pwedeng sumali doon, ha? Okay, therefore, klase nga. Now, dito guys, nurses, anong universal sign? Agad tandaan, ha? Okay, therefore, class. Agad, ano po ang universal sign? Kasi nakita mong hinawakan yung leg sa choke with daddy, guys. Wag kang class, pumasok doon. Kasi ang ibig sabihin, nurses, nag-perform lamang sila ng 50 shades of gray. Tama ba? Okay, nurses, class, kaya hindi po emergency yun. Tama? Okay, class, sana all, ha? Pinapalo. Class, nga. Here we go, class, again. What is universal sign? Ang sagot is the person grabs his chest. Tama? When the person grabs his chest, ang tawag na person your, very good guys, answer yung term short class person your, very good class, term short living sign. Term short your divine sign, very good, ha? Again, class, sabi ko, ano yan? Dito ngayon, ano yan? A, the person grabs his chest. B, the jowa grabs her chest. Hindi po yun, guys. Hindi po yun. The person grabs her chest. Ganda. The person grabs his chest. Ang tawag doon, class, living sign. Tama, guys? Actually, guys, tingnan, ang pag-pronounce ito is term as Lavain. Tama? Lavain. So, syempre kay Pinoy, Levine. Tama? Okay, dapat pronounce system siya, Lavain. Tama siya, what is your? Lavain. Lavain, labeda, loca. Lavain, labeda, loca. This is your Lavain. Tama siya, Lavain sign, ha? Lavain sign, ha? The person grabs his chest. Pag mag-class, hindi pwedeng ganon, hindi po yun MI. Kapag gumaganon siya, hindi po MI yun, ha? Okay, guys, hindi po MI yun. Tama? Okay, therefore, classing yan. Ito, guys, dito, person grabs his chest. Again, kasi exam, chest, hand clutching. The chest, hand clutching, or class in chest. Again, chest, hand clutching. Chest, hand clutch. Di ba pag clutch, di ba pinipiga mo? Clutch, pinipiga mo sana all. Pinipiga. Tama ba? Class, chest, hand. Clutching, tama. Okay, therefore, chest hand, if you are clutching, tama. Okay, therefore, class again, chest hand, clutching, tama. Okay, therefore, chest hand, clutching, tama. Ganun sure. Very good, class, tama. Ganun sure. Living sign, class. The person grabs his chest, tama ba? Okay, therefore, class again, the person grabs his chest, ha? Hindi po rin the nurse grabs his chest, ha? Kapag si nurse na grabs sa chest, ipatuloy po mo, ha? Okay, the patient grabs his chest, tama ba? Okay, grabs his chest, tama ba? Okay, good. Ang gagawin represent your loving class, represent your loving side. Ulitin ko guys, balikan kayo na recall nurses guys. Ulitin natin, here we go. Guys, in the case of my class, balikan. Class, what causes chest pain? Use RNs. Answer, myocardial ischemia. In the case of MI, if only one coronary artery is obstructed, isa lang, kapag isa lang ang obstructed, anong tawag doon? Refers to your very good subendocardial. Kapag dalawang USRNs, anong tawag doon? Refers again to your very refers again to your class again your very good transmural. Again, transmural. Tama? Okay, good. Now, class, what is the characteristic? How would it best describe the chest pain? Describe as chest tightness. Ang universal sign, answer is Levine sign. Good. Question. The nurse is caring for a patient with MI. What is the cause of MI? Answer. Direct sagot, myocardial ischemia. Myocardial ischemia. Tama? The doctor ordered that the patient should be given oxygen. What is the purpose of giving oxygen? Answer. To relieve ischemia. Thereby, it will relieve your chest pain. Tama? Okay, good. Third question. What oxygen should be given? Hardo, answer what is high. Bakit daw high? Anong answer? The purpose is to saturate the ischemic myocardium. Therefore, pag magsagot ka sa exam, dito lang po ikot yung sagot mo. Tama? Oh, good. Here we go. Now, una case versus class again recall. Now, class. But, ang sabi sa exam again recall versus class in the case again of your chest pain. That's why the reason sabi ko rin na isentro mo sa gitna po ng notebook nyo ng notebook. Tama? Here we go, class. Kasi sabi sa exam, if the chest pain is on and off, on and plus on and off. On and off. Ibig sabihin kasi pabalik-balik lang ha. On and off. On off kasi pabalik-balik. Kasi pabalik-balik siya. On and off. Kasi on and off. Parang relasyon mo lang dati ha. On and off. Tama ba? Okay. Kasi on and off. Ibig sabihin kasi pabalik-balik lang. Tama ba? Yes ano? Yes na ba? Number the bearable. Bearable nurse. Bearable. Ang ibig sabihin ng bearable. Therefore kasi sabihin kasi kinakaya ba? Yes ano? Yes, tinitiis mo lang. Kasi titiis mo kasi tingin ha? Okay. Kasi tinitiis mo lang. Tama? Okay. Therefore kasi bearable kasi nang hinayan ka. Yung tipong therefore kasi ng best friend best. Iwo mo na yan. Walang kwenta yung boyfriend mo. Naku kasi di po ang kwenta yan. Bes, okay ko talaga mag-iwalay kaming dalawa. Bes, yung boyfriend ba yan? Bes, okay na naman. Bes, kakayanin ko naman din. Matagal na kami. Bes, boyfriend mo. Naku, sabi ko sa'yo, una pa lang, ayaw ko na sa kanya. Hindi ako buto sa boyfriend. Bes, okay naman. Bes. Alam mo kasi nang inaya, okay naman mag-iwalay kami. Pero bes, mag-iwalay kami, okay lang. Pero bes, yung oten, sayang. Iba para pinahinayangan. Uy, class yan. Oh, here we go. Class yan ha. Okay, therefore, class ano siya? Dito, bearable, class yan. Bearable, pambihira, class bearable. Tama? Okay, kay tandaan class, kung si Sir J nga nagsabi kay nurses, huwag ka mag-ala. Pag nakapasa ka, sabi ni Sir J, uulan ng oten. Tama ba? Okay. At sabi ni Sir J, wala ka ng ibang gagawin daw, kundi nganganga ka na lang. Tama? Okay, class yan. Okay, credit to Sir Balicha. Okay, klase nga. Here we go. Dito guys, yes na siya. Bearable kasi bearable. Tama, bearable ha. Take to nurses ha. Kapag umulan yan, please naman ha. Klase tingnan nurses, huwag pagsabay-sabayin. Tandaan, macho-choke ka. Okay. Isa lang, one at a time. Tama? Okay, class, here we go. Tingnan na. Ito yun. Una, class, on off. Number 2, bearable. Number 3, short in duration. Now, pag short in duration, ibig sabihin guys, again, class, again, madali lang ba yun, no? Yes, panandalian na. Short in duration, ibig sabihin, short in duration, panandalian na. Ibig sabihin, short in duration, ibig sabihin, class, pinagtagpo, pero hindi tinadhana. Kasi only short in duration. Kaya class, in a case, short in duration, guys, versus, ibig sabihin, guys, versus, tingnan ha, alam mo naman, class, ang sabi kasi parang sabi lang ni Jollibee. Ang sabi ni Jollibee, ang skin ng Jollibee yan, taas ang kamay. Ang sabi ni Jollibee kung bakit hindi ka nagtatagal lagi ng boyfriend mo, kasi ang sabi ni Jollibee, masarap pero hindi mahal. Tama ba? Masarap pero hindi mahal. Okay, therefore class, only less than 10 minutes. Short in duration, less than 10 minutes. Less than 10 minutes. That's less than 10 minutes. Maximum of 15 minutes. Tama ba? Okay. Less than minutes, maximum 15 minutes. Tama ba? O ngayon, therefore, nurses, ibig sabihin kasi panandalian lang. Tama ba? Panandalian lang. Tama ba? Kaya sabi ni Ann Cortez, di ba? What happens in Bora stays in Bora. Tama ba? Okay. Short in duration. Tama? Short in duration. Tama ba? Okay. Short in duration. Ibig sabihin, if the chest pain is on and off, bearable, short in duration nurses class, hindi pen MI. Ang pagpasa kanya, angina pectoris. Mas watasyon na pa lang siya, angina pectoris. Sir, hindi pa siya MI. Ang pagpasa kanya class, angina. Kasi na siya, angina pectoris po. Ang pagdano kasi your angina, kasi angina pectoris. This is your angina pectoris. Kaya therefore class, ibig sabihin, ano class ang tandaan? In the case of your angina, guys, ibig sabihin, ang angina, same as MI. Ang cause ba ng angina, sharing ba again, ay ischemia? Yes. Same di bang chest tightness? Yes. Same di bang living sign? Yes. Except, class, anong karakteristik ng angina? Ang pain niya is on and off. Number 2, bearable in short in duration. The short angina. Hindi pa siya MI, tag pa lang doon, angina pectoris. Tama ba? Okay, good. Case stress, galingan natin. Now, in the case of angina, guys, alam mo guys, pag angina, forecasting angina has different types. Kasi guys, again, may types ang angina, tama ba? Yes, may types din po agad ang angina, tama ba? May types din po agad ang angina, tama ba? Okay, therefore, kasi dito ngayon, may types din po si angina. Therefore, kasi what are types? Includes, number 1. Okay, so types din. Number 1, kasi una class ito ngayon, number 1. The first type, again, class includes, again, angina. Number 1, una, Are you familiar guys, USR and skin? Pag binanggit ko, number one class reference again, number one reference again, stable. Yes, ano? Good. Again, the most common is reference your stable. The reference what your stable. Huh? You have your stable. This reference again your stable. Tama ba? Okay, this reference your stable. Tama ba? Okay, therefore, reference your stable. Tama ba? Okay, therefore, here we go. Guys, yun that. Kapag may stable, may very good, unstable. Pag may high, may low. Very good. Pag may yes, may no. Very good. Pag may close, may open. Pag may papasamay, kinabahan ka, di ba? Class again. Siyempre, class again, nurses again. May, again, kung may papasamay, siyempre, guys, again, siyempre, nurses, class again, may USRN. Na ba? Okay, good. Again, your forecast, pag may stable, may unstable. Stable, end of your unstable. Na ba? Okay. Stable, class again, may wrong, unstable. Na ba? Pag may stable, mayroon kang unstable. Your forecast, can tatlo yun. Your forecast, here we go muna. Stable, unstable. Ang major type includes loss, also refers again to your pamilya ba pag binit ko nurses sa exam refers again to stable, unstable. Number 3 refers yun friends metal. Again, friends metal, may pa lab chair. Uy, ang lab chair ko hindi pa dumating. Alam mo, na-expect ko talaga yon. Yung lab chair ko kasi malapit yung fiesta, guys. Ilagay ko sana sa sofa namin. Okay, yung lab chair. Sana may mga 6 kayo, guys. Kasi pa-open ko yung bisita doon. Ang sarap na sa ano ba? Guys, nagulat ako nang pumasok ko ng hotel. Bakit may ganun? Akala ko ang ganda ng upuan. Kasi ano tawag dito, guys? Parang kayo ito, upo. Maganda yung pakiramdam pag umupo ka doon. Bakit may ganun? Ano klaseng upuan? Bakit may ganun? Paglasingin na, okay, therefore, bakit gusto ko, ba't may ganun? Tapos mag-order ka, guys. So, magpadala ko ng lab chair, please naman, guys. Ang ipabalot nyo. Baka nakakarga sa motor ng Shopee, ha? Kitang-kita. Tapos nakakapit bahay ko nakatingin. Bakit may order na ganito? Okay, guys. Dito, guys, versus tingnan. Ito yun. Pag may stable again, tanda na. Okay, class again. Pag may stable, ha? Okay, class again. Siyempre, class again. Pag nakapasa na, gagamitin mo na ang lab chair mo. Tama ba? Okay, therefore, class na, bebe. Snacks lang, bebe. Okay, therefore, class again, tingnan. Dito, class again, tingnan. Dito yan. Okay, therefore, class dito ngayon, ha? Okay, therefore, this is your stable. Number 2, you have your unstable. You have your unstable. Kasi you have your unstable. You have your unstable. Tapos yung last, again, refers your friends method. Again, refers your friends. Kita to yan. Stable. And so last refers again your friends method. Last refers your friends, again, friends. Method as friends method. Now you have your friends method. Therefore, the 3 type includes stable, unstable, friends method. Here we go, guys. Tingnan. Here we go, stable. And so you have your friends method, your friends method. Tama ba? Okay, here we go, guys. There's this, guys. Ito ngayon again. Now, class. Kapag in a case, tas ganyan, ha? Okay, stable and you have your unstable. Therefore, as you recall, you have your friends method. Question. What is another term for stable? The stable is term assured what? Typical angina. Known as what is your typical. Pag stable, ang tawag na refers again to typical angina. Refers again to typical, ha? Ang tawag na refers again to typical. Typical kasi typical angina. Ngayon, siyempre guys, tawag na refers to typical, ha? Typical kasi typical angina. Typical. Ngayon, plus siyempre typical kasi typical. Parang crush mo lang dati. Ano lang siya? Ang ganda niya? Typical. You're typical. Pag may typical, may walang tropical. So, ang tropical dyan, pambihira kasi ganyan, ha? Sabi ko sa inyo, guys, sa pag-feeding program ka na lang, ha? Pag typical, may atypical. Buti lang, walang tropical. Lagi mayroon kang atypical. Pag may typical, may siya mayroong atypical. Mayroon kang atypical, mayroon kang atypical. Tama? O, syempre, guys, again, pag friends metal, known again as your variant angina. Refers what to your variant, plus variant, plus your variant angina. Ngayon, tatlo yan. Stable, unstable, last refers your typical or variant. Tama? Okay, here we go. Now, guys, versus last have here nurses, guys. Balikan natin. Kapag stable, guys, versus, ano bang stable? Stable is accompanied by stable, predictable, or unpredictable pain. Predictable or unpredictable? Class USR. Answer good. Answer, ano yan? Answer yes. Accompanied by what? Answer good. Very good, guys. Again, predictable pain. Team live po natin, guys. Again, tingnan, ha? Okay, class. Again, represent your class. Accompanied by what? By your predictable pain. Predictable pain. Therefore, kasi predictable. Kasi predictable pain. Tama? Kaya therefore, pag stable kasi, ano bang stable nurses? Naku, sir, parang galaw lang ng boyfriend mo. Napaka-predictable. Napaka-predictable, ha? Napaka-predictable. Kaya pag boyfriend pa, alam, be, o, ano naman kayo problema mo? Be, bakit? Be, alisan ako. Saan pupunta? Be, change oil ako, be. Change, ano sabi mo? Change oil, be ba? Change, ano sabi mo? Change oil. Kapo ka lang change oil, bakit ba change oil? Kasi naku, wag mong payagan. Ibang change oil yun, ha? Be, yung motor kasi, be, dalawa. Yung dalawa ba? Yung isa, change oil. Pag change oil, guys, sundan mo na, ha? Okay, sige na, ha? Okay, therefore kasi, be, barado karburador. Ayusin nyo, ha? Nurses, ha? Okay. Ang galaw ng boyfriend mo, ano yan? Napaka-predictable. Okay, napaka-predictable. Tama ba? Napaka-predictable. Therefore, class, ibig sabihin na siya, dito represent your stable, if you're stable. Tama ba? Okay, therefore, class. While, kapag stable siya by predictable, therefore, pag unstable, ano yan? Accompanied by what? On your unpredictable. Kasi unpredictable. Kasi unpredictable pain. Kasi siya ay unpredictable pain. Unpredictable kasi niya your pain. Ibig sabihin guys, anong stable? Ang stable kasi para gano'n ng boyfriend mo napaka-predictable. Anong unstable? Parang utak ng babae, unpredictable. Tama? Yes or no? Yes, maniwala ka. Alam mo mga girls natin guys, pasimple lang po ito. Gulat lang minsan kapag umaga ka, sobrang napaka-sweet niya, naka-my-day ka, pagkapon inaaway ka na. Tama ba? Ganun po. Inaaway ka na taba? Okay, kasi inaaway ka na taba? Okay, abising ka sige na. Kasi guys, anong galing mga babae ka, sabi nila, naku, kasi ako pa mag-asawa ka na, di ba? Naku, kasi sabi nila kasi sabihin, sa mag-asawa na, kasi dapat class, maroon ka na, kasi maroon ka na obligasyon. Kapag babae ka, nurses, ikaw ang ilaw ng tahanan. Taba? Kasi pag nawala ka, brown out ang bahay. Hindi guys. Okay, tingnan again. Tandaan kas palagi na. Kapag again class game recall, pag babae class, ang utak is unpredictable. Ang babae daw, nurses, alam mo guys, naku mababae ito, may mga bagay-bagay sila na sila nakakaintindi. Tama? Kapag class, alam mo kung bakit, pag mag-usap-usap sila, naku, maniwala ka. Huwag mong kausapin ang girlfriend mo kasama yung mga friends niya. Bakit? Alam pagkausap niya, wala kang kakampi. Tama ba? Uy, nagkakampi-kampihan ang mga yan. Akala mo lang. Nagkakampi-kampihan. Tama ba? Okay, class, ganyan. Kaya bakit sabi nila, mabagal kumilos, mabagal magbihis, mabagal kumain, pero mabilis magduda. Tama ba? Napaka-predictable. Unpredictable. Tama ba? Okay, kasi ha, kunwari class, kinakatingin lang pro class, inaalam pala ang password ng cellphone mo. Tama? Okay. Therefore, class nga. Here we go. Dito ngayon. Oh. Dito guys, again, tingnan, you have your unpredictable. Tama? While, in the case, again, therefore, pag press mo, anong cause? The cause is due again to your class vasospasm. Tama? Okay. Due again to your vasospasm. Ang cause is vasospasm. Due to vasospasm, guys, sir, sasayin, due to vasospasm. Sir, bakit nagka-spasm? Due to vasospasm, sir, bakit nagkaroon siya ng vasospasm? Nagka-vasospasm ba siya? Bakit nagka-vasospasm? Bakit? Na John Lloyd at siya ina ba? Hindi. Klase gina. John Lloyd at siya ina. Uy, ano yun? Klase gina. Hindi. Klase gina. Now, pag vasospasm, bakit spasm? Anong cause? Due to exposure to cold. Exposure to cold. Due to exposure to cold. Exposure to cold. Ang ibig sabihin due to exposure to cold. Ibig sabihin kasi tingnan na magalit ang girlfriend mo. Ha? Nilagay ka sa freezer. Unpredictable. Tama? Naku class, andun ka, naka-chest pain ka, hinanap ka agad ng mama mo, andun ka sa loob ng freezer. Tama? Class again, due again to exposure to cold. Ha? Nanlamig ka na. Tama? Exposure to cold. Tapos exposure what again to cold. Very common yan kapag sa US ka during winter. Tama ba yes? No? Yes, lumalabig. Exposure again to cold. Nagkaspasm ka, nagkaroon ka ng chest pain. Tama? Okay, here we go. Now, guys, kapag sinabi sa exam again recall, nurses kasi recall na una, kapag accompanied by predictable pain, stable. Kapag unpredictable, ano yun? Unstable. Kapag due to vasospasm, transmitted. Question, what type of angina again, because angina occurs during activity. Stable, unstable. What angina occurs during activity? Stable or unstable? Yes, ours was the answer. What angina occurs in activity? Stable or unstable? Answer good is answer. Good answer good, stable. Bakit kasi again? Kasi guys, expected yan once may activity ka, nagka-chest pain ka. Tama? Nagka-chest pain ka. Ang ibig sabihin class, that is class occurs on activity. This one occurs on activity. May ginawa ka. Occurs on activity. Occurs on activity. May ginawa ka, nag-jogging ka. Tapos again, pag ginawa ka, nag-jogging ka, tingnan mo, nag-tree-planting ka. Occurs on activity. Tama? Basta may ginawa kayo guys, ha? Nagkaroon ka ng chest pain. Nagkaroon ka ng chest pain. Tama? Okay, therefore, occurs on activity. Tama ba? Okay, ibig sabihin, basta may ginawa ka, ang ibig sabihin guys, versus again, that is term as your stable. While, ibig sabihin, yung tipo nakaupo ka lang, nanood ka ng TV, kasi recall, or naglalaro ka ng computer, magka-chest pain ka. Ano yun? Stable or unstable? Ano yun? Unstable. Bakit ano yan? Unpredictable. Ibig sabihin, it occurs at rest. Occurs at rest. Gabisin occurs again at rest. As occurs again at rest. These angina occurs at rest. Again, occurs again at rest. This one occurs. And occurs again at rest. Mga tao na ganoon kasi yung kumain lang sa restaurant tapos bigla nagka-chest pain. Tama ba? Plus again, occurs at rest. Tama ba? Yung tipong nanood ng TV, nagka-chest pain. Plus again, that is your siya, unstable. Napakadelikado, di ba? Occurs at rest. Again, occurs again at rest. Tama ba? This one occurs again at rest. Tama ba? Okay, this one occurs again at rest. Tama ba? Okay, good. Therefore, here we go guys. Wait lang guys, bunutin ko lang aking charger. Ha? Okay guys, sige tingnan na. Kasi kanina pa siya plus again nurses dito nakabaon. Tama ba? Saglit lang. Sana all. Ba? Okay, kasi nga na. Okay na ba? Wait lang guys ha. Okay, bunutin ko po muna. Okay, here we go class. Okay guys, again. Of course, again, at rest, na ba? O ang ibig sabihin guys, sources nga na. Ito napakadelikado. Now, sa dalawa kasi na stable, unstable kasi precious metal. Stable, unstable precious metal. Sino ang malapit-lapit could predispose feeling mo to MI? Stable, unstable, precious metal. Sino kasi recall again ang high risk na magka-MI na? Sino yon? Stable, unstable, precious metal. Sino sa dalawa? Sino sa tatlo? Answer? Very good. Unstable. Pag unstable, anytime pwede ka pala magkadiretso sa MI. Ibig sabihin, this could predispose to MI. This is the type of angina highly classic prone to predispose or to develop your MI. Tama? Okay. Here we go guys. Again. Now, tingin sa board class versus guys. Ito yun again. Now, ibig sabihin when you answer the question guys, USRS. Imagine mo lamang class, look at this one. Now, maglito ng example para mas bilis mo siyang maintindihan. Here we go. Imagine mo naman guys versus if this your blood vessel, and this again is your blood vessel. Tama? O ngayon, here we go. Kapag blood vessel, may have two blood vessels. This is your coronary artery, this is your blood vessel. Guys, again guys, depende ko sa mga lagay ng part ng notebook, basta may space ka, okay lang po yan. Here we go. Kapag blood vessels natin, again, let's recall. Kapag blood vessels natin, what is term again is your plaque formation? Plus plaque formation, guys, refers to atherosclerosis. Ather, tama? Okay, ather. Therefore, kasi again, kapag may obstruction, therefore, obstruction, partial obstruction, class, ibig sabihin, class, nag-decrease bang blood flow? Yes or no? Yes. Pero, nakakapasok pa rin bang blood flow? Yes or no? Yes. Good. Ibig sabihin, once nakapasok pa rin blood flow, therefore, nurses class, ibig sabihin, class, nakapasok pa rin. Ibig sabihin, guys, kapag partial class, ibig sabihin, class, ang tagulong class, represent your angina pectoris. Ibig sabihin, kapag in a case again class ginto ngayon, nakita mo therefore class, kapag in a case again nakapasok pa ang dugo class, ibig sabihin class, that is an premature angina. Then again also sure, angina. That's the reason kung bakit guys versus angina yan. Ito pong dahilan kung bakit guys versus kapag ang blood flow mo hindi po consistent, kaya ang pain mo is on and off. Minsan lalakas ang daloy, minsan hina. Lalakasina on and off, bearable in short in duration. Tama? Short in duration. Pero guys, tandaan mo, there will come a time guys versus that these blood vessels will cause total occlusion. Will cause total occlusion ngayon. Guys, again, tandaan USRS again. Kapag nakaroon ng total occlusion, therefore, once occluded na po siya dito ngayon, class, recall, ang tanong guys versus, makadaloy pa ba yung blood flow? Yes or no? Class, makadaloy pa ba yung blood flow? Yes or no? Ang sagot is no. Ngayon, pag hindi na po makadalaw yan, ibig sabihin class, ang opposite side nito guys versus, magkakaroon ba siya ng tissue necrosis? Yes or no? Yes. Magkakaroon siyang tissue necrosis. Nurses guys, tandaan USRS. Sige, here we go. Kapag nagkaroon na po siya again ng necrosis, again, mayroon siyang necrosis, may cell death na po yan. Kapag may necrosis, therefore kasi mayroon siyang presbyopia necrosis. Kapag may necrosis, hindi na po yan angina, guys, ang tawag na sa kanya, myocardial. Kasi myocardial infarction. Anong ibig ko iparating? That means, guys, USRS nga, does MI and angina, do they have the same physiology? Same ba ang physiology ng MI and angina? Yes or no? Yes. Except, na pag partial occlusion, pag partial pa lang, tagon, MI angina, partial pa lang, tawag ito refers to Breguetagon angina. Pag total occlusion, guys, USRS, ang tawag sa kanya, MI. Tama? Ibig sabihin, guys, versus, sino class negative for necrosis? Negative for necrosis, kapag walang necrosis, ang tawag pa lang doon, Breguet angina. Presence of necrosis, ang tawag doon, MI. Breguet kasi partial occlusion, ano yun? Angina. Total occlusion, ang tawag doon, MI of your MI. Tama? Okay guys, kitandaan nyo guys, versus and then again recall. Sa angina guys, kanina, if you notice therefore, the pain here is on and off. Ano pa? Bearable in short duration. Kasi guys, again, hindi consistent ang blood flow. Pag MI, kapag once may necrosis, the pain which is on and off, bearable, short duration, this will aggravate. Bakit kasi ganito yan? Kaya the pain which on and off, kasi this will become already permanent. Will become already permanent. Will become already permanent. Tama? Ang sakit na will become already permanent. Will become already permanent. Tama? Ang short duration, which is less than 10 minutes, will become already long, because long in duration. Kasi long in duration. Because long in duration. Tatagal na po siya, long in duration. So usually, ang pain now is more than 10 minutes. More than 10 minutes. Usually, kasi more than, again, 10 minutes. Because therefore, this is now plus more than greater than 10 minutes. And therefore, kasi the pain already guys ito ngayon cannot be relieved by rest. Cannot be relieved by rest. Terminate po natin guys, again, makisabay na po sa this is cannot be relieved. Again, cannot be relieved by rest. Again, cannot be relieved. Again, relieved again by what? By your rest and by rest. Ibig sabihin guys sa exam, anong rule? Again now, if the pain is class permanent, long duration, and cannot be relieved by rest, guys, versus hindi na po yan angina. Ang tag na sa kanya, reference to your myocardial infarction. Reference to myocardial infarction. Now, these are possible what myocardial infarction. Myocardial infarction. Therefore, guys, versus anong rule? Does MI and angina, does they have the same physiology? Yes or no? Yes. Tama. Class. Except, what differentiates MI to angina? Teamlight po natin makasabay. Class, again, recall ano yan? What differentiates? Class, answer is A. Onset. B. Characteristic. C. Duration of chest pain. What differentiates MI to angina? Onset, characteristic, or duration? Guys, class, again, USRS, INA. Answer is, very good. Answer is duration of your chest pain. Bakit? Kasi pag less, bakit less duration? Kasi, same ba ang MI angina? Same ba silang chest tightness? Yes. Same ba silang Levine sign? Yes. Except kapag less than 10 minutes, ano ka pa lang? Angina. Kapag more than 10 minutes, ano ka na ngayon? MI. Kaya what differentiates? Answer is, it is that duration, what duration of your chest pain. Duration what of your chest pain. Taba? Okay, good. Therefore, class, ngayon, okay, let's try. Ask, sabihin sa akin, therefore, class, recall, identify your questions. Sabi sa akin, MI or angina. Balikan muna kayo na, what angina is accompanied by, again, by predictable pain. Team life po natin, guys, predictable, predictable. What is predictable pain? Answer good is, ano yun? Predictable is stable. Becomes unpredictable. Ano yun? Unstable. Now, exposure to cold. Answer good is, good. Friends method. Okay, friends, metal highly risk to predispose or proceed again to MI. Sino yun? Ang sagot is, ano yan? Good. Unstable. Unstable. Good. Very good. Answer. Of course, on activity, may ginagawa ka, naka-chest pain ka, tama? Ang sagot is, answer is, ano yan? Very good. Answer is, ano yan? Very good. Stable. Tama? Okay, good. Therefore, guys, ito po gagawin natin. Okay, therefore, let's try. Sabihin sa class, MI angina, MI again or your angina, guys, USRS, okay lang ba? Tanggalin ko po muna ang ating screen. Yes, ano guys, versus, okay lang ba guys, versus collect clear screen. Ibabalik ko lang po. Yes, ano? Yes, okay, good. Therefore, class, kitingan na, ibabalik ko muna kasi in 3, 2, okay, 1, guys. Therefore, class, sabihin sa akin, class, MI angina, MI or angina, guys, versus walang sumagot ng angina, ha? Class, isa ba ng angina, guys, ayusin nyo, ha? So, ba ng scrotum sa kita ng noo, ha? Hawiin mo lang kapag sa gabal, kasalanan mo yan. Okay, dito tumubot. Pag dukas kiting ha, huwag may gawlang ulo kasi tutunog yan parang lato-lato lang. Okay, therefore, class, here we go. Let's take sabihin sa akin, MI again or your angina? MI angina? MI or angina, guys? Magkalaman nurses, guys, ako'y magtatanong lahat ba isasagot? Yes, ano? Yes, very good. Class, again, ringan. Nurse, magka-smile. Yes, para di halata. Yes, na mali ang sagot? Yes. So, therefore, let's try. Sabihin sa akin, MI or angina? Magkalaman again, nurses, kaya? Yes, therefore, nurses, let the game begin. Okay, therefore, number 1, una, nurses, on and off. Answer? Very good, nurses. Tamang-dama o kayo. Kasi pambira ko kasi. Answer? Angina, very good, class. Cannot be relieved by rest. Ang sagot yun. Ano yun? Answer is, ano yun? Very good, MI, very good, nurses, less than 10 minutes. Less than 10 minutes. Team live po natin. Ano yun? Answer? Angina, very good, guys, nurses, class. Again, tingnan. Class, Ken. Tingnan. Class, ibig sabihin, total occlusion. Total occlusion. Sino yun? Answer? MI presence of necrosis. Presence of necrosis. Ang sagot, ano yun? Ang sagot is, very good answer. MI, very good, nurses. Kasi can recall, nurses, short in duration. Short in duration. Ang sagot, ano yun? Angina, angina, very good, guys. Nurses, class, can recall. Tingnan, class, the pain again, class, cannot be relieved by rest. Cannot be relieved by rest. Ano yun? MI, very good, more than 10 minutes. Pag more than 10 minutes, answer? MI, very good, less than 10 minutes. Less than 10 minutes. Answer? Angina, most life-threatening between the two. MI, angina, most life-threatening. Ang sagot is between the two. Answer is MI. Good. Guys, pakinggan na buti. Here we go. Pag sinabi kong angina, marabang N. Yes or no? Yes, angina, marabang N. Yes, yes. And then N kas ke N, drug ba N nitroglycerin. Yes or no? Yes. Pag sinabing MI, marabang M. Yes, kaya ang drug is M is M, wala ba? M, morphine sulfate. Morphine sulfate. Tama ba? Yes. Kapag angina, marabang N. Yes. Pag N, anong gamot sa N, NTG, nitroglycerin. Pag MI class, anong gamot? MMM, M, morphine sulfate. Kaya question, class, relieved by nitroglycerin. Relieved by nitroglycerin. Sino yun? Ang sagot is, very good. Ang sagot is, good, angina. Relieved by morphine. Ang sagot, MI. Kasi guys, ang libro, balibliftarin mo. Sabi ng libro mo, pain cannot be relieved by nitroglycerin is termed as myocardial infarction. Kaya what relieves, again class, only class relieves the pain na my answer is, you have your morphine. Tama? Kasi pain can't be relieved again by nitroglycerin is termed as myocardial infarction. Tama? Okay, good. Ibig sabihin guys, yourselves, sino ang binibigyan ng morphine? MI. Tama? Okay, your MI. Tama? Okay, good. Guys, yourselves guys, kaya balikan po natin guys, yourselves. Ito ngayon. Here we go. Now, ibabalik ko po yung ating screen guys, yourselves. Look at this one guys, yourselves. Ibabalik ko kasi natin in 3, 2, again, 1. Guys, yourselves again. Here we go. Now, class question. Now, in a case of your MI guys, yourselves again in your angina. Class, look at this one guys, yourselves. Balikan natin. Now, class, ang question of the exam again, recall now. Class, in a case of MI, what is the most life-threatening complication, guys, when a patient develops MI? What's the most life-threatening complication? Choices: A, ventricular arrhythmia, B, cardiogenic shock. What's the best answer? What's the most life-threatening complication in a case of MI? Most life-threatening complication, answer A, ventricular arrhythmia, B, cardiogenic shock. Answer, good answer is, okay, class nurses, are you sure? Sure na sure ba kayo siya? Nurse, paglalaban. Hanggang kamatayan. Okay, balikan class Nicole. What is the answer, guys? Sige, tingnan. Here we go, class tingnan. Now, pag sinabi sa exam, most life-threatening nakakamatay. Kasi life-threatening nakakamatay. The most life-threatening complication as sa exam is, answer is, very good class, ang good is ventricular arrhythmia. Tama? Kaya walang pasyente na MI na walang cardiac monitor. Diba? Sabi siya sa pasyente, nurse, I have chest pain. O anong unang sagot ng doktor? Automatic stat, ECG. Kaya walang pasyente na MI na walang cardiac monitor. Kaya pag sinabing, what type of shock occurs in MI? Ang sagot is what type of shock? Ang sagot is cardiogenic shock. Cardiogenic shock. Pag life-threatening, ang sagot is sa exam is a ventricular arrhythmia. Tama? Okay, good. Therefore, last what, here we go. The complication class when the patient can develop severe MI. Guys, versus okay, but can I clear the screen, guys? USRS. Can I clear the screen? Yes, I do. Good. Okay, for that, let's clear 3, 2, okay, 1. The furnaces, guys. Again, here we go. Let's about class the complication class when the patient develops already myocardial infarction. Tama? Okay, therefore, last account. Here we go. Dito ngayon, you have your complications class when the patient develops MI. Tama? You have your complications. Again, complications class, complications. What of your MI class? There's what of your MI class. These would begin as your complication when the patient develops myocardial infarction. Number 1 class. Here we go. Class number 1. Ngayon, again, tingnan. Now, pag sa exam guys, first, again, recall, you have your class complication class when the patient develops again, you have your MI. Let me see, tingnan po natin guys, pag-isabay na rin po again, tingnan, here we go. Now, pag complication kasi, MI class, balikan natin kasi, sabi nyo bago lang guys, first, here we go. Now, kapag siya again, I have your complication. Ngayon, now, kapag ang pasyente kasi nagkaroon again ng MI guys, in the case of your MI question, ano po ang life-threatening class again, ang sagot sa exam kanya, walang iba, answer is ventricular arrhythmia. This is the most, I think, is walang iba, ventricular arrhythmia. Tama ba? Okay, good. Ventricular arrhythmia. Ventricular arrhythmia. Ibig sabihin class, it's the irritability of the ventricle. Ventricular, you have your arrhythmia. Tama ba? Okay guys, tandaan guys sa exam USRN. Sige, class. One is kasi arrhythmia or dysrhythmia are the same. Tama, arrhythmia or dysrhythmia are the same. Kasi ang sayang guys, sir, dati man nag-exam estudyante ko, sabi ko, guys, sir, wala ba doon sagot sir again? Kasi guys, at tinuro ko ventricular arrhythmia, pambira na kita sa exam, ventricular dysrhythmia, hindi sinagot guys. Tingnan, again, tandaan. Kapag sa exam guys, tandaan mo palagi, ang rhythm, kapag regular, ang tawag doon rhythmic. Kapag irregular class, ang tawag doon dysrhythmic. Tama? Kaya arrhythmic or dysrhythmic class, again, they are just the same. Tama? Ventricular again, arrhythmia or dysrhythmia, sabi ko, they are just only the same. Tama? Okay, they are only kasi dito the same. Tama? Okay, good. Therefore, class again, balikan po natin ngayon. Here we go. Now, arrhythmia, siya again, ang most life-threatening complication class, again, of your most life-threatening. Kasi this is the most, again, most life-threatening. Ito pinakadelikado. Dito po namamatay yung pasyente with your, the most life-threatening. The most life-threatening kasi complication kasi of your MI is and siya of your ventricular class again arrhythmia. Most life-threatening complication. Tama? Okay, good. Therefore, next case, the most life-threatening is your arrhythmia. Happy seen guys, your tingnan. Kapag ang kakilala mo nagkaroon ng MI guys, tayo nga nabuti kasi yung recall, what is the most unstable? Ito class again pinakadelikado. The most unstable again time again after the attack. The most unstable bantayan mo is the first 6 to 8 hours. Napakadelikado niyan. First 6 to 8 hours is the most unstable class in the case of MI. Tama? The first 6 to 8 hours bantay mo, this is the most unstable. First 6 to 8 hours. Kasi anytime, pwede siya magka-chest pain, pwede siya kasi magkaroon siya ng again cardiac arrest. Tama ba? Yes. While the safest. Exam kasi ang safest. Sabi, yung tipong pagkaibatay ng pasyente, masabi mo na ako, okay na, pwede ka lang makatulog kasi medyo stable na siya, The most stable is, ang sagot sa exam kailan daw? Ang sagot is kailan siya? Next class, it must be after 24 hours. After 24 hours. After 24 hours class, therefore, now that is the safest. Kasi guys, ang pasyente medyo okay na po ang rhythm. Tama? Class in after 24 hours or within 24 to 48 hours, that is the most safest. Okay, stay tuned ha? Okay, sabi ko bago lang guys, sources, standard class, USR, and here we go. Guys, kapag sa exam kanina, class, the most unstable is the first 68 hours. Huwag ka muna matulog dito. Tama ba? Okay, kasi class, bantay mo yung pasyente mo. Kapag the most stable is after 24 hours. That means, kung ikaw duty sa ICU, or sa emergency room, or sa ikaw yung again ang private duty nurse ng pasyente, pag first 68 hours, bantayan po mabuti. Anytime, pwede po siya ma-arrest. Tama ba? Para yung pasyente guys, all throughout. Okay, sige na bisina, lagyan ng pasyente. Okay siya kanina, kausap niya lang yung family niya, tama? Ang family niya. Tapos kalagitnaan, tas gulat ka lang class sa chest pain. Yun pala, nako, ang pasyente kas na muwersa siya. Kasi bakit? Nako, 3 days pa lang hindi makalabas sa kanyang stool. Nako, pinilit niya, nako, automatic nurses nagka-chest pain. That's why guys, bantayan mo po yan ha. Kung pwede lang last, wag sila class mag-strain, magbalsalba. Kasi guys, napakadelikado yan kapag nagkaroon ka ng MI. Tama? Okay, good. Here we go. Now, class, ano class. Kapag siya po again habisin kay sources, again ang most likely question. Anong arrhythmia ang most common cause of death? Sino pong ventricular arrhythmia yan? Ang sagot sa NCLEX is PVC. You have your PVC. Reference kayo your PVC. Guys, can you sure what is your PVC? PVC guys, hindi po tubo. Kasi marami sa bahay yan. Ayusin mo. Hindi po tubo na dyan ang tubig mo. Ha? Pambihira guys. Again, oh. Now, you have to know what is your PVC. Ha? Pambihira kasi na PVC. Marami sa bahay nyo. Ayusin nyo. Ha? Tingnan. Kasi na, sabi ko kasi pag PVC class again, sabi mo kasi tingnan, dahil tubig ako magtobero ka na lang ha. Class again, tingnan ha. Okay, nag-interest ka pa, sayang ha. Class again, tingnan. Okay, PVC stands for your premature ventricular contraction. Tama? Premature ventricular contraction is your PVC. Tama? Okay, class. Represent premature ventricular contraction class premature ventricular contraction. Guys, again, premature ventricular contraction. Tama? Okay, class, recall. Premature ventricular contraction or premature ventricular beats. Tama? Okay, therefore, class, ito yung tinanagyan recall. Now, at alam mo ba, guys, nurses, tingnan. Kapag siyang PVC, ang PVC, guys, nurses, this is the #1 cause of death in MI. Sa lahat kasi recall, class, ito ang kumikitil ng buhay sa pasyente na may MI. Kaya sabi nga sa exam, this is the #1 cause of death. Kaya sa US, guys, #1 cause, again, #1 cause of death. Again, #1 cause, what cause of your death? Again, cause again of your death in MI class, again, cause again of your death in MI class, therefore, is walang iba your PVC, premature ventricular class again contraction. This is the #1 cause of death in MI is your premature class ventricular contraction, defined as what is your PVC, premature ventricular contraction. Tama ba? Okay, good. Case sources, galingan po natin. Here we go. Now, kapag siya na-focus your PVC kasi ko premature ventricular contraction, guys, how is PVC being described? Kasi guys, tingnan mo mabuti kasi guys, sa NCLEX mo may drawing. Kapag nag-NLE ka, okay lang po, hindi mo kapis. Pag NCLEX ka, napaka-significant, kaysa dapat makita mo, again, maintindihan mo kung anong lalabas sa monitor mo kapag may drawing niya. Look at this one, guys. Tingnan. Class, in a case class kayo balikan, class, is this the normal ECG? Yes or no? Normal ba ito? Yes or no? Yes, normal ito. Tama? Normal po ang ECG ito. Class, normal. Bakit so normal? Look at this one. Class, normal. Bakit normal? Tingnan mo. My P, yes or no? Yes. My P, my Q, my R, my S, my T. Tama? Kompleto yan. Kapag ang isang waves nurses, again, dito ngayon, all waves are present at yung sinus rhythm. Pag sinus, all waves are present. Kaya pag all waves are present, tapos mababa ang heart rate. Example, always, my P, my Q, my R, my S, my T, tapos ang heartbeat mo is only 56, ang tawag sa class sinus bradycardia. Kasi all waves are present, pero mababa ang heart rate mo. Tama yes, ano? Yes. Okay. Forecast, this is your normal rate. This is your normal, again, ECG. Tama? Okay, here we go. Now, kapag yung normal kaskin, how is PVC being described? Class sa NCLEX, guys, kapag right plus wrong, PVC is described in 3 ways. Tatlo yan. Pahinga na buti, guys. Tatlo yan. How is PVC described? Number one, the PVC, it contains no P waves. It contains no P waves. Pakinggan, it contains no P waves. Saba? O it contains no waves. And take look at number 2, class 2, nagkaroon ka premature class, premature what? Bizarre QRS. Bizarre class, bizarre QRS. Na therefore class, balikan, ibig sabihin guys, QRS. Look at this one. Ito ang naman gina-ECG. Now, ECG na PVC guys. So PVC mo guys kanina, it contains no P waves. So makita mo walang P waves, class, this is your QRS. Now, this is again reference your PVC. After P again, class again QRS, then that is your again T. Next, the forecast can class again QRS. Next, the forecast is your T. The forecast, this is your normal class easy there for this is now you have your PVC. You have your PVC, tama? Okay, this is defining the short PVC, tama? Okay, guys, you have your PVC. Ito yung normal, tama? Okay, now. Happy din guys, ito yung normal kasi guys sa ECG, tama? Ito yung normal again. Have you seen this one? Ang normal, PQRST, always a present. Ang PVC guys, ganito yan. Again, guys, ito guys, again, ang PVC guys, kunin ka natin. Ang PVC ito yan, guys, agad-agad QRS, din, karo yan. T yan agad. Next, again, QRS, next of your T. Happens guys, next gonna be skin QRS, next of your T. Kaya nag-duty ka sa hospital, kapag first time mag-duty, sa doktor mo, Dok, ang hirap naman yan, Dok. Paano malaman, match ka sa doktor, ha? Pag may nakita kang gumuhit, tawagin mo ako, ha? Bakit? PVC yan. This is your PVC. Ang malaking guhit yan, guys, PVC po ang tawag natin. Yes, ano? Yes, tama? Okay, PVC po ang tawag natin. Tama? Guys, alam mo, PVC, hindi naman ito lumalabas, guys, in a case by MI. Kami minsan kapag may fever ka, tumataas ang temperature mo, nagka-septicemia ka, lumalabas po ito, ang PVC natin, guys. Again, now, class, kapag nakita mo, guys, forecast this, your PVC premature ventricular contraction, dapat, guys, alam mo to ang class again ng PVC. Here we go. Now, describe PVC, guys, entryways. PVC, therefore, last describe your PVC, class. How we know na siya, again, ay PVC? Number one, PVC, class. Una, class, PVC. Ang pag-go refers for PVC, premature ventricular contraction. Una, anong first characteristic? It contains no P-waves. Contains no P-waves. Contains no P-waves. Contains no P-waves. Saba? O kasi sabi ko, it contains no P-waves. Saba? Okay, number two, classify again as what? Number two, classify is your bizarre. Kasi in bizarre, QRS. So siya bizarre, kasi bizarre, QRS, guys, can bizarre, QRS. Now, ano ba bizarre, guys? Bizarre? Bizarre kakaiba. Wala siyang katulad. Parang ikaw lang, nurses, kung bakit nurses nagustuhan ka ng boyfriend mo. Kasi ibig sabihin, ano ka? Bizarre. Kakaiba ka. Wala kang katulad. Kasi ang boyfriend mo, kasi tingnan ha, wala man sa'yo ang lahat. Ako sa tuwina. Di ka man yung tipong nakakausap sa TV o radyo. Ang sinisigaw ng puso, ika'y mahal ko. Bakit ano ka? Bizarre, tama? Ang mundo ko ay puno ng saya. This is your bizarre, tama? Kaya forecast, kakaiba ka. Kaya hindi ka ba nagtataka kung bakit, guys, kasi nga, minsan may sobrang maganda, bakit pangit ang jowa? Kasi guys, tana palagi sa buhay, sabi na ng boyfriend niya, bakit ang pangit-pangit yan? Bakit nagustuhan mo? Ang isagot niya sa'yo, borrow my eyes and you can see the beauty of my wife. Tama? Bakit? Again, sayo na pa. Kasi guys, may nakikita siya, nakakaiba. Ikaw lang po yan. Nabayasan, no? Yes, tama. Okay, tandaan po yan, guys, nurses, ha? Kaya ang ibig sabihin, guys, nga na. Okay, therefore, classing ngayon, you have your bizarre QRS. Tama? Okay, therefore, classing nga. Here we go. Now, class, ang tagon, bizarre. Ano ka, nurses, guys? Ano ka? Kakaiba. Ano ka, diba? Kakaiba ka, tama? Okay, therefore, classing, kakaiba, tama? Kapag in a case, again, so example, kapag ang babaeng maganda, tapos pangit yung boyfriend, anong ibig sabihin? Hindi yun kinulang, nakuha sa diskarte. Hindi. Nakuha sa diskarte. Ngayon, ibig sabihin, guys, nurses, kapag pogi ka at pangit yung jowa mo, anong ibig sabihin nun? Huwag sabihin no choice. No choice. Bakit ka na? Di ba palagi, guys, alam ko ang kasabihan ng palagi ng mga taga-ainap. Anong palagi ng ainap? Sabi ng ainap, narinig ko ito palagi. Huwag choosy kapag hindi ka naman. Yummy. Diba? Okay, guys, again. Dito ko lang narinig sa inyo yan. Diba? Okay, here we go. Dito, guys, again, tingnan. Tandaan po, guys, nurses, ha? Okay, paano, guys, kapag bata ka, matanda yung jowa? Ano ang ibig sabihin? Class. Ano ibig sabihin? Naku, syempre, guys, ano yun, ha? Okay, si Tito, class, again, ang susi sa tagumpay. Hindi, guys, again, yan. Okay, class, again, here we go. Dito, guys, again, bizarre. Plus, nurses, guys, nurses, mayroon kang widening of your QRS. Kaya ang tatlo na ito, guys, maawa ka, isagot mo ito. Ito ang characteristic of your PVC. Ano yun? Plus, contains the waves, bizarre QRS, and widening of your QRS. These are the three main characteristics of PVC. Guys, sandaan yan kapag sa exam, guys, andyan class, ang tatlo na ito, isagot mo yan kapag in a case right mo na wrong. These are the three characteristics when the patient develops PVC. Contains the waves. Number two, class can recall. Number two, good. Again, class can recall, class, you have your bizarre and widening of your QRS. Tama? Okay, good. The four class nurses, guys, tingnan, here we go. Guys, kapag nakita mo ang PVC, guys, sa exam, again, nakita mo kasi ang PVC, are you supposed to, tas bibilangin ko ba ito? Yes, ano? Yes, bibilangin ko. Kapag in the case, lumitaw yan, have you seen kasi lumabas yung PVC? Tingnan lumabas ang PVC. Guys, kasi yung PVC, guys, automatic case dati. Ako nag-duty dyan kasi sa ICU, guys. Kapag nakita ko nagaragad ka sa i-freeze mo again ang cardiac monitor. Class, bakit bantayan mo? Bibilangin mo. Kasi paglabas yun ng PBC class, class are supposed to count. Yes and no? Yes. Kapag labas doon, class ng PBC, nasa yung PBC mo, class in one form class, bibilangin mo ng PBC. Kapag labas yan, class in one form class, ibig sabihin, kapag once makita ka at least ilan, 6 to 8 PBCs per minute. Ilan daw at least ilan? 6 to 8. There's 6 to 8 PBCs per minute. 6 to 8. Tama? Okay, 6 to 8 again PBC per minute. Ibig sabihin guys, bibilangin mo to class nurses ha. Sir, nakita na at least ilan siya guys. Again, 6 to 8. 6 to 8 plus 6 to 8 PBC. Again, 6 again PBC again per minute. In one fluent class, again, mag-appear itong 6 to 8 PBC again per minute. Tapos, bantayan mo yun, sir. Paano pag sa exam ko, sir, walang nakalagay na 6 to 8, hanapin mo ang word na trigeminal. Ano siya, trigeminal? Sa terms what is short? Trigeminal. Kasi for second to trigeminal. Kasi trigeminal. Kasi trigeminal lagi na PBC. Trigeminal lagi na PBC. Tama ba? Trigeminal. Sir, ano bang trigeminal na PBC? Ito yun. Guys, ito yun. Look at the PBC sa taas. Habis this one. Class normal. Tama ba? Ngayon, may labas sa isa. First PBC. Tama? Ikalawa, class may labas sa second PBC. The second PBC, this is second PBC. Last, ito is the last in PBC. Just the third PBC. Ibig sabihin guys, sources, kapag 3 PBC in a row, class ganyan, bago, normal, ang tagdoon, trigeminal. Pag dalawahan, trigeminal. Pag tatluhan, trigeminal. Pag apatan, quadrigeminal. Ibig sabihin, kung may lumabas na tatlo, 1, 2, 3, bago mag-normal, tagdoon trigeminal. Sir, class, nakita 6 to 8 class or trigeminal class, it is categorized as reportable. It should be reported. Ha? Hindi pwedeng mamaya mo lang kasi hindi i-refer kasi takot kayo, Dok, baka mapagalitan ka naman. Tama ba yes or no? Yes. Yeah? Then again, record, it is siya reportable. It should be reportable class. Again, tingin na, reportable class. Dapat i-report mo to. It is categorized siya as reportable. Yan ang siya reportable. You should report, guys, nurses. Ang siya reportable. Napakadelikado. Ha? Sir, tingin mo, so bakit delikado? Tingin mo naman, may trigeminal ka, may tatluhan. Paano pa may lumabas pa? Business, ngayon, lumabas pa. Tingnan ba? Okay, kasi, tingnan, business one guys, sources, sige ngayon, may tatlo pa ngayon. Sabihin, bago mag-normal, ngayon. I-connect mo ka lahat, ilang PBC na yan? Automaticas, 6 na yan. Tama? 6 na. Bakit? Ito yung una tatlo, ikalawakas, 6 na lahat na PBC yan. Delikado po yan. It is siya reportable. Yes or no? Yes. Ito na as sure, reportable. Tama ba? Okay, question. Class Ken. In a case of PBC, therefore, bakit does i-report from PBC? Guys, question, what is the complication when a patient develops PBC? What is the complication, guys? USR answer? Ano po again ang complication? Bakit, guys, i-report ko to? Kasi sabi sa exam, if PBC left untreated, what is the complication? Is complication of your PBC, ha? Complication of your PBC. Sa team live po natin, guys, yourself. So, hopefully, guys, andyan po yung matagal live po natin. Okay, class niya. If left untreated, anong complication? Look at this one. Sa baba, kasi we go. Ito yung normal, PQRST. Tama? Okay, here we go. Class, ito class, normal po yan. Ito ganyan na, siya, normal. Tama? Okay, may labas sa PBC. Guys, yung PBC class, first PBC, okay. Okay, let's see your PBC class can be SAR, QRS. Tama? Okay, class class can QRS. Sabihin guys, tatlo na. Tama ba? Okay. Guys, nurses, ano ang tawag mo dito kanina? Siya ba, again, ay PBC? Ano? Yes, PBC ito. Tama? PBC. Ngayon, guys, sir, bigay ko sa kabila guys, sabi ko siya ang iyong PBC. Ito lang, because short PBC. Ngayon, sir, delikado to. Pag left untreated, guys, ano mangyari guys, sir, sa USR yan? Pag hindi mo po ito class again, na-report. Complication class kayo na, kaya naman, plus in complication class, complication on, complication on, word complication, sir, VTAC. Kung dito get your VTAC, complication, represent your VTAC. That could be again your VTAC. Kaya dapat i-report mo anong complication guys ang tawag niya your VTAC. Your VTAC. Represent your VTAC. VTAC. Complication to gito your VTAC. Okay, third verse again your VTAC sa Ilonggo, hindi bitok ha. Again, VTAC. Bitok. VTAC ha. Bitukon ka nga bata ha. Okay, kasi yan VTAC. Ventricular tachycardia, ventricular tachycardia. Ventricular tachycardia. This is ventricular tachycardia. We have your VTAC. Tama? VTAC and ventricular tachycardia. Tama? Okay, good. Therefore, kasi, sir, din ka na bang VTAC? Yes. Isa, bakit delikado? Bakit? Gusto mong malaman ng karugtong nun? Okay, bakit? Ano sunod nun? Class VTAC next. Again, class. Again, next. Time of death. 8:30. Wala pong titingin pa. Okay, class, takpan na po natin. Sige, yan ang mangyari sa pasyente mo. May babalutin ka. Tama po, Sharon ka naman. May babalutin ka. Tama ba? Bakit guys stresses ha? Okay, pare. Okay, kasi may babalutin ka. Tama? Okay, kasi class again, diap your class again, complication of your vita pa ba? Okay, complication guys again, vita. Kaya sabi ko, may babalutin ka. Tama? Okay, class again now. Here we go. Okay, therefore kasi ganyan, here we go. Kasi ano bang PVC? Ang PVC is described as, ano siya? Bizarre. Di ba? Ano siya? Bizarre QRS. Ang vita kasi is described as wide. Wide and bizarre. Wide plus wide and bizarre. Have you seen guys? Pag wide and bizarre, that's the first control plus P, that's the first control with wide and bizarre QRS. Therefore kasi wide and bizarre QRS. Now that is term again, assure, ano siya? Yup, your vita. Tanda na, ito po ang kanyang complication guys. Sa the complication ko dito, vita, ventricular tachycardia. O ngayon, guys, again, ventricular tachycardia. Tama? Okay, the complication is ventricular tachycardia. Tama? Okay, bakit may letter C yan? Okay, kasi letter C, wait lang guys, napatungan pala ng aking cellphone. Okay, class dito, this is the your class, again, you have your complication is the ventricular tachycardia. Good, again, focus, here we go ngayon, class, recall na, this is the complication class, again, of your kanina, you have your PVC. Guys, versus case, balikan. O ngayon, recall. Class, in the case kaya therefore kasi balik natin kaya recall na stand up. Now, in the case pag sa exam, what is the complication guys? Kaya nakasabi PVC, complication is vita. Pag left answer, could be again to vita. Pag saying what is bizarre? Pag bizarre QRS lang, bizarre. At pag bizarre, tawag na first your PVC. No wave, class can bizarre, widen. Pero pag wide in bizarre, class can pag wide in bizarre, ibig sabihin tawag na sa kanya, very good answer is ventricular tachycardia. Good. Question of the exam. Pakinggan na buti. Kapag ang PVC case was a first-line drug, the first-line drug for a PVC case, first-line drug for a patient with PVC, guys, was a first-line drug kapag ang pasyente nagkaroon ng PVC case, drug of choice kasi first-line drug. Okay, the first line, again, the first line of defense, again, ang Camp Big Falcon. Ano yan? The first-line drug, again, what for your PVC case versus class, again, first-line drug, for what for your PVC, again, for your PVC guys, anong gamot guys versus ang sagot sa exam class, ang sagot, it starts with letter L. Anong L? Very good. Lidocaine or xylocaine. Lidocaine or xylocaine. Guys, this is lidocaine or xylocaine. Just this essentially you have lidocaine. Lidocaine kasi lidocaine or xylocaine. Lidocaine or xylocaine. That's lidocaine organ or your this is your xylocaine. Lidocaine or xylocaine. Tama? The first drug is lidocaine or xylocaine. Tama? Okay, good. Therefore, kasi lidocaine or xylocaine. Tama? Okay, therefore, kasi recall again, lidocaine or xylocaine. Tama? Okay, this is the first line drug. So, we call lidocaine again or xylocaine. Tama? Okay, here we go. Kasi recall now. Kapag lidocaine or xylocaine, guys, naka-lidocaine drip ka, una kasi gagawin, you could give lidocaine bolus. Yung isang ampule, ubusin mo yan. Next, after class again, you could give again your lidocaine kasi naka-drip ka siya ng lidocaine, guys, versus again recall. Pero, alam mo guys, again recall, ang lidocaine kasi may side effect. Anong side effect class when you have your, again, kasi when you have your giving lidocaine? Lidocaine kasi guys, ano siya? It causes bradycardia. It decreases your heart rate class. It decreases your heart rate class. It decreases your heart rate. Tama? It causes bradycardia. It decreases your heart rate. Tama ba? Sir, bradycardic kapag nagbibigay ka ng lidocaine or xylocaine, it will causes your bradycardia. Tama ba? It will cause your bradycardia. Tama ba? Okay, good guys. Here we go. Now, kaya sabi ko, it causes your bradycardia. Question guys, the exam again, recall now. Example, ang pasyente, nagkaroon ka ng PVC guys. USR sa PVC. Pero, with lagay natin das 56 beats per minute. 56 beats again per minute. Guys, pwede bang ibigay si lidocaine? Are you a safe nurse? Pwede bang ibigay ang lidocaine or xylocaine? Pwede bang ibigay? Yes or no? Bibigay ba yes or no? O, bibigay ko ba o hindi? Bibigay ko ba o hindi? Papasa ka ba o hindi? Ang sagot tas, ibibigay ba yes? Ang sagot yes. Very good guys, hindi. Tama? Plus, bakit hindi? Kasi lalo lang siya mag-bradycardic. Tama ba? Okay, therefore, huwag mo siyang ibigay ha. Hindi pwede guys ha. Huwag mo siyang ibigay nurses sa atin ha. Nako sir, bakit kasi huwag mo siyang ibigay? Tama? Bakit? Tama po. Nakakadikte sa cardiac. Question. Guys, good. Tama po. Again, therefore kasi yan. Tama po yan. Lalapit po siya sa liwanag pag ganun. Tama? Okay. Let's get again. Therefore, as question glass. Therefore, here we go. Kapag siya class this is a first drug is lidocaine or xylocaine. Question, this is letter B. Letter B, lagyan natin na. Ngayon, ang pasyente, paano kapag nagkaroon siya ng PVC? Sir, may PVC, sir, PVC. PVC, sir, with bradycardia. PBC kasi yun, pero bradycardic ang pasyente kasi PBC bradycardia. Hindi pwede ang best friend mong lidocaine kasi lidocaine. Ano ang pwede ko ibigay? Sir, nag-visit pre the bradycardic, anong ibigay mo kasi bibigyan mo ng jacket? Hindi. Kasi what, bigyan mo ng answer? Word answer is atropine. Atropine sulfate. Huwag mabigyan ng jacket. Ha? Klase yan, atropine sulfate. Atropine. What is atropine? Ano bang atropine? What's atropine, guys? What is atropine? Ano bang atropine, guys? USRNs. What is atropine, guys? Atropine sulfate. Sino ba ang ating atropine sulfate USRNs? Ano yan? That is your anti. Anong anti, guys? Anti what? Anti? Very good. Cholinergic. Anti-cholinergic. Skid ako ang gagawin, guys. Anti-cholinergic. Now, what is anti-cholinergic, guys? Simpa or para? If you are an anti-cholinergic, are simpa or para? Ang sagot, ano ka? Very good, versus, guys. Ano yan? Answer is, pag cholinergic lang, para. Pero pag anti-cholinergic daw, it becomes simpa. It becomes simpa. Pag choric can recall, it becomes your simpa. It becomes your simpa. Tama? Simpa. Therefore, class, ibig sabihin, the atropine, it treats bradycardia, but ibig sabihin, class, it treats again class PBC, but does not cause bradycardia. This is what the atropine does. It will increase your heart rate. Ibig sabihin, guys, yan, kung last na exam question strategy, lahat ng bradycardic, bibigyan mo siya ng atropine. Kasi atropine is a chosen drug if the patient is having bradycardia. This is a drug of choice for bradycardia. Bigyan mo siya ng atropine sulfate. Kaya alam mo, guys, versus tingin ha, kapag ang the case again, kapag yung jowa mo, humihina na po ang tibok ng puso sa iyo, anong gagawin mo? Turukan mo ng atropine nurses para bumalik ang dating tamis. Tama ba? Okay, kaya turukan mo ng atropine. Tama na? Atropine sulfate. Tama? Okay, therefore kasi nga, okay, turukan mo ng atropine. Para in the case again, class, again, tingnan, class, in the case again, bumalik sa memory niya ang masayang alaala nyo. Muling ibalik ang tamis ng pag-ibig. Sayang naman ang ating nakaraan. Okay, nurses, guys, bigyan mo ng atropine, ha? Nurses, ha? Okay, class again, kapag sa bahay yung guys, kapag in the case mag-duty ka, kapag may sobrang atropine, nurses, alam mo mga staff nurse natin, guys, masap na maniwala ka. Lahat ng staff nurse may sariling pharmacy ito. May wala ka, guys, nurses. Bakit? Ang staff nurses, again, hanapin mo ang staff nurse natin. Class, kung in-case pag kino mo saan, class, again, ito ngayon, kapag nawawala, nurses, ang mga gamot nurses, andun lang po sa locker ng staff nurse. Na ba yes or no? Yes. Kapag nawala, again, class nurses, again, ito ngayon, class, again, nawala, again, ang sobrang ginagamit nyo na tape andun sa locker ng staff nurse. Kapag nawala ang bandage scissor, sa locker ng staff nurse. Kapag in a case class nurses, ang sobrang diazepam nasa locker din po ng staff nurse. Tama ba yes o no? Yes. Kasi in a case pagod sa duty nurses, kapag day off, anong ginagawa? Nurses, ayan nurses, class na ko pambihira. Kasi ganti, lumulunok ng diazepam para makatulog doon. Kaya tandaan, guys, ha, kanya-kasking kapag staff nurse ka, kanya-kanyang tago ng gamot. Tama? Paunahan na lang. Tama? Okay, kapag in a case kulang ka sa tulog, ano lang gagawin mo, ha? Class, mag-receive o mag-rebotril ka. Tama ba? Okay. Class, para pasarap ang tulog mo. Tama? Okay, therefore, class yan. Guys, magtago ka ng atropine. Tama? Magtago ka rin ng epinephrine. Ha? Bakit yung epinephrine mo is a sympathetic yan? Pag sympathetic, therefore, class nurses, class cardiac glycoside, sympathetic yan. Class, ibig sabihin, class glucose, parang siya sumisipa sa puso, bis, para tibig ang puso. Kapag may sobrang epinephrine, itago mo. Bakit itago mo? Nurses, kay later on, class, kapag day off mo, pag magsabong ka, iturok mo sa manok. Kapag tinurok mo sa manok, nako, maniwala ka, mananalo ka, nurses. Yung manok mo kahit wala ng ulo, nurses, pumapalo pa rin. Nasobra ng epinephrine. Nagina, epinephrine, ba? Sobra pa sa Thunderbird yan. Kapag tinurok ka mo ng epinephrine yung manok mo. Kasi kung wala ng pakpak, lumalaban pa, di ba? Naka-adrenaline rush yung manok mo, tama? Okay, just alam mo na kasi malapit ang sekreto. Kaya guys, huwag kang pumusta kapag nurse. Again, kapag nurse ang may-ari ng manok sa sabungan. Nako, class, tingin ha? Class, ang manok niya nakadroga. Tinuturo ka ng epinephrine, tama? Okay, sobra pa sa Thunderbird yan. Tama? Okay, here we go, class, get yan. Oh, now, question guys, nurses, tingnan. Here we go. Now, tingnan. Sir, paano pag walang lidocaine? Kapag walang lidocaine kasi hindi pwedeng walang sagot class ang NCLEX exam. If lidocaine is unavailable, what's the second line drug? The second line drug for PBC, guys, USRNs, ang sagot is walang iba, amiodarone. Amiodarone. This is a second line drug, amiodarone. Amiodarone. Second line drug is class amiodarone. Second line drug for your PBC. Say second line drug. The second line drug for the PBC, because for the PBC is, ang second for what for PBC again, for PBC is amiodarone. Guys, again, tingnan ha, is amiodarone. Guys, sa hospital na mag-duty ka, ang amiodarone, siya pa yung cordarone, diba? Kinaka-cordarone drip ka minsan with 2 ounces of cordarone. That is your amiodarone. Ha? A second line job for PBC is, you have your reference for amiodarone. That is your cordarone. Amiodarone po yan. Amiodarone. So that is your cordarone. Amiodarone. Okay, therefore, or you're fine against your cordarone. Yes, for sa Ronavir quadrum. Tama? Okay, therefore, classic Ronavir quadrum. Bakit kasi ganyan ano yun? Mga classic anti-arrhythmic drug. It treats ventricular arrhythmia. Anti-arrhythmic. It treats ventricular arrhythmia. Sabi ko, ventricular arrhythmia, ibig sabihin guys, guys, ang problem is ventricle. It treats ventricular arrhythmia. Ventricular skin arrhythmia. Kaya pag ang problem is ventricle, class bigyan mo ng amiodarone or cordarone. Tama? Class, it treats ventricular arrhythmia. Anti-arrhythmic drug. Tama? Okay, balikan. Guys, kanina, what's the most life-threatening complication? Saan ka mamatay? Due to your ventricular arrhythmia. Guys, very good class. Recall again, balikan. Anong arrhythmia is most commonly seen for a person with MI? Ang sagot is PBC. How describe PBC? Describe PBC in 3 ways. Sato yan. Anong una? Contains no P waves. Number 2, very good, beside QRS. Number 3, ano yan? There's a widening what of your QRS. Widening what of your QRS. Tama ba? Okay, guys. How many PBC should be reported? Ilang PBC should be reported? Ilan yon? Very good, 6 to 8. Pag walang 6 to 8, guys, sagot again, class again, sagot answer is, very good, kapag nagkaroon ka ng trigeminal na PBC. Therefore, in the case of PBC, guys, anong unang gamot na maiisip mo? The first line drug is, very good, first line drug is lidocaine or xylocaine. If lidocaine is unavailable, anong gamot? Bibigyan mo ng jacket. Hindi, bigyan mo ng answer is, very good, answer is amiodarone. Tama? Ngayon, class 1 hour after the patient develops bradycardia, then let's anticipate to prepare what drug? Kapag nagkaroon ng bradycardia, ang sagot is, good, bigyan mo ng answer, good, ano yan? Atropine sulfate. Tama? Oh, good. Second complication, guys. Tingnan, here we go. Now, what type of shock occurs in a case of MI? Anong shock yun? What shock, guys, occurs in a case of MI? Anong shock yun? Anong shock? Second complication answer is cardiogenic shock. As cardiogenic shock. Kapag na-shock si cardiodalisay, ang tawag doon, cardiogenic shock. As cardiogenic, as cardiogenic shock. As this is your cardiogenic shock. Mama? Okay, this is your cardiogenic shock. Anong shock, guys? Sige, last about the shock. What shock is due to massive blood loss? Massive blood loss. Ano yun? Massive blood loss. Anong shock yun? Due to massive blood loss. Ang sagot dito refers to very good nurses. Ano yun? Yes, magnificent nurses. Superior nurses. Ano ipamila? Hoy, mag-type kayo kasi mga hayop to. Hypovolemic shock. Due to allergy, guys. Allergy. Oh, this allergies. Pag allergies, ano yun? Very good anaphylactic shock. Anaphylactic shock ang tawag doon, ha? Okay, basta na anaphylactic shock. Anaphylactic shock. Tama ba? Okay, therefore class. Kapag due again class, due again to infection ng infection. Ang tawag doon, refers to your good. Ang sagot, refers to your septic shock. Yung septic shock. Tama ba? O ngayon, o ito, anong shock yun? Class, hinimatay ka. Bakit? Nag-decrease ang blood flow sa brain mo? Hinimatay ka due to extreme fear. Sobrang takot. Nang pumunta ka kasi kagising mo lang, nakita mo mukha mo sa salamin, hinimatay ka na makita mo mukha mo sa salamin. Ang tawag dito, class, refers again to your extreme fear. Takot ka sa mukha mo, hindi phobia. Ang tawag, neurogenic shock. Pag neurogenic, ang cause is due to extreme fear. Ha? Sobrang takot, hinimatay ka. Extreme fear is neurogenic shock. Tama? Okay, neurogenic shock. Tama? Okay, class ganito nga. May matao na pag sobrang natakot, again, hinimatay, neurogenic yan. Decrease blood flow to the brain. Kasi class, that is your extreme fear. Class, ito ngayon, again, now. Cardiac, kasi ganito ko, again, look at this one, guys, yourselves. Now, kapag ito kasi guys ang heart natin, kasi recall ang heart, what part of the heart kasi suffers the most damage in MI? What part of the heart suffers the most damage? Answer is good. Answer is your left ventricle. Answer is your left ventricle. Ang answer is your left ventricle. Tama ba? Left ventricle. This one, it suffers the most damage. Tama ba? Okay, good. Therefore, sabi ko this one, it suffers the most damage is the left ventricle. Tama ba? Okay, here we go. Now, kapag dito guys, nagkaroon na ng necrosis, anong MI yung kanya guys kapag both coronary artery, right and left, ano yun? Transmural. Kapag isa lang, subendocardial. Good. Guys, here we go. Kapag in a case class damage to, class, sabihin class sa exam damage to ang left ventricle natin. Anong rule again guys? Again, tandaan guys, ito yun. Kapag in a case again, kailan ito nangyayari? In a case again of the cardiac shock, this one guys, nurses, it occurs. It occurs if 40% of the left ventricle is damaged. Of course, if ilan siya? 40%. 40% of your left ventricle, left ventricle is damaged. Of course, if 40% of the left ventricle siya is damaged. Sama? Ibig sabihin ka, 40% na may necrosis, now, that could lead again to your cardiogenic shock. Of course, if 40% of the left ventricle is damaged, now that refers to your class of your class cardiogenic shock. Class cardiogenic shock. Of course, if 40% of the left ventricle is damaged. Here we go, guys, again, recall. Now, class, tingnan again. Now, ano po ang complication, guys, kapag na-damage again ang left ventricle? So, kanina class, ilang percent? 40% is damaged. Tama ba? Okay, here we go. Look at this one. Kapag damage guys stresses ang left ventricle, damage and therefore, what will happen, guys, again to your ventricular contraction? Increase or decrease? Ventricular contraction. Answer? Very good answer is decrease. Decrease in your ventricular contraction. Decrease in your ventricular. Decrease what in your ventricular contraction. Decrease what in your ventricular contraction. Decrease in your ventricular contraction. Now, you again to decrease again in your ventricular contraction. Tama, class? Decrease your ventricular contraction. Tama? Okay, here we go, kasi recall now, class. Okay, now. Kapag decrease in your ventricular contraction, guys, nurses, decrease. Now, kapag siya decrease, therefore casting decrease, therefore casting nga. Now, dito ngayon, decrease. Therefore casting nga. Here we go, casting decrease. Again na, class. Nga. Pag decrease, therefore, what will happen, guys, nurses? Again, decrease, contraction. Therefore, what will happen, guys? Again, decrease. Again, therefore casting nga ngayon, what will happen the heart rate? Answer, increase or decrease? Answer, decrease heart rate. Decrease what in your heart rate. Decrease contraction, guys, could lead to decrease what in your heart rate. Now, decrease heart rate, therefore, class again, thereby decreasing again, class decrease heart rate, class again, thereby decreases what? Decrease your cardiac output. Decreasing cardiac output, decrease again heart rate, decrease again recall, class, decrease cardiac rate again dito, decrease cardiac output, guys, therefore, class, thereby decreasing your blood pressure. Decreasing your blood pressure. Decrease ang output, syempre decrease ang blood flow, decrease again ang blood pressure. Tama? Kaya tawag sa kanya, kaya magiging what a short shock. Tama sa what a short shock. Tama? Oh, have you seen, guys? Pansinin mo ang typical na shock. Bakit? Anong rule? Lahat ng shock, ano ang signs of shock? Ang signs of shock refers to the hypo. Ang hypotachy. Again, very good. Pag shock refers to the hypo, we get hypo, again, hypo, we get hypo, taki-taki, rumba. Hypo, taki-taki, rumba. Therefore, this is the shock. Now, ang tanong sa exam, again, tandaan. Now, class, the cardiogenic shock. That's cardiogenic shock. Tama ba? Okay, class. The cardiac shock is the only shock that doesn't follow the hypo-taki-taki. Ayaw niya mag-rumba. Bakit, guys? Again, kasi ang cardiac shock na makita mo, hindi niya po pina-follow ito. The cardiac shock again, nakita mo, sa kanya, decrease heart rate, thereby decreasing blood pressure. Ibig sabihin, what shock does not follow the principle of hypo-taki-taki? Anong shock yun? Brainstorm? Very good, class. Ang sagot is, very good. Answer is A, cardiac shock. Letter B, regal shocker. Ang sagot is, very good, class. Answer is, regal shocker. Answer is cardiogenic shock. Cardiogenic shock. It doesn't follow the hypo-taki-taki. Tama? Okay, siya lang po ang hindi sumusunod ng hypo-taki-taki. It's the only shock, class. Again, sa kanya, decrease heart rate, decreasing blood pressure. Tama? Okay, question, guys. Galingan po natin, shock, rat, goal. Okay, therefore, class again, Okay, class again. Here we go. Dito, guys, yourselves, kung nakita mo, guys, USRS, again, look at this one. Pag decrease po cardiac output, that is decrease yung blood flow. Tama? Guys, anong effect? Pag decrease, guys, ang blood flow, guys, decrease in blood flow. Ngayon, pag decrease ang blood flow, therefore, ibig sabihin, guys, dito, magdi-decrease pang oxygen, yes, yes, look at this one. Ngayon, anong effect in a case of shock? Pag decrease blood flow, kasi decrease, therefore, kasi recall, ngayon, class, ibig sabihin, kaya pag decrease, guys, oxygen, ibig sabihin, maaari bang decrease oxygen in the brain, yes, kapag decrease oxygen class in the brain, ano ang mangyari kapag kulang ka ng oxygen sa brain? Magkaroon ka ng hypoxia. Special ba sa inyo your hypoxia? Classic in hypoxia. Decreased blood flow sa brain, magkaroon ka ng hypoxia. Tama, hypoxia. Tama ba? Okay, therefore, pag sa brain class, therefore, pag sa brain class, magkaroon ng very good hypoxia. Ngayon, class, kapag sa heart class, makulang ba ng oxygen? Yes. Kasi ang heart, kailangan niya ng oxygen class, therefore, nagkaroon ng ischemia. Nagkaroon ng ischemia. CR class will stop from your ischemia. Have you seen class? Vital organs, ang target po niya, mauna class na madami stop. Next, kapag in a case again, si lungs, kapag kulang ng oxygen class, recall, nagkaroon ka na ng dyspnea. Magkaroon ka na ng dyspnea. the patient will develop behavior dyspnea. Tama, behavior dyspnea. Plus, again, recalling yan, si kidney nurses, again, ang kidney stop, and again, your kidneys, again, kapag kulang ka na oxigenous ng blood flow sa kidney, therefore, classing yan, what will happen, class, can recall, could lead again to decreased blood flow, again, oligoria. Could lead again to oligoria. Kapansin mo, in a case of shock, guys, sources, hindi ka naman talaga mamatay because of shock. You will die because of multi-organ failure. Multi-organ failure. Kaya guys, ang doktor mo, usually guys, makita mo yan palagi kapag nag-duty ka sa hospital. Kapag yung doktor, hindi niya pa ma-roll out kung bakit namatay ang pasyente, ang nakalagay sa kanyang class again certificate, again death certificate, nakalagay na multi-organ failure. Yun lang po ang pinaka-safe again kasi na diagnosis kapag hindi mo pa na-diagnose. Multi-organ failure. Tama? Ganun po yun. Okay, question. Sige, therefore, let's try here. This one. Question. In a case of shock, question, again, plus the exam test. Galingan po natin ha? O, sige. In a case of shock, class, therefore, the cut-on bit choice is nothing class in a case of shock. Question. In a case of shock, nurses, sa shock, class, what organ suffers the most damage? A, brain. Again, one brain. Heart, again, class, lungs, or kidney. Plus, in a case of shock, class, get again, what organ class suffers the most damage? Sino po ang mag-suffer ng most damage kapag mag-shock? Again, ha? Okay, kapag kulang ng blood focus, which organ would suffers the most damage? 1, 2, 3, or 4. Sige guys, kayo pumili. Tingnan po natin, pumili din. Okay. In case of shock, what organ suffers the most damage? Answer is, okay, class ganers, are you sure? Sure na sure ka ba dyan? Nasa paglalaban, hanggang kamatayan. Okay, balikan. Answer is, okay guys, itandaan. Now, kapag shock guys, just about ang brain, kamay na heart, manalangin ha, kidneys, tas magabay na ka na, lungs, kasi makiramdam ka na, bakit nagkatong guys? Pag sinagot mo to, feeling mo, ilalabas ko na bang carpooling mo. Okay, here we go kasi tandaan again sa exam. Now, in a case of shock, class again, pag lahat ng parte ng katawan mo na ubusan ng blood flow, mag-meeting-meeting po ang mga vital organs na katawan mo. Tama? Mag-meeting-meeting din po sila. Tama? Guys, ang sabi ng katawan mo, alam kong kulang tayo lahat again ng oxygen. Ngayon, ang sabi ng katawan mo, para tumagal tayo, ano man mangyari, unahin mo, bigyan ng oxygen si unahin mo si brain. Bakit si brain? Kasi siya lang ang may utak. Tama? Wala tayong utak, kaya dapat kailangan ng utak para mabuhay tayo. Magkasikit yan. Oh. Ngayon, sabi ng brain again, hindi ako tatagal nurses kapag inakis ko tatagal, kapag maubos to, kaya dapat may tutulak. Dapat buhay si heart. Buhay si heart. Sino si heart? O sabi ng heart, alam mo walang kwenta to kung walang oxygen. Dapat may oxygen ito. O dapat buhay si lungs. Kapag nag-usap ko sa pangtatlo, sabi ng kidney, saglit lang. Bakit? Paano naman ako? Kasi yung kidney class ang ginawawa. Nagtingin na ng tatlo, nakatingin kay kidney. Tama? Friend. Pwede ba? Ikaw na lang magsakripisyo. Habisin guys, kapag in-a-case, nagkataon guys, nurses, kapag nagkataon class, at kapag nagkagipitan ng lahat nurses, the kidney would sacrifice. Tama? Sabi ng kidney, sige na nga, ako na ang magparaya. Tama? Kailangan niyang mamamatay para mabuhay. Kaya that's the reason guys, in the case of shock, sabi ko class sa shock, in the case of the shock class, in the case of the shock class, ang rule, the kidney suffers the most damage. Sa suffers the most, that means siya ang inalay. Tama ba? Okay, siya again ang inalay. Tama ba? Okay. The kidney class, in the case of shock, the kidney can suffers the most, that means suffers the most damage. Tama? Pag kidney, the case of shock, the kidney is the one that suffers again the most damage. Kidney is the one suffers the most damage. Tama? Si kidney po ang inalaya, suffers again the most damage. Tama? Okay, therefore class, habang inaalay si kidney, class again, class nakasabay yung kanta, habang may nakaputik, may nakalagay na, walang sino man ang mabubuhay para sa sarili lamang. Tayong lahat ay tinipon ng Diyos. Aba, nagtipon-tipon yung brain, yung heart, yung lungs, ang kidney, ang inalay. Okay, class, sige. Tama? Okay, tingnan na. Okay, therefore, class, si kidney ang nagsasuffer ng most damage. Ang kidney, class, gulong-gulo. Tama, sabi ng kidney, kung wala ka na naintindihan, kung wala ka na nalapitan, kapit lang sa akin. Yung kidney that suffer the most damage. Kaya the question guys of the exam again, tandaan, kaya anong complication na siya? Ang sagot sa NCLEX, renal failure. Renal failure. Ano ang complication class? If shock is left untreated guys, ano ang complication guys ng shock? That could lead into renal failure kasi renal failure. Tama? Okay class, complication is wala iba na yun. Very good. Renal failure kasi the kidney would suffer the most damage. Napansin nyo ba na kapag in-case ang pasyente, kapag yung BP mo 60-40, tama 60-40? O sige nga, o 60-40. Sige nga, again. O, may output ang pasyente, wala. Zero urine output, tama? Kaya kidney ang kawawa. Kapag kailangan ng iPhone, si kidney din ang binibinta. Pambihira, kasi goodbye kidney, hello iPhone. Si kidney na naman ang nagsakripisyo. Pambihira kasi. Okay, kasi okay, binta ang kidney, pambili ng iPhone, ha? Sabi ng kidney. Nagsimula sa bundong ito, magkasama tayo. Dahil sa iPhone, ha? Kasi pinagpalit mo ako, ha? Ang kidney pa rin ang nasakripisyo. Na ba? Okay. Complication is renal failure. Question again of exam. Now, anong gamot, guys? In the case when a patient develops cardiogenic shock, ha? Pambira. Kasi dalawa naman sila, ha? Abusado kayo. Inabuso yung kidney. Now, in the case of cardiac shock, kidney gone, what's the drug of choice? Drug of choice case says, have you seen? Bagsak ba ang heart rate? Yes. Bagsak ba ang BP? I need a drug para tumas ang heart rate, tumas ang BP. Anong gamot? Bigyan mo siya ng drug and aswat, adrenaline. And so, bigyan mo siya ng answer? Adrenaline. Drug choice is adrenaline, di ba? Ang adrenaline, siya ay sympathetic. Yes, kabigyan mo siya ng adrenaline. Kasi kabigyan mo siya ng adrenaline. Kasi guys, siyang sympathetic. Kaya guys, alam mo pag adrenaline, alam natin, what are the type again of your adrenaline? Tatlo po ang ating adrenaline. Ano bang tatlong adrenaline, guys? USRS na okay. Alam mo to, walang iba class syempre. Kapag natapos ang buhay ng kidney, ang tawag doon class, ano yan? End. Tama? End. Tama ba? Okay, therefore class, in the end, it does really matters. Tama? I've tried so hard. Tama ba? Okay, guys. This is your end. Tama? Anong end? Very good. Epinephrine siya. Epinephrine. Because again, I tried so hard and not so far. Is your end the end? Tama, is your end. Epinephrine. Because epinephrine. Because epinephrine. Because ano siya? Epinephrine. Tama. Okay, again. Pag may epinephrine, kasi number 2 kang nor. Epinephrine. Meron kang nor. Epinephrine. Kasi nor. Epinephrine. Epinephrine number 2. You have nor. Kasi nor. Epinephrine. Guys, sa hospital, kung duty ka, ang norepinephrine, siya po yung levofed. Di ba? Norepinephrine. Norepinephrine is your levofed. Tama? Levofed is your norepinephrine. Plus norepinephrine. Tama? Norepinephrine. Plus norepinephrine. Tama? Anong D? D stands for D. Anong D stands for D? Where the C stands for D of your D. Dopamine of your dopamine. Have you seen, guys? Kaya pa sa hospital, ang pasyente kapag naka-insert na kompleto na may epinephrine, may dobutamine, may levofed, ay naku kaskin, malamang nako ha, pagbutihan nyo ang pag-titrate nurses para hindi mo siya mabalot. Tama ba? Pagbutihan mo ang pag-titrate niya na. Kaskin dito ngayon. This is your class, this is a drug of choice. Tama? Okay, here we go. Guys, balikan natin guys. Tingnan na. Ngayon, ulitin ko. Drug of choice for angina ha. Angina. NNN. Nitroglycerin. Tama? Okay, nitroglycerin. Tama? Okay. Drug of choice for MI. MMM. Morphine sulfate. Drug of choice for PBC. Ang sagot? Lidocaine or xylocaine. Class, in the case of bradycardia, drug of choice for bradycardia, very good. Ang sagot is atropine. Atropine. If class again recall, lidocaine is unavailable, ang second line drug, ang sagot is very good of your amizarone. Drug of choice for again for cardiac shock, ang sagot is, walang iba, answer is, you have your class, ang sagot is, you have your class, ano yan? Class answer is adrenaline. Anong totoong adrenaline? Ano yun? N. Epinephrine, norepinephrine, dopamine, dopamine. At last, ganito class, ganito slow naman, again for the pulse, for the night, again, says, the last complication is, walang iba, class. Kapag hindi lahat ng dugo, guys, maitulak po ng iyong class, ng iyong heart. Pag hindi niya po maitulak yung class, guys, syempre, kasi backflow ba yan yung sino? Yes. Have you seen, guys, says, kapag nasira yung class, yan, ang left ventricle mo, pag hindi lahat class, maitulak niyan, backflow po yung dugo. Tama ba? Backflow. Saan siya babalik? Kasi babalik siya sa backflow. Babalik saan? At babalik ka rin. At babalik saan? Sa lungs. Tama ba? Anong complication? Congestive heart failure. Tama ba? CHF. Again, CHF. When you get your, anong third complication is your CHF. Anong CHF stands for your? Congestive heart failure. CHF. Anong CHF? Right-sided or left-sided? Guys, ay sagot mo is left-sided. Kasi guys, bumalik sa lungs, left-sided. Kasi yun yung left-sided. Kapag may CHF, therefore, ang pasyente, what heart sound will the nurse expect to hear? S1, S2, S3. Kapag may say siya ka, S1, S2, S3, ano yun? Very good class. You will hear the word class again. That is your S3 of your S3. Tama? Kapag S3 guys, nurses, anong sound ba kapag S3 guys? S3 nurses, anong heart sound? Ang mga S3 guys, ano yun? Therefore, anong heart sound yun? Siyempre, pag nabitin, kan sugot mo, bebe. Very good. Murmur. Ano yung bebe? Murmur. Ha? Class again pag monthsary, bebe. Murmur. Ha? Pag anniversary, bebe. Murmur. Class again, class next lang, bebe. Okay, class pag nabitin ka, bebe. Murmur. Ha? Okay, therefore, class again, ha? Okay, therefore, pag nabitin ka, sugot mo, bebe. Murmur. Next lang, bebe. Okay, therefore, you have your murmur. Okay, this is last of your heart sound. Tama? Okay, yun. Therefore, alam mo na ngayon, anong tatlong complication ng MI? Anong tatlong complication, guys? Anong tatlong complication ng MI? Therefore, nurses, anong complication? Anong tatlo class again? Ano yun? Number 1, una. Very good. Ventricular arrhythmia. Number 2. Ano yun? Very good class cardiac shock. And number 3, answer is congestive heart failure. Sa tatlo, anong pinakadelikado? The most life-threatening class among the 3. Ang sagot is, very good answer is ventricular arrhythmia. What arrhythmia is the most common cause of death sa MI? Anong arrhythmia? Answer is, ang sagot is PVC. Ano ang complication ng PVC? Ano yun? Very good. Ang sagot is answer. Very good answer is very good nurses class. Ano yun? Very good nurses. Wala na naman akong kausap. Ang sagot is beta. Beta. What is the complication of shock? Ang sagot. Complication of shock. Ang sagot is very good reference to renal failure. Kasi renal failure. Renal failure. Tama? Class, in a case, tandaan class answer, you have your renal failure. Tama ba? Okay, good. You can recall, guys. Balikan natin, guys. Bago mag-end ang klase kasi, guys, sa next time na bumalik tayo, alamin natin, class, again, recall, ano po again dito ngayon, ang zones of MI, at syempre, what priority would you deal for the person again with MI? Okay, balikan muna kasi recall, guys, 2 minutes to recap, bago mag-end ang topic again for the day. Class, ang sabi sa exam, what differentiates MI to angina? Onset, characteristic, duration. What differentiates? Onset, characteristic, duration. Answer. Duration of your duration. Very good case nurses. Again, recall question. The nurse is caring for Mr. Brown diagnosed with MI. The patient complains of chest pain. What is the cause of chest pain? And so myocardial ischemia or myocardial insufficiency. Tama. Third question. The doctor orders that the patient should be given oxygen. Bakit siya bibigyan ng oxygen? Answer. Last answer. To relieve ischemia. Diba it relieves chest pain. So what relieves chest pain? Morphine oxygen. Answer is oxygen. Kasi lahat ng muscle, it needs oxygen. Tama? What oxygen should be given? High or low? USR. Ang sagot? High. Ilang liters? Ibigay ilang liters? 6 to 8 liters per minute. Very good. Bakit high? Ang purpose is to saturate the ischemic myocardium. Very good question. Class, anong characteristic? How would you describe the chest pain? Ano yun? Very good. Chest tightness. Again, chest tightness. What is that universal sign? Ano yun? Ang sagot is very good Levite sign. Class, chest and clutching. Ha? Okay, because the person grabs his chest. Tama ba? Okay, guys. What angina is accompanied by predictable pain? Galingan. Predictable pain. Ano yun? Ang sagot is stable. The pain becomes unpredictable. Ano yun? Unstable. Good. Exposure to cold. Ang tawag doon. Again, ang tawag ito, Prince metal. Again, Prince metal. What angina is highly risk to develop again, class, or could lead again to MI? Ang sagot is, ano yun? Stable, unstable, or Prince metal? Answer is unstable. If you're unstable. Good, guys, gumagaling ka na ngayon, class. Here we go. Class, again, recall. Class, balikan, sabihin sa akin kanina, nurses, what is relieved by nitroglycerin? Am I angina? Relieved by nitroglycerin? Very good answer, angina. Relieved by morphine? Ano yun? MI. Guys, galingan natin. Drug of choice tayo. Drug of choice for angina. Angina, NNN. NTG. Nitroglycerin. Drug of choice for MI. MMM. Morphine sulfate. Drug of choice again for your PVC. PVC, anong gamot? Ang sagot is good. Lidocaine or xylocaine. What's the second line drug? Second line drug? Ang sagot is, ang sagot, amiodarone. Drug of choice for bradycardia. Bradycardia. Ang sagot is atropine sulfate. Good. Drug of choice for cardiogenic shock. Cardiogenic shock. Anong gamot? Ang sagot is, good. Ang sagot is adrenaline. Tama ba? Ang itong adrenaline, and anong N? Epinephrine. Norepinephrine, you have your dopamine. Tama? Okay, good. Nurses class, in a case of shock, what organ would suffer the most damage? Sino class ang magpaparaya? Guys, ang sagot is, very good answer is kidney. Okay, in the case of shock, what is the complication of shock? Binanggit ko to ng primary fluids and electrolytes. Ang sagot is, good. Complication is renal failure. Good. Again, guys, nurses, naintindihan pa ba tayo dyan, guys? Yes or no? Yes, nakakuha po ba guys versus? Yes, so pasa pa sa ating blood-brain barrier. Yes, ano? Yes, very good. Okay, so guys versus 2023. Handa ka na bang pumasa? Yes. Susunod ka na ba? Yes, ano? Yes, very good. Okay, so guys, sige versus. See you guys on succeeding schedules guys versus. Okay guys, tomorrow class 9. Wala mo tayong pasok tomorrow guys ha, kasi may nakita ako tomorrow Sunday. Okay guys, sige tomorrow. Guys, off po natin then. Class again, we're to see guys again sa Monday guys. Andiyan po sa schedules po natin. Okay? Guys, kapag wala kang ginagawa guys, yun, basahin niyo po yung notes natin. Kasi malapit na po na mag-exam guys, ang sarap sagutin po ng NCLEX nurses if you understand the question. Baunin niyo po ito guys nurses habang kayo papunta sa test taking area niyo. Bakit guys yan? I do believe guys, kayo po again ang magsasabi na mag-shutdown at question 85. Tama? Guys, salamat guys sa tiglag po natin nakaantabay. Thank you po. Sa dito po guys, kita po natin guys sa ating Zoom. Again, thank you very much again kay Ma'am Maris. Salamat po again Ma'am. Again Ma'am, thank you po again. Tingnan. Sir AJ, thank you po and all the rest guys. Again Ma'am Jamaica, class again Jawel. Ma'am, thank you po again Ma'am May. Ingat ka po Ma'am. Ayan. Ma'am Jan, thank you po again. And of course again Sir Jet. Okay guys, thank you. Okay, therefore this year Sir Hisoka signing off. Mr. DIY. Always low prices. Hindi. Nag-endorse. Guys, salamat. Thank you po. Again, see you guys. See you guys. You can see you po. Salamat. Thank you very much po. God bless po. Thank you. Okay, bye-bye po. Bye-bye. Okay, thank you. Bye.